will be virtual. Secondly, they provide that written statements and pre-recorded video statements may be submitted in advance on certain agenda items. They also provide a special process for considering credentials, and essentially this is to be done by the chairperson in advance of the meeting rather than the normal procedure, which is to convene a committee of credentials which would meet during the meeting. But that's not feasible given the short space of time in which this meeting is being held. Another key feature is that no voting by show of hands or secret ballot may take place. But of course, in practice, decisions of the regional committee are normally taken by consensus in any event, and we certainly hope that will continue to be the case. And finally, the special procedures permit the re-election of the chair of the 69th Regional Committee session as the chair of the 70th Regional Committee session. Thank you. So with that, please allow me to hand the floor back to the chairperson.
Y a-t-il des remarques ou des observations? S'il n'y en a pas, la décision numéro 2 est donc adoptée. Nous poursuivons nos travaux avec l'examen du point numéro 2 de l'ordre du jour intitulé « Élection du président, des vice-présidents et des rapporteurs ». Je donne à nouveau la parole au conseiller juridique pour des orientations sur la procédure à suivre. Monsieur le conseiller juridique.
According to Rule 10 of the Rules of Procedure of the Regional Committee, the committee shall elect its officers comprising of a chairperson and 2 vice chairpersons. We will start with the position of chairperson. In accordance with paragraph 9 of the special procedures that we have just adopted, Mrs. Jacqueline Lydia Mikolo, Minister of Health and of the Population, of Women's Promotion and of Integration of the Republic of Congo, is proposed for the position of chairperson. May I ask whether this proposal is acceptable? There being no comments or requests for the floor, Mrs. Jacqueline Lydia Mikolo is elected as chairperson of the 70th session of the Regional Committee for Africa. And I can hand the floor back to you, Madam Chairperson, in your capacity now as chairperson of the 70th Regional Committee.
Je vous remercie. Distingués délégués, je tiens avant toute chose à remercier les membres du comité régional de la confiance qu'ils m'ont témoignée en me réélisant en qualité de présidente du comité régional. C'est pour moi un insigne honneur d'assumer cette responsabilité et je tiens à vous assurer que je ferai de mon mieux pour diriger les travaux du comité régional de façon productive, avec efficacité et fermeté. Nous passons donc la parole à l'étape suivante du programme qui concerne l'élection des 2 vice-présidents du comité régional. Conformément à l'article 10 du règlement intérieur du comité régional, et en application de la résolution RC 54-R11 qui a consacré le regroupement des pays de la région africaine de l'OMS par bloc géographique, il a été proposé que les ministres de la Santé du Bénin et de l'Éthiopie assument ces postes. Y a-t-il des observations par rapport à la proposition que les ministres de la Santé du Bénin et de l'Éthiopie occupent les 2 postes de vice-président du comité régional? Je ne vois pas d'observation. Le professeur Benjamin Oupkotin et le docteur Lia Tadesse, représentant le Bénin et l'Éthiopie, respectivement, sont ainsi élus vice-présidents de la 70e session du comité régional. Je vous remercie. En application de l'article 13 du règlement intérieur, nous allons maintenant déterminer par tirage au sort l'ordre selon lequel les deux vice-présidents seront appelés à exercer la présidence au cas où la présidente ne serait pas en mesure d'aller jusqu'au terme de son mandat. Distingués délégués, à l'issue du tirage au sort, il ressort que le professeur Benjamin Oupatin, ministre de la Santé du Bénin, occupera le poste de premier vice-président du comité régional et que le docteur Lia Tadesse, ministre de la Santé de l'Éthiopie, occupera le poste de deuxième vice-président du comité. Je vous remercie. Nous passons donc immédiatement à l'élection des trois rapporteurs. Conformément à l'article 15 du règlement intérieur du comité régional, nous devons élire trois rapporteurs à raison d'un rapporteur pour chacune des trois langues de travail. Les trois propositions suivantes sont soumises. Le docteur Jane Ruth Acheng, ministre ougandaise de la Santé, en qualité de rapporteur pour la langue anglaise. Le docteur Idi Iliassou Massara, ministre nigérien de la Santé publique, en qualité de rapporteur pour la langue française. Le docteur Sylvia Paula Valentin Lutukuta, ministre anglaise de la Santé, en qualité de rapporteur pour la langue portugaise. Y a-t-il des observations concernant les propositions formulées? Je n'en vois pas. Par conséquent, la docteure Acheng, le docteur Maïna Sarah et la docteure Lutukuta sont élus rapporteurs de la 70e session du comité régional. Je vous remercie. Nous pouvons donc sereinement passer au point 3 de l'ordre du jour qui traite de l'adoption de l'ordre du jour provisoire, de l'ordre du jour provisoire réduit du programme de travail provisoire. Adoption donc de l'ordre du jour. Nous commençons par l'ordre du jour provisoire qui nous est proposé pour adoption. C'est l'ordre du jour qui fait l'objet du document RC 70-1 établi conformément à l'article 7 du règlement intérieur du comité régional. Y a-t-il des remarques ou des observations? S'il n'y a pas d'observation, l'ordre du jour est adopté. Adoption de l'ordre du jour réduit. Nous passons à présent à l'adoption de l'ordre du jour réduit prévu pour cette session virtuelle comme indiqué dans le document RC 70-1 addendum numéro 2. Y a-t-il des remarques et des observations par rapport à l'ordre du jour réduit? Je ne vois pas d'observation. L'ordre du jour réduit est adopté. Adoption du programme de travail. Mesdames et messieurs, nous examinons à présent le programme de travail proposé pour la présente session. Veuillez vous référer au document RC 70-1 addendum numéro 1. J'aimerais suggérer que nous limitions le temps de parole à un maximum de 2 minutes par intervenant. Je n'hésiterai pas donc à interrompre les délégués dont les interventions se poursuivent au-delà de ce temps. Les délégués sont priés de se référer au compte à rebours qui s'affiche au coin de leur écran. Pour des contraintes de temps, les déclarations des acteurs non étatiques ne seront autorisées que sous forme écrite lors de la présente session. Les interventions des acteurs non étatiques seront postées sur le site web du comité régional. Y a-t-il des remarques, des observations? Je ne vois pas d'objection, donc il en est ainsi décidé. Nous allons passer au rapport sur la vérification des pouvoirs. Distingués délégués, nous poursuivons donc nos travaux avec le rapport sur la vérification des pouvoirs. Conformément au paragraphe 12 des procédures spéciales régissant la conduite des séances virtuelles de la session du comité régional, les noms des représentants, y compris tous les suppléants, les conseillers et les secrétaires, devaient être communiqués par voie électronique à la directrice régionale et prendre la forme de pouvoir lorsqu'ils étaient établis soit par un chef d'État, soit par un ministre des Affaires étrangères, soit par un ministre de la Santé, soit encore par une autre autorité appropriée. Conformément au paragraphe 13 des procédures spéciales régissant la conduite de la présente session virtuelle, j'ai déterminé, en ma qualité de présidente de la 69e session du comité régional, si les pouvoirs présentés par la 70e session du comité régional étaient conformes aux prescriptions du règlement intérieur. Au terme de mon évaluation, j'ai le plaisir de vous informer que j'ai jugé conforme aux dispositions de l'article 3 du règlement intérieur du comité régional de l'Afrique les pouvoirs présentés par les 47 États membres de la région africaine, à savoir l'Afrique du Sud, l'Algérie, l'Angola, le Bénin, le Botswana, le Burkina Faso, le Burundi, le Cap-Vert, le Cameroun, les Comores, le Congo, la Côte d'Ivoire, l'Érythrée, l'États-Unis, l'Éthiopie, le Gabon, la Gambie, le Ghana, la Guinée-Bissau, Guinée équatoriale, le Kenya, le Lesotho, la Namibie, le Libéria, le Madagascar, Malawi, Mali, les îles Maurice, Mauritanie, Mozambique, Namibie, Niger, Nigeria, Ouganda, la République centrafricaine, la République démocratique du Congo, la République unie de Tanzanie, le Rwanda, Sao Tomé et Principe, le Sénégal, les Seychelles, Sierra Leone, le Soudan du Sud, le Tchad, le Togo, la Zambie et le Zimbabwe. S'agissant de la participation du Mali à cette session virtuelle, je tiens à porter à l'attention du comité régional que le secrétariat a reçu le 20 août 2020 des pouvoirs signés par le secrétaire général du ministère des Affaires étrangères et de la coopération internationale, désignant une délégation de 5 fonctionnaires techniques du ministère de la Santé et des Affaires sociales et de 2 fonctionnaires de la mission permanente du Mali à Genève pour participer à la présente session virtuelle. Concernant la participation de la Guinée-Bissau, nous venons juste de recevoir des pouvoirs datés du 24 août 2020 signés par le ministre de la Santé publique au vu de l'évolution récente de la situation en Guinée-Bissau et notamment du dernier rapport du secrétaire général des Nations Unies en la matière. Je recommande au comité régional d'accepter ces pouvoirs. En conclusion, et sur la base de l'évaluation que je viens de vous présenter, je voudrais proposer que nous reconnaissions la validité des pouvoirs présentés par les 47 États membres de la région africaine pour participer à la présente session virtuelle. Y a-t-il des observations? Je n'en vois pas. On est donc ainsi décidé. Je voudrais donc passer la parole à mon cher ami et frère, le ministre de la Santé du Bénin, vice-président de la 70e session du Comité régional pour l'Afrique, de cette session virtuelle, pour poursuivre avec le point 6 de l'ordre du jour.
Merci, Madame la Présidente et chers amis. Monsieur le directeur général de l'OMS, Madame la directrice régionale, Mesdames et Messieurs les ministres, chers délégués, je vous remercie déjà pour la confiance faite à mon endroit pour être le vice-président de cette session du comité régional. Nous allons aborder donc le point 6 de l'ordre du jour intitulé « Intervention du président du sous-comité du programme » qui figure dans le document RC 70/3. Je passe la parole au docteur Gibson Mlanga du Zimbabwe en sa qualité de président du sous-comité du programme. Docteur Mlanga, à vous.
Thank you very much, Vice Chair, and all protocols observed. The Program Subcommittee held a virtual meeting from 25 to 26 June 2020, where 9 documents on public health matters of regional concern and 1 document on procedural matters were reviewed and recommended for adoption by the 70th session of the Regional Committee for Africa. I will briefly highlight the key issues from each of the documents. Please note that the complete statement of the chairperson of the PSC is contained in document AFR/RC 70/3 on tactical and health matters. The PSC discussed the document entitled Fifth Progress Report on the Implementation of the Transformation Agenda of the World Health Organization Secretariat in the African Region, 2015 to 2020. Members applauded the implementation of the Transformation Agenda, especially the mentorship program. They recalled the recommendation by member states during the 69th Regional Committee that WHO should extend the pathway to leadership for health transformation program to countries and requested that this be included in the next steps. We also reviewed the document entitled Strengthening Country Presence to Deliver Universal Health Coverage in Africa. Universal health coverage provides the platform for achieving the WHO triple billion targets and health-related sustainable development goals. The members underscored the need to align WHO's response to the needs of member states to ensure a stronger presence at country level. Upon reviewing the document entitled Certification of Wild Polio Virus Eradication in the African Region and Sustaining the Gains Post-Certification, the PSC members identified vaccine logistics as an important challenge, especially in countries with security compromised areas or hard to reach districts with poor infrastructure. Members noted that innovative practices, including drone technology to deliver vaccines to remote communities, should be promoted. With regards to the document entitled Ensuring Implementation of National Polio Transition Plans in the African Region, the members stressed the need to integrate all aspects of strengthening routine immunization in the national polio transition plans and to prioritize post-polio certification activities for resource allocation. Pertaining to the document entitled Quality, Equity and Dignity in Health Services Delivery in the WHO African Region, Bridging the Quality Gap to Accelerate Progress Towards Achieving the SDG Targets for Maternal newborn, and child health. The PSC acknowledged the high burden of maternal and neonatal mortality in the African region and highlighted areas that need to be urgently addressed. These include low coverage of emergency obstetrics and neonatal care and the inadequate allocation of resources for maternal and newborn health. We also considered the document entitled Framework for the Implementation of the Global Action Plan on Physical Activity, 2018 to 2030 in the WHO African region. Members highlighted the importance of the document in the context of the epidemiological transition and noted that only a limited number of countries are implementing appropriate policies. The PSC reviewed the document entitled Strategy for Scaling Up Health Innovations in the WHO African region. Members noted that accelerating innovations is critical to scaling up health interventions, particularly among hard-to-reach and marginalized population groups. Concerning the document entitled Status of Human Organ and Tissue Donation and Transplantation, or TDT, in the WHO African region, members observed that compared to other regions, the situation of OTDT in the African region is critical, given that available data is inadequate to determine the true need for transplant services. We also discussed the report on the performance of health systems in the WHO African region. Members recommended that member states substantially improve government investment in health systems, especially at primary health care and community level, to ensure that the health needs of the population are addressed even during emergencies. The PSC also considered the document on the proposals for the designation of member states on committees that require representation from the African region. The chairperson of the regional committee will go into detail into each of the proposed decision points, which the PSC recommended for adoption. Finally, the PSC recommended the resolution on the written silence procedure, which will allow the RRC to adopt, without further discussion, the reports recommended by the PSC, as well as any additional documents recommended by the regional director in consultation with the regional committee chair. The regional committee chair will present the resolution on the written silence procedure for your considerations. In conclusion, I wish to express appreciation to all the PSC members for their wonderful work and thank the Secretariat for their support. Thank you, Chair, and over to you.
Monsieur le vice-président, c'est à vous de prendre le relais. Vous avez la parole.
Oui.
En attendant le retour du vice-président, je vérifie donc s'il n'y a pas d'observation concernant ce rapport. Je n'en vois pas. Donc, j'estime que le comité est disposé à prendre note du rapport établi par le sous-comité du programme. Nous prenons note du dit rapport. Distingués délégués, nous allons maintenant examiner les propositions concernant la désignation des États membres devant siéger dans les commissions qui requièrent une représentation de la région africaine. En premier lieu, nous allons examiner les propositions relatives au choix des États membres à intégrer au comité qui nécessite une représentation de la région africaine, comme prescrit par le sous-comité du programme dans l'intervention du président du sous-comité du programme. Veuillez donc vous référer au paragraphe 42 du document RC 70-3. Nous commencerons par la composition du sous-comité du programme. Le mandat de l'Angola, du Cameroun, du Rwanda, du Sénégal, du Togo et du Zimbabwe au sein du sous-comité du programme expire à la clôture de la 70e session du comité régional de l'Afrique. Il est proposé que ces pays soient remplacés au sein du sous-comité du programme par l'Érythrée, le Libéria, le Mali, le Mozambique, la Namibie et la République centrafricaine. La composition complète du sous-comité du programme se présentera donc ainsi qu'il suit. Sous-région 1, Cap-Vert, Côte d'Ivoire, Gambie, Guinée, Libéria, Mali. Sous-région 2, Tchad, Guinée équatoriale, Congo, République démocratique du Congo, République centrafricaine, Érythrée. Sous-région 3, Comores, Lesotho, Malawi, Maurice, Mozambique, Namibie. Y a-t-il des observations concernant le projet de décision? S'il n'y a pas d'observation, je propose que la décision soit adoptée telle qu'elle a été proposée. Je vous remercie. La décision est adoptée. Nous examinons ensuite la désignation des États membres de la région africaine devant siéger au Conseil exécutif. Alors, nous étions sur le point donc d'examiner la désignation des États membres de la région africaine devant siéger au Conseil exécutif, mais je viens d'apprendre que le vice-président, le ministre du Bénin, est à nouveau en ligne. Les problèmes techniques ont été résolus et il pourrait prendre le relais.
Merci, Madame la Présidente. Effectivement, j'avais quelques soucis de connexion. Donc, nous examinons la désignation des États membres de la région africaine devant siéger au Conseil exécutif. Le mandat du Gabon au sein du Conseil exécutif expire à la clôture de la 74e Assemblée mondiale de la santé en mai 2021, en application des dispositions de la résolution RC 54-R11, dans laquelle le Rwanda est désigné pour remplacer le Gabon au Conseil exécutif à compter de la 149e session en mai 2021, immédiatement après la 74e Assemblée mondiale de la santé. La région africaine sera donc représentée au Conseil exécutif par les États membres mentionnés dans le tableau ci-après. Sous-région 1, Burkina Faso, 2019-2022. Ghana, 2020-2023. Guinée-Bissau, 2020-2023. Sous-région 2, Kenya, 2019-2022. Rwanda, 2021-2024. Sous-région 3, Botswana, 2020-2023. Madagascar, 2020-2023. Le Kenya est désigné pour occuper le poste de président du Conseil exécutif à compter de la 149e session du Conseil exécutif. Madagascar est désigné pour remplacer le Gabon comme membre du comité du programme du budget et de l'administration PBAC à compter de la 149e session du Conseil exécutif. Le Ghana et Madagascar représenteront donc la région africaine au sein du PBAC. Y a-t-il des observations concernant le projet de décision?
Honorable Chair, Honorable Vice Chair, can we ask you to kindly select the French channel when you're speaking so that it does not interfere with the English translation or Portuguese translation? Can you kindly select the French and speak into the French? Thank you very much. Sorry for interrupting.
Okay. Okay. S'il n'y a pas d'observation, je propose que la décision soit adoptée telle qu'elle a été proposée. Je vous remercie. La décision est adoptée. Enfin, nous examinerons la décision des États membres de la région africaine devant siéger au bureau de la 74e session de l'Assemblée mondiale de la santé qui se tiendra en mai 2021. Conformément à la pratique courante, il est proposé que la présidente de la 70e session du Comité régional de l'Afrique soit désignée pour occuper le poste de vice-président de la 74e Assemblée mondiale de la santé. S'agissant des commissions principales de l'Assemblée mondiale de la santé et sur la base de l'ordre alphabétique anglais et des groupes géographiques sous-régionaux, il est proposé ce qui suit. L'Afrique du Sud occupera le poste de vice-président de la commission A. L'Algérie, le Burundi, la Zambie et le Zimbabwe siégeront à la commission générale et le Mali, le Cameroun et la Namibie siégeront à la commission de vérification des pouvoirs. Y a-t-il des observations concernant le projet de décision? S'il n'y a pas d'observation, je propose que la décision soit adoptée telle qu'elle a été proposée. Je vous remercie. La décision est adoptée. Mesdames et messieurs les délégués, en ce qui concerne la thématique des élections, il est porté à mon attention que le sous-comité du programme n'a pas envisagé la nomination de représentants au programme spécial de recherche, de développement et de formation à la recherche en reproduction humaine, membre de catégorie 2 du comité d'orientation et de coordination PCC, et que nous devons par conséquent élire 2 membres du PCC. Le mandat du Mozambique et de la Namibie expire le 31 décembre 2020. Conformément à l'ordre alphabétique anglais, il est proposé que la Namibie et le Mozambique soient remplacés par le Rwanda et Sao Tomé et Principe pour une période de 3 ans avec effet à compter du 1er janvier 2021 jusqu'au 31 décembre 2023. Le Rwanda et Sao Tomé et Principe se joindront ainsi au Niger et au Nigeria qui siègent au comité d'orientation et de coordination. Y a-t-il des observations concernant le projet de décision? S'il n'y a pas d'observation, je suggère que la décision soit adoptée telle qu'elle a été proposée. Je vous remercie. La décision est adoptée. Nous examinons à présent le projet de résolution sur la procédure écrite d'approbation tacite tel qu'il a été recommandé par le sous-comité du programme. Veuillez vous référer au document RC70-WP1 qui a été transmis à tous les États membres en même temps que les invitations à la présente session du comité régional. Cette résolution permettra au comité régional d'adopter sans autre discussion des rapports et des résolutions jugées appropriées, à moins que des objections ne soient envoyées sous forme écrite à la directrice régionale. Y a-t-il des objections concernant le projet de résolution? S'il n'y a pas d'observation, je suggère que le projet de résolution soit adopté tel qu'il a été recommandé par le sous-comité du programme. La résolution est donc adoptée. Nous examinerons aussi le projet de résolution du secrétariat concernant la suspension de la 70e session du comité régional. Veuillez vous référer au document RC70-WP2. Dans le projet de résolution, il est proposé que la 70e session soit suspendue et qu'elle reprenne à telle date qui sera déterminée et par tel autre moyen qui seront choisis par la présidente du comité régional en consultation avec la directrice régionale. Y a-t-il des observations concernant le projet de résolution? S'il n'y a pas d'observation, je suggère que le projet de résolution soit adopté tel qu'il a été élaboré par le secrétariat. La résolution est donc adoptée. Ainsi prend fin donc le point 6 de l'ordre du jour. Madame la Présidente, je vous retourne la parole. Merci.
Monsieur le vice-président, je vous remercie pour l'excellente conduite des travaux et la rapidité. Merci beaucoup. Nous allons donc examiner le point 5 à l'ordre du jour qui concerne les activités de l'Organisation mondiale de la santé dans la région africaine 2019-2020, rapport de la directrice régionale. Vous l'avez dans le document RC70-2, distingué délégué. Le document intitulé Activités de l'OMS dans la région africaine 2019-2020, rapport de la directrice régionale, RC70-2, pour rappel. J'invite donc la docteure Machidiso Moeti, directrice régionale de l'OMS pour l'Afrique, à nous présenter son rapport. Docteur Moeti, vous avez la parole.
Thank you so much, Madam Chairperson. And I'm going to present this report supported by some PowerPoint slides. So Chairperson, Honorable Ministers, Heads of Delegations, partners, dear colleagues and friends, it's my pleasure to present the report of the work of WHO, the African region, between July 2019 and June 2020, in which we have strived to document the work that we are doing to contribute to the triple billion targets of the GPW13, in addition to, of course, responding to the COVID-19 pandemic. And as we will discuss the pandemic later today, in this presentation, I'll focus more on other priority health issues in the region. So next slide, please. A lot has indeed happened in the past year, and member states have faced significant challenges and also made historic progress in advancing good health. First of all, WHO, working with partners, have supported the Democratic Republic of the Congo in responding to a very complex Ebola outbreak with the help of innovations, as already has been said by the Director General, such as the first WHO pre-qualified vaccine against this virus. In addition, last September, the United Nations General Assembly adopted the Political Declaration on Universal Health Coverage. And in a side event at the UNGA, we organized and flagged a side event and flagged the importance of integrated investments in health security and in health systems. And I think what is happening today with the COVID-19 pandemic underlines the importance of that approach. In January, the coronavirus outbreak was declared a public health emergency of international concern, and almost 1 month later, the first case was reported in the WHO African region. In March, we launched a new initiative to recruit 100 UN volunteers from the Global South to work with WHO with a particular emphasis on women. This is part of our attempts to both diversify our staffing and also to address the imbalance in gender. And we are keen to bring in, through starting as volunteers, identify young women in the early stages of their career to come into WHO so that they can grow in the organization if they fit some functions. And I'm very pleased to say that despite the challenging environment in recent months, we already have 30 volunteers who have been recruited, and I'm happy to see some very talented young women running around in the regional office in Brazzaville. And now, after 4 years without a case of wild polio virus in the region, later on today, we will celebrate the regional eradication of wild polio virus. So a lot has happened in the past year. Next slide, please. In all the work that we are doing, universal health coverage remains vitally important as an overarching goal. The region continues to make progress towards UHC with a marginal increase in our scoring on the UHC index. So out of 100, we went from 46 to 48 between 2017 and 2019. And this is a composite index that looks at how our health systems in the region are performing, both starting from the fairness of financing right up to delivering and access to services. So this compares, we know, to a global average, which has remained 66 between 2017 and 2019, just signaling that we have made small steps in progress, but there is a lot to do still in achieving UHC. And I'd just like to signal here the important role of nurses as human resources, playing a key role in promoting health, in providing health services to African populations, and say that we celebrated their role in globally join others in the International Year of the Nurse. We are starting to see signs of progress and a movement towards UHC. And I'd like to thank and congratulate the ministers for everything that you have been doing. Here we are showing just a few examples of the hard work that is going on to update your strategies, to look at financing for health and develop the more appropriate financing strategies while striving to mobilize additional resources, and then to decentralize health systems management in order to be better able to deliver services where people are living. So we are really seeing all this analysis, defining groups that need to go into prepayment schemes, for example, and capacity building for policy development and implementation as the movement towards UHC. Just a couple of examples, as I said, in the past year, South Africa and Zambia have introduced national health insurance legislation. The Democratic Republic of the Congo has launched a national UHC plan, and Burundi convened a national health conference focusing on UHC. Overall, we are seeing an increased and sustained focus on health financing, with more countries producing national health accounts and more countries being able to do this on an annual basis or on a biannual basis, so as to see trends in financing for health and assure ourselves that we adjust what is going on so as to be able to deliver UHC. Our small island developing states have agreed on a pool procurement mechanism with which we are supporting them to be able to have access to more affordable NCD medicines, because they face particular challenges in order to procure their medicines. And I'll just echo what the Director General has said, and indeed recognize that more countries are signing up to the African Medicines Agency, and we encourage as well that more and more countries do that. And as we continue to improve the quality of maternal and child care, we are also seeing results. For instance, in Sierra Leone, after establishing a dedicated quality management unit, deaths among children in 13 high-burden hospitals reduced from 15% in 2017 to 9% in 2019. The next slide, please. A big part of our work on UHC is sustaining and accelerating the gains in preventing and controlling communicable diseases. On HIV, TB, and malaria, we now have 32 countries that are recording annual declines of at least 4% in new TB cases. And we know that we need to build on this good work by increasing treatment coverage, which currently stands at 56%, and ensuring that child household contacts of active TB cases receive preventive treatment. Currently, this stands only at 29%. Therefore, we need to put more emphasis on this. In the HIV response, we know that community health workers are playing key roles. And in Zambia, for example, they've helped some peri-urban communities to achieve the 90-90-90 targets and to reduce new infections by 30%. So these healthcare workers who are closest to communities working with other community agents can make a great deal of difference as far as HIV risk, which continues known to be a serious problem for young girls and young women in our countries, and also access to treatment is concerned. And at the regional level, stigma and discrimination among vulnerable groups remain key challenges in the response, especially as relates to young women aged 15 to 24 years old. So we continue to need to do more work on this. In Ghana, Malawi, and Kenya, more than 300,000 children have received the malaria vaccine, which is a promising tool. We were doing a field testing of the utilization of this vaccine, and I am encouraged by the results, and it will be one of the tools that we bring into our work on malaria in the region. In working on expanding access to immunization, which we know is one of the best tools in public health, just a couple of examples that Cote d'Ivoire and Equatorial Guinea introduced the hepatitis B birth dose, bringing to 13 the number of countries that are offering this low-cost life-saving vaccine in the African region. And more than 36 million people were protected from yellow fever in Ghana and Nigeria through preventive vaccination campaigns in 2019. And 6 countries responded to measles outbreaks, meaning we have challenges in the coverage in the region with the measles vaccine. And we recognize that more needs to be done to increase routine immunization coverage, which has stagnated in the past 3 years or so at around 76%, as against over 90% target that has been set at the global level. And for the past 10 years has changed very little. So this is one of the challenges that we need to face together, and we continue to search for even more refined strategies to find those children who are continuing not to have access to immunization. Next slide. Our support to countries to respond to outbreaks of vaccine-preventable diseases, I mentioned the measles, is part of the support provided every year around 100 acute health events, most of which are disease outbreaks that are reported to WHO in the Africa region. In the past year, we've seen outbreaks of cholera, monkeypox, Lassa fever, and plague, among others. However, it is very encouraging that as a region, we are continuing to detect outbreaks faster from a median time of about 17 days in 2016 to just 4 days in 2019. This is part of the work that we have done collectively in reforming WHO's Health Emergencies Program, and therefore improving what we are doing to support countries in defining certain ways of working in organizing incident management and surveillance and alert following up in certain ways. We're also able to control outbreaks faster on average, And this has changed from a median of 418 days in 2016 to just 40 days in 2019. This is in part thanks to our strategic and operational work together to improve preparedness and response capacities. 46 of our 47 countries have undergone external evaluations, and 39 have developed national action plans for health security to address the gaps that we've identified in your IHR capacities. And here I'd like to say we now need to prioritize the key actions that we need to be undertaken first in covering these gaps in our IHR capacities in the region. And just to give an example, I've already mentioned the Ebola outbreak response in the Democratic Republic of the Congo. This was a particularly significant event. It occurred in a very complex conflict zone as an environment with a protracted humanitarian crisis and where there is intense population movement. And we saw the results that are shown there on the slides. We had 3,400 cases and 1,100 people survived. Vaccination reached 303,000 people, including healthcare workers and the immediate contacts of cases. 250,000 contacts were traced, and an amazing 181 million travelers were screened in the various points of entry with surrounding countries, with Uganda, with Tanzania, with Rwanda, around the DRC. And countries responded to and investigated 6,000 alerts on a daily basis. And we believe that the 9 neighboring countries around the Democratic Republic of the Congo, who worked very hard and consistently on preparedness, then have been better prepared, including to respond to the COVID-19 pandemic, which is a positive result of this investment. Next slide, please. We recognize promoting health and well-being as absolutely critical in our region, particularly because of the challenges that are faced still in providing access to healthcare equitably for all the citizens of African countries that need it. So this is an important part of the GPW 13 on which we have been working with member states in the African region. And beyond preventing and controlling diseases, we also need to look at the conditions in which people live, work, grow, and age in order to be able to promote better health and well-being. In the past year, 6 countries increased tobacco taxes to reduce demand for tobacco products, and 8 countries strengthened their implementation of policies and legislation to reduce the harmful use of alcohol. So again, this is just providing you with some highlights and some examples of the work that countries are doing to address health promotion and well-being in areas, frankly, of our work that are not very well funded, but it is encouraging that some progress is being made. Other examples, the good work of Cabo Verde's Healthy Cities initiative was recognized at the UN General Assembly with an award from the Interagency Task Force on NCDs. And in travel to Cabo Verde, I participated myself in the activities that are led by the Ministers of Health, Ministers of Sport, mobilizing the population to take part in sporting and other events. In the area of water and sanitation, for the first time, thanks to contributions from all countries in the region, we have baseline information at the time of the survey on the situation of water and sanitation in schools. And when the survey was carried out, we found that only 47% of schools in the region, or 47% of schools did not have a drinking water service, and only 51% of healthcare facilities had basic water services or alcohol hand rub available at points of care, which is then highlighting the need to work with the relevant sector to improve the situation both for education and also for healthcare. The COVID-19 pandemic affords opportunities to improve access to water in these settings, and we hope very much will take the opportunity. With regard to food safety, some examples show that Burkina Faso, Ghana, and Senegal established new national rapid alert networks towards protecting populations from foodborne disease outbreaks, which are very frequent in our region. So this is important progress to be made. And then finally, as part of our flagship adolescent health program, in order to advance adolescent health. We've also worked with 23 African youth networks in the past year to build their capacities to engage in policy-making processes and to represent the views, ideas, and contribution of their peers. We have such a youthful population in Africa. It's absolutely vital that our health promotion and healthcare provision address the needs of this very important population subgroup. Next slide, please. Lastly, just to emphasize that in our programmatic work and in restructuring the regional office to deliver better on the general program of work, 13 triple billion targets, we've established a new cluster to accelerate integrated approaches in some key cross-cutting areas, including primary healthcare, antimicrobial resistance, laboratory services, data and health information, and then the area of innovation, digital health, and research. Recognizing that very often this work is carried out in parallel between different programs in a relatively fragmented way, and we are striving to achieve economies and also efficiencies across programs by ensuring that these functions are carried out together and are linked, and by also understanding that this will ease the burden in ministers of health in working with us if we go not in fragmented ways with each program trying, for example, to create its own separate data systems, but if we really strive to encourage and to model this more integrated way of working on these. On our work on primary healthcare, we are focusing on reaching communities or supporting governments to reach communities, including working in Mozambique, Sierra Leone, and Zimbabwe as some examples to strengthen district planning, management, and monitoring capacities. To optimize the use of antibiotics, Chad and Madagascar approved their national antimicrobial resistance action plans. We know that many other countries have been working on AMR, joining therefore more than 30 African countries that have endorsed and are implementing such plans. And also as part of monitoring progress towards the 2020, the SDGs, the 2020 report on health systems performance has been published in the region, and we've also published an atlas of African health statistics, which is availed to help ministers of health, partners to know what is going on in the region and to use this data as part of what they are doing. We're very keen on accessing the innovative capacities of scientists and other experts in the African region. Launched other innovation challenges in the past. And we convened the first COVID-19 hackathon now in the response to the pandemic, bringing together 100 top innovators virtually. We provided some seed funding to some of the promising innovations that have emerged, such as, for example, an information management tool, which is now being used in some hospitals in Uganda, with plans to roll out to other regions in the country, and we hope to make it available to other countries in the region. So we are working very much to promote innovation in the region, and we've recognized that there is huge capacity for this, and the COVID-19 response, some of the work that the Africa CDC is doing has also identified some innovations. We've worked on an integrated digital health platform that automates all the functions of health facilities, which is being used now in Kenya and in the Seychelles. Again, these are some of the innovations that can help with more efficiency in the way of managing our health facilities. Next. Can you go back one? Okay. Honorable ministers, dear colleagues and partners, it's not only about what we do, but how that is important. And we remain focused on delivering in ways that are more effective, that continue to be results-driven and accountable, and that are guided by the regional and the global transformation agendas of WHO. After almost 2 years, reviews of our staff profiles and structures in all of our 47 countries have been completed, and we're now implementing the recommendations with support from partners, and actually recognizing that we need to invest more at the country level in order to help have the competencies to support you in the optimal way. That is very important. Our leadership development program has been expanded to include a dedicated program for mid and senior level women staff, again, striving to achieve a gender balance in our staffing. And we've assessed needs for leadership training among senior leaders in ministries of health. This was mentioned by the chair of the program subcommittee when he gave their report. So we've started to act on what has been proposed by the program subcommittee. We've seen a 5-fold increase in media engagements. We are striving to communicate better, and particularly around the COVID-19 pandemic, and are using these as opportunities to share health information with the public, with regional leaders, opinion makers, and also to share what it is that WHO and member states are doing and achieving. We're very happy with a strong collaboration with key partners, key organizations like the African Union, the Africa CDC, the regional economic communities, and other development partners that are investing in health in Africa. As far as our management systems are concerned, just very briefly, we have not had unsatisfactory audit results for the past 5 years, meaning that our accountability, our compliance with rules is improving in the region. We are striving to contain our costs and have managed to save $10 million in the past year. This is an area on which we need to continue to be working. And then as far as the program budget is concerned, in 2018, 2019, we've already implemented, we implemented $707 million of our budget. This was about over 90% of the funding that we received. And we mobilized, I believe, about 90% of the budget that we had been aiming at, which is an improvement. And as far as the humanitarian response was concerned, we managed to mobilize $417 million in the past biennium. In this biennium, the program budget is concerned, we have managed to mobilize $423 million, which is 43% of the budget that you approved. We are continuing to work on resource mobilization, and about $250 million of the funding that we requested and were mobilizing for our humanitarian work has been mobilized. And here I'll just pause to say, as far as the work on COVID-19 is concerned, we still have a significant gap in mobilizing the resources that we need to provide, particularly technical support to the work that you are doing, honorable ministers, in responding to the pandemic. So, next slide, please. To finish, just looking forward in the rest of the coming year, of course, we can anticipate that the coronavirus will continue to circulate, so we need to continue adjusting to this new normal, the new way of working, which includes making greater use of technology and leveraging more the partnerships that have arisen in the context of responding to the pandemic. The adjustment includes, I'd like to emphasize, ensuring the continuity of essential services and addressing other threats with appropriate precautions in place for frontline workers and communities. I'd just like to flag the fact that we know in relation to the COVID-19 pandemic that in quite a few countries we will be having elections in the next few months, and we just like to plead and urge that these potentially mass gatherings be run in ways that take into account the need to minimize the spread of the virus, and we are available as WHO to provide advice as far as that is concerned. And then globally and at the level of the African Union, the importance of achieving universal health coverage has been confirmed, reiterated by our political leaders, and together we need to keep working for these declarations to be translated into national and subnational action to protect vulnerable populations in particular, and to work towards enhancing equity. We've also seen this year the effective role played by high-level multisectoral task forces on COVID-19, and see this as an opportunity to strengthen similar mechanisms and ways of working for other priority issues to expand engagement beyond the health sector, which is needed on so many health issues. And this includes partnering with and leveraging the capacities of the private sector for better health with a continuing focus on equity. So with 10 years to go until the Sustainable Development Goals deadline, we are making progress but we need really to accelerate our efforts to ensure that the targets are on track and that the gains we have made to date are sustained and advanced despite the big challenge that is being presented to us all by the COVID-19 pandemic. And just in closing, I'd like to extend and express my appreciation to the member states, to yourselves, honorable ministers, to the heads of state for your leadership, your action, collaboration with us in WHO, also to partners and to our WHO staff and colleagues for the progress and achievements of the past year, even under these very challenging conditions of the pandemic. I look forward very much to our continuing collaboration to improve health outcomes in the African region, and I thank you very much for your attention. Thank you.
Merci infiniment, Dr. Moiti. Mesdames et messieurs, vous êtes maintenant invités à intervenir relativement à l'exposé qui vient de nous être présenté. Pour une utilisation rationnelle du temps dont nous disposons pour cette séance et afin de recueillir le maximum de contributions possibles, chaque délégation disposera de 2 minutes pour ses observations ou commentaires. Et un système inspiré de feux de signalisation nous aidera au cours de cette séance. Je profite de l'occasion qui m'est offerte pour féliciter la directrice régionale et la remercier de son travail et du rapport dont elle vient de nous présenter une synthèse. Chers collègues, je viens de transmettre vos félicitations à la directrice régionale et vous prie donc de faire l'impasse sur les félicitations et les remerciements et de passer directement à vos observations. La parole est maintenant ouverte pour des interventions en rapport avec l'exposé présenté par la directrice régionale. Madame Dramé Avognon, coordonnatrice du programme Relations extérieures, partenariat et organe directeur au bureau régional, m'aidera pour la modération de cette séance. Madame Dramé Avognon, chère Pamela, prenez la parole, s'il vous plaît.
Thank you very much, Madam Chair. Honorable Ministers, Excellencies, distinguished delegates, we invite you to raise your hands should you wish to take the floor, as the Chair has indicated. Chair, I can already see that Malawi, the Honorable Minister of Malawi, followed by Kenya, would like to take the floor. Malawi, Honorable Minister, you have the floor. Honorable Minister of Malawi. Chair, we seem to be having problems with Malawi, so can we go on to Kenya and then come back to Malawi. Over to you, Honorable Distinguished Delegate of Kenya. Over to you.
Thank you, Chairperson. Kenya is pleased to address this historic virtual regional committee, the first of its kind as a result of the ongoing COVID-19 pandemic. First and foremost, on behalf of the government of the Republic of Kenya, I wish to congratulate Dr. Moeti on her appointment to serve a second term in the post of WHO Regional Director for Africa. I also wish to take this opportunity to congratulate the Africa member states on the certification of Africa region as wild polio virus free. Chairperson, Kenya welcomes the report on the work of the WHO in the Africa region for the past year and thanks the regional director for the comprehensive report. We are pleased to note the steady progress being made by countries in the region towards the attainment of the triple billion targets and the sustainable development goals, with the support of the regional office and the country offices. In this regard, Kenya appreciates the efforts made by the Secretariat to support the government health insurance and financing reforms to ensure better alignment with the national aspirations on universal health coverage. Chairperson, the COVID-19 pandemic has suspended life as we all know it and severely disrupted provisions of essential health services, thereby threatening erosion of the gains made in maternal and child health, HIV, TB, malaria, and immunization services, among other priority programs. In conclusion, as we all work to end the acute phase of the pandemic, Kenya requests the regional director to consider developing a policy brief for the attention of heads of state and governments, highlighting the policy imperatives necessary to guarantee that the region is better prepared for the next pandemic. This brief should, among other issues, propose actions to guarantee regional health commodity security through strengthening of the local manufacture of essential medicines, supplies, and equipment. I thank you, Madam Chair.
Thank you very much. We will try now and see if the Honorable Minister of Malawi can take the floor. If that doesn't work, we understand that there's a video and we will play the video. Honorable Minister of Malawi, you have the floor. Honorable Minister,
I think we are muted there. Yeah.
Perfect. You're on now. We can see you and hear you. Go ahead, Honorable Minister. My apologies, Minister. We cannot see. We cannot seem to hear you. If you would don't mind, can we go ahead with playing the video instead? Because we seem to have a challenge. Can we ask the video to be played, please, from the Honorable Minister? Thank you.
Thank you.
Yeah.
We apologize, but there is no sound.
While the video is being sorted, we will come back to the video if you don't mind. May I suggest that we hand the floor to Comoros, the distinguished delegate for Comoros, and then we will come back to the video of Malawi. Distinguished delegate of Comoros, the floor is yours.
Merci, Madame la Présidente.
Thank you very much, Madam Chair. I would like, on behalf of the Union of the Comoros, thank the Regional Director for the high-quality presentation of the report on the activities of WHO AFRA, covering June 2019 to June 2020 in a very difficult world context. The implementation of different activities throughout last year was possible thanks to the General Program of Work for 2019-2023, which has three priority axes: access to UHC, protection when there are health emergencies, and promotion of well-being of populations. With regards to strengthening supplies, infrastructure, and access to high-quality products, health products, We, as a small island nation, have implemented a strategy with a view to making more medicines available for non-communicable diseases thanks to pooled purchasing. This has led to a 40% reduction in the cost of medicines for the countries that are working together and has allowed us to supply high-quality medicines. With regards to HIV/AIDS, there have been important projects underway for the 80-80-80 target. 80% of people working with HIV/AIDS now benefit from treatment. The Madam Minister has stopped, and 90% now have very low viral loads. We have integrated important medication in the list of essential medicines to help treat people affected by HIV/AIDS, and a number of people are now benefiting from this. With regards to the fight against malaria, important progress has been achieved, and we are on the right path with a view to eliminating malaria. With regards to leprosy, thanks to a partnership between the WHO and the Sasakawa Foundation, we organized a screening campaign nationally and treatment in 2019 with a view to eradicating the disease. For vaccine-preventable diseases, we have made every effort to respect the Addis Ababa commitment, guaranteeing co-financing for new vaccines since 2019. It is also important to underscore that we were declared polio-free as of 2015. With regards to health emergency situations, we have carried out the requisite surveys and joint external and JEs, and our plans to prepare for and respond to emergencies is now firmly in place. We have taken into account the directives of the third edition of the guide published by the WHO in 2019, adapting it to the reality of the country. We now have a platform that allows us to guarantee cross-border surveillance. We have also made sure that there is research in surveillance in the area of epidemics, thanks to this platform. Mobilization of resources so that we can set up public health emergency structures is still, however, a challenge. So we would appeal to the WHO to help us strengthen its presence in the member states so that it can carry out its leadership role in the health sector. As a member state, it is our responsibility to further collaborate and strengthen our cooperation with the Secretariat with a view to guaranteeing and preserving the role of coordinating health access in our region, respecting the rules and regulations in place. We would like to commend the report of the Secretariat and would like to thank them for all the support given us. Thank you very much, Madam Chair, for having given me the floor.
Thank you very much. We understand some people may have problems raising their hands. May we ask that you use the hands button at the bottom or send a message in the chat and we shall give you the floor. I would like to remind all honorable ministers and distinguished delegates that the timer is there in 2 minutes. We have next on our list, Madam Chair, we have the Central African Republic, followed by the Gambia, and then Zambia and Botswana. The Honorable Minister from the Central African Republic, you have the floor.
Merci.
Thank you very much, Madam Chair. We would like to thank you sincerely for the excellent work done by the World Health Organization through its African Regional Office. We would simply like to underscore our concerns here today with regards to the situation of conflict and post-conflict nations. We believe that we need to do work in these countries under the transformation agenda of implemented by our regional director. We have witnessed firsthand our shortcomings in the fight against COVID-19. It has been difficult to have access to certain input in my country. And so we understand that the transformation agenda does not take into account the situation of fragile countries that have experienced serious difficulties, inequality, and imbalances worldwide with regards to access to certain commodities. So we would recommend, if this has not already been done, that our regional office quickly show us, demonstrate to us that this transformation agenda is also there for populations under distress, in conflict or post-conflict situations, and that in emergency situations such as the COVID-19 pandemic affecting the world, they are not penalized.
For redirecting an organization that was riddled with a lot of challenges over the years. Certainly, it's a difficult time as we were trying to stabilize. And we know yourself and your team, we are now faced with a different challenge, unprecedented. That's the COVID-19 challenge. A lot of progress had been made in other areas in the Gambia and in other countries, I know, but the COVID-19 challenge is a test for our health systems. Most of our health systems have been very weak. Many of our countries have, over the years, had very weak health systems. Now, COVID-19 exposed those cracks and weaknesses even more so. The smaller countries with little capacity, it has been a big challenge. Of course, we cannot go without thanking the WHO under your own leadership, Director General, for providing the technical support and the material support in strengthening our system, the laboratories, the surveillance system, and so on and so forth. However, at this juncture, I will be quick to add that many of our systems were not prepared for this COVID-19. It's an eye-opener, and we suggest that thereafter, of course, during the pandemic, but thereafter, we need to have strong surveillance systems in our countries. It is very, very important we have strong surveillance systems and also strong response systems. As I mentioned earlier, with such weak health systems, what do? We need the capacity. So we suggest a peer review mechanism whereby every country will have a basic minimum that can be reviewed by the WHO and providing guidance. Now, in the case of the Gambia, for example, if we tell you we have only 2 intensive care specialists in the whole country before COVID-19, and that's what we still have. So those kinds of capacities, many of the other countries are like that. If we encounter so many very sick people, even if we have the ICU facilities, what do we do with those patients? Even if we have all the ventilators, the capacity to use those ventilators probably will not be there. So these are very serious capacity challenges that many of our countries have faced during this pandemic, but to have an efficient health system, to add to the well-being of our people, after this pandemic, I think it can even start now, but after this pandemic, we need to have these robust systems whereby we have a mechanism to ensure that each health system goes by some basic standards. Governments, I'm sure, will be open to this, but with proper guidance from the WHO, you know, every health system has basic standards when it comes to treating the severely ill patients, when it comes to surveillance mechanisms, when it comes to following up with these people. Yeah. Well, okay, I will wrap up. Give me just a few seconds. But by and large, I think, do I still have the floor? Hello? Yes. Thank you very much. But I think I want to commend the WHO, and I want to commend all our colleague ministers for all the efforts we have put into this pandemic. But I also suggest a lot more collaboration between the countries so that we share information, we share ideas as to our experiences, to learn from each other and to pave the way forward. I wish to stop here for the time being. Thank you very much.
Thank you very much, Honorable
Merci,
Minister.
Monsieur le Ministre. Je rappelle, Madame la modératrice et mes collègues ministres, que nous avons 2 minutes par intervenant.
I'd like to remind the ministers that we have 2 minutes per speaker. Thank you.
Thank you, Chair. Thank you very much. Chair, we understand that the video from Malawi is ready, and we suggest that we play the video now. And then we have 5 other speakers, so we'd like to encourage the honorable ministers, the distinguished delegates, to keep it short to 2 minutes. The video for Malawi, please. Thank you.
Chairperson, on behalf of Malawi, I would like to thank the Regional Director for the excellent report. We are happy to note that good progress is being made in the implementation of planned activities in all areas, especially in the area of WHO transformation agenda, whose main focus in the region is on putting people at the center of change through the 5 key initiatives. I would also like to highlight the importance of the region being focused in accelerating progress to attain universal health coverage by year 2030. We are happy that WHO's top priority is to support countries in ensuring that every person has access to health care without suffering any financial hardship. As countries, we are committed to this, and we have developed strategies to achieve universal health coverage. For example, in Malawi, all health services in the public health facilities, in line with our health sector strategic plan 2, are free of charge to the user. This ensures that no one fails to get health services because of financial hardships. We are also planning to introduce health insurance. It is also pleasing to note, Chairperson, that the region has made good progress in the area of neglected tropical diseases. Lymphatic filariasis has been eliminated in Malawi, and this has been certified by WHO. There are also preliminary indications that onchocerciasis is about to be eliminated in Malawi. In fact, we are just waiting for certification by WHO. Lastly, Honorable Chairperson, I would like to thank WHO and all other partners for their support you have given us during the period of this report, especially in the light of COVID-19 pandemic. As stated in the report, I would also like to ask you to continue supporting us so as that we balance our work to make sure that we do not lose the gains made in previous years because of the COVID-19 pandemic. Indeed, Mr. Chairperson, the COVID-19 pandemic should be taken as an opportunity for us to strengthen our health systems. Thank you for your attention.
Thank you very much. Honorable Chair, we would like to give the floor to Zambia, the distinguished delegate of Zambia. Zambia, you have the floor, followed by Botswana.
Madam Moderator, thank you very much. On behalf of the Republic of Zambia, we are proud to be part of the 70th Regional Committee of the World Health Organization. Zambia is delighted to be part of the celebration of the certification of World Polio virus eradication in the region. Chairperson, Zambia continues to make steady progress towards the attainment of universal health coverage in line with the regional and global aspirations. As a country, we are inspired by the World Health Organization transformation agenda in the region. Our national health insurance coverage as a country for the enactment of the Health Insurance Bill in 2018. This has translated in more of our people having access to healthcare services without suffering financial hardships. Chairperson, progress has also been made in health infrastructure development in our country, with 482 primary health clinics built, while 25,000 health workers have been recruited in the last few years, compared to our set target of 30,000 health workers to be recruited. Chair, inspired by WHO, Zambia has seen improvements in key performance indicators in the sector. We reduced our maternal mortality ratio from 398 to 278 per 100,000 live births from 2014 to 2028, while under 5 mortality in children has been reduced from 75 to 61 per 1,000 live births. Zambia continues making progress in attaining the HIV epidemic control, with its triple 90 performance starting at 92, 85, 76. Chairperson, the advent of COVID-19 pandemic threatens to reverse some of the gains we've scored as a country and as a region. As we strive to maintain provision of essential health services, it is clear and it is an imperative for all of us to collectively invest in creating robust, resilient, and sustainable health systems to repel the shocks from any public health threats or emergencies as we are seeing. Today it's COVID-19, we have Ebola, and there are many other threats we shall continue facing. We need to continuously and carefully strike a balance between protecting the lives of our people while allowing the wheels of our economies running to steer socio-economic prosperity for our countries. Zambia therefore urges all member states, with the support from the Secretariat, to continue forging ahead with the necessary partnerships, such as those with the Africa CDC, for enhanced synergies in order to leverage on collective resources at our disposal. Chairperson, as I conclude, I wish to recognize and appreciate the leadership of WHO at various levels and all our strategic partners in the fight against COVID-19, as well as the continued sacrifice and great work of our gallant frontline staff, the healthcare workers. Chairperson, Zambia salutes you.
Thank you very much, distinguished delegate of Zambia. Chair, kindly Chair, we have 5 more speakers, after which I understand we are going to close the floor. 5 more speakers, and these are Botswana, Liberia, Congo, Nigeria, and Uganda. We would like to hand the floor to Botswana, to be followed by Liberia. Honorable Minister, you have the floor. Botswana, you have the floor.
Thank you, Chairperson. Botswana welcomes the report of the Regional Director on the work of the WHO in the Africa region and knows the achievements and progress made across all pillars of the health system. The COVID-19 pandemic has brought unprecedented socioeconomic challenges on our society and placed a burden on our health system. This has led to severe disruption in health service delivery, particularly for maternal and child health, as well as HIV, TB, malaria, non-communicable disease, and immunization programs. We, however, believe that the crisis has also brought opportunities for the African region. We welcome the high-level political focus on the national health agenda, which is anticipated to result in increased investment in human resource for health innovation, domestic financing to improve health system performance, including in preparation and response to emerging and re-emerging health emergencies, as per the IHR 2005. Likewise, we believe strengthening of the health information systems across all levels of the health system are essential to address the challenges and better monitor the progress made. We are pleased by the WHO's immense support to our governments in providing technical advice regarding the COVID-19 response. And of noteworthy is the strengthening and decentralizing of the laboratory testing capacity and training of healthcare workers with Africa CDC and other partners. The infrastructure will be pivotal to the provision of other health services. I observe and strongly suggest that it is times like this that we must draw our inspiration history of facing and overcoming similar challenges. We managed to reverse adversities which HIV/AIDS has made against us in the 90s and 2000s. Together, we can do the same today. Undoubtedly, the greatest challenge of our region that our region faces are the inequities in access to essential quality health services, which are paramount to reach the WHO triple billion targets. We therefore welcome the WHO support to countries in addressing social and economic determinants for health, including through a health in all policy approach. Lastly, Chairperson, Botswana wishes to congratulate African member states, global health partners and communities under the leadership of the WHO Director on the certification of eradication of wild polio virus in the Africa region. We are also acutely aware that much more work needs to be maintained to sustain these achievements and support of the rollout of the novel oral polio vaccine type 2. In closing, as we traverse this normal and anxiously await the vaccine for COVID-19, our strength lies in cooperation, and together we shall shape the future as we've done before. I thank you, Madam Chair.
Thank you very much, Honorable Minister. I would now like to pass the floor on to the distinguished delegate from Liberia, to be followed by Congo.
Madam Chair, thank you so much for this opportunity. Liberia is pleased to express her appreciation to the Director General for her glaring yet succinct deliberation on what WHO Afro has accomplished during these challenging times globally. In Liberia, the impact of WHO Afro is felt not only with some resources, but the appointment of Dr. Peter Clement, who has worked with us during Ebola and now working with us as a team that is gradually making some significant progress against COVID-19, not being complacent because it is not over until it is over. As we conglomerate through this virtual field, it is critical that WHO continues to drive technological, innovative means that will impact us in sharing best practices in dealing with both epidemics and building health system. As we continue to battle COVID-19, I plead with my colleagues not to forget about routine health services, and we look forward to WHO Afro to share some best practices and experiences with us. I wish to express my special thanks to the Secretariat. Liberia stands ready to share her experiences. I thank you, Madam Chair.
Thank you very much. We will now give the floor to Congo, to be followed by Nigeria. Distinguished delegate of Congo, you have the floor.
Thank you, Madam Chair. The sound is very low. Thank you for giving us the floor on this important occasion. Regional Director, thank you very much for your report. Your report has highlighted the achievements that we have made, as well as the priorities that we have focused on with regard to disease prevention and control. We are all aimed at achieving UHC. However, since 2019, we have had several challenges in accessing financial and material resources, and this has been exacerbated by the COVID situation. Because of the COVID pandemic, we have had difficulties in covering the health services in other areas. We think that the lessons learned in terms of financing for the pandemic can also be drawn upon in terms of dealing with the pandemic and trying to deal with other diseases at the same time. Regional Director, I would like to thank you very much for the efforts made by yourself and the organization in this regard. Thank you.
Thank you very much, distinguished delegate. We had two more speakers on the list. I believe the chair has closed the list, unfortunately. So would like to hand the floor to the Honorable Minister of Nigeria, to be followed by Uganda. Thank you. Honorable Minister of Nigeria, you have the floor.
Can you hear me now?
Yes, yes, Honorable Minister, you have the floor.
Can you hear me now?
Yes, we can hear you, Honorable Minister. You have the floor.
Thank you, Madam Chair. Nigeria congratulates the Regional Director, Dr. Moeti, on the excellent report on her stewardship over the past year, half of which was in the shadow of the COVID-19 challenge. I also congratulate the Regional Committee on the certification of our region as wild polio free, and Nigeria is pleased to have been part of this effort over the past 4 years. We are determined to uphold the gains and have put together all efforts to strengthen our primary healthcare system for universal health coverage, and especially the routine immunization despite the challenge. An important lesson for our region is the realization that African countries need to work together more than ever before on developing their own solutions, including manufacturing of pharmaceuticals, commodities, and vaccines. Thank you.
Thank you very much, Honorable Minister. We will now have the floor to Uganda, to the Honorable Minister of Uganda. Honorable Minister, you have the floor.
Thank you very much. On behalf of the Republic of Uganda,
Bissau, could you please mute the floor? Could you please mute your mic? Honorable Minister of Uganda, you have the floor.
Thank you, Madam Chair. Madam Chair, on behalf of the Republic of Uganda, I wish to appreciate you and your teams for your unwavering support and guidance to the African region, especially during this pandemic of the COVID-19, and your unwavering support over the years in ensuring that our populations are healthy and that our goals of universal health coverage is not lost. Allow me to appreciate my colleagues for the efforts in controlling the pandemic. This is a time when Africa's resilience will be tested, as COVID-19 has tested many systems internationally. We must remain united if we are to win this war, and indeed it is possible. However, we must continue with our efforts of building resilient systems, but also remain focused not to lose the gains we have made over the years in addressing the high burden of communicable and non-communicable diseases, as well as issues surrounding maternal and child health services. I wish to urge all of us to remain focused and to continue with the goal of universal health coverage in our various nations. I thank you.
Thank you very much, Honorable Minister. Chair, we have two countries. We have the Honorable Minister of South Africa and the distinguished delegate of Cameroon who would like to take the floor. Chair, over to you. Thank you very much, Chair.
Madame la modératrice, nous allons exceptionnellement...
Madam Moderator, exceptionally, we shall be granting 2 minutes to 2 countries who have asked for the plain, Cameroon and South African. And then we will definitively close the list. The other member countries who would like to make statements can send us written statements to the Secretariat. Thank you.
Thank you very much, Chair. Thank you. We will therefore give the floor to the Honorable Minister of South Africa, to be followed by the distinguished delegate of Cameroon. Honorable Minister of South Africa, you have the floor. Thank you.
Thank you very much, Honorable Chairperson, the Chairperson of the session, and I want to congratulate my colleague, Minister of Congo, for a re-election. Let me also thank the Regional Director, Dr. Moeti, for a very beautiful report, and also want to thank Dr. Tedros for all the continuous support. At this point, we want to support the report that has been given and welcome. We welcome the report, and we want to also indicate that the report is showing the importance of us strengthening our health services as we move towards universal health coverage. It has become very clear in our response to COVID-19 that if we are not vigilant, we may lose the gains that we have already obtained from the fight on tuberculosis, fight against HIV, and even some of the basic essential services such as immunization and reproductive health. And it becomes very, very important for us to continue to ensure that no one is left behind as we move towards a healthier population in the continent, particularly focusing on balancing the need to deal with non-communicable diseases all together in a package of universal health coverage. Your report, Honorable Regional Director, has really reminded us about the need for us to work together as a continent. Thank you very much for all the support from the WHO at Geneva, as well as in the region. And thanks to all the members for working together in the fight against COVID-19. We thank you.
Thank you very much, Honourable Minister from South Africa. We will now hand the floor to the distinguished delegate from Cameroon. Cameroon, you have the floor. The distinguished delegate from Cameroon, you have the floor. You're muted. If you don't mind unmuting yourself. Thank you very much.
We still have no incoming sound from Cameroon. Good day, everyone. I'm sorry, we just had a little problem with our microphone. It was off. Thank you very much for giving me the floor. On behalf of the government of Cameroon, to take stock of the situation and comment on the regional director's report. I'm sorry. Cameroon would like to applaud this document, and we would really, truly like to appreciate and congratulate the team of the WHO Secretariat and the Regional Director who have worked on this document, which has important information of interest for us all. However, we do have one or two concerns that we would like to raise, particularly relating to our conflict areas. This was a comment or a topic already broached on by the Central African Republic. We have a similar situation. We have a conflict in two areas, and this is where we have open conflict ongoing on the ground, which has really been a challenge for us. And we do need to take stock of the situation and know what are the real needs of the populations, particularly in those conflict areas. We would like WHO to please make this a priority to help these people in need so that we can carry on our activities on the ground. At the same time, we would like to encourage a better collaboration in terms of receiving funding from other sources to help us to move forward with our programs on the ground. And like all our countries, we have all been struck by the COVID-19 pandemic, which has already made our already fragile health systems even more debilitated. This is a concern for us all. We would therefore like to move forward with new technology so that we can have better case management in the field. We would like to receive more information and more data from WHO on how we can move forward given our situations on the ground. Of course, we would like to approve the report of the regional director. That said, thank you very much for your attention.
Thank you very much, distinguished delegate from Cameroon. Madam Chair, I'm pleased to report that that was the last of the speakers, and back to you. Thank you very much.
Nous remercions tous les intervenants, et puisqu'il n'y a plus d'autres intervenants.
We would like to thank all the speakers, and since there are no more calls for the floor, I would like to give the floor to Dr. Moeti for her remarks.
Thank you very much, Chair, and I'd like to thank all the honorable ministers for their observations on the report, for their reactions to the report, and for the approval of the report. I also thank those that shared the experiences of their countries in not only continuing to advance universal health coverage and provide health services to populations as well as prevent outbreaks, but also the response to the COVID-19 pandemic. And thank you very much for all the encouragement to ourselves as a secretariat for the work that we are doing to support your countries. And really, I thank you on behalf of all my colleagues for your collaboration, which has been excellent in all the work that you are doing. I would like to address the concerns expressed by the Minister of the Central African Republic that were supplemented to some extent by the official from Cameroon about the need to pay more attention to countries affected by humanitarian crises and conflicts. And first of all, would like to assure the Honorable Minister that we absolutely do not neglect the importance of countries in these situations, as well as people who are living in situations in conflict all over the region. We don't have a particular initiative on this, but we do pay special attention to people living under the most difficult circumstances and are working with humanitarian partners as well, so that we do our part as WHO in providing guidance and in providing technical support, what is being achieved in the countries. However, we have taken note of the concerns expressed, and we will do our best to highlight this even more prominently in the work that we are doing, ensure that we work with others to mobilize the types of resources that will enable us to do more effort, to make more effort, and for people and countries under these very challenging circumstances. Otherwise, I think it's just to note some of the comments that were made by ministers of health, and also to very much agree with those that emphasize the need for countries to exchange experiences, exchange lessons learned, and to work together on some key initiatives, such as working together around the issue of local or regional production of some key items that are needed for health development. We've observed that the COVID-19 pandemic has forced African countries to explore and to utilize the production capacities that exist both in kind of industrialized settings and in the more kind of local capacity to produce items that are needed for development. I'd just like to say, as far as the procurement of supplies needed for the COVID-19 response is concerned, and we will touch on this in the session COVID-19, it has indeed been one of the most important and most difficult challenges that have been faced by the continent, by the region, the COVID-19 pandemic. And again, hopefully this will spur us on as the African region to make all the efforts possible to become more and more self-sufficient in local production of key items and materials. And here I'd like to very much acknowledge the leadership of the African Union, which has taken very strong steps to accelerate this process at the political level. And then it's up to all of us to work, including under the auspices of the African Medicines Agency and the Inter-Africa Trade Agreements, so that this collaboration really does get strengthened. I noticed that this was emphasized by several ministers and delegations, and can only say that we support that strongly in WHO and have been as a technical partner present in all the discussions that are taking place on this matter. So I'll conclude very much again by thanking you, ministers, for your concern for continuing to provide essential services to your populations while you at the same time respond to the pandemic, and only assure you that we are absolutely ready as WHO to help with this. We've developed a framework. We have some guidance to help to make sure that this is done in a way that does not exacerbate the spread of the COVID-19 virus. So thank you all very much. Thank you, Chair, and I yield back the floor to you.
Merci, Dr. Moeti, pour l'examen.
Thank you, Dr. Moeti, for your feedback. We have now come to the end of this agenda item. We can assume that the Regional Committee is ready to take note of the report of the Regional Director. Thank you.
maintenant marquer une courte pause.
We will now have a short break. The meeting will continue with a special event on COVID-19 response in the WHO African region. We would like to invite all of you to kindly be ready to resume at this time, as this was only a one-day meeting and we have a great number of issues to cover. We will follow the schedule and keep to it according to the different agenda items on our program of work. We have only 10 minutes of break now. We shall ask the Secretariat at this point if they have any announcements. The meeting will resume at 12:30. Thank you. As I said, we have 10 minutes for a break and we will resume at 12:30 Brazzaville time.
Hello, can you hear us from Geneva?
Hi, yes, we can hear you. This is Dr. Mweti.
Thank you for confirmation.
Thank you, we can hear you.
That's what. Okay. Hello, colleagues from Afro. Can you hear me?
Yes, we can.
Okay. Thank you.
Oh, yes, we can.
Thank you.
Yeah.
peuvent répondre sur les discours à vous. Mesdames et messieurs les délégués, chers invités, après l'examen fructueux du rapport de la directrice régionale,
Ladies and gentlemen, after the assessment of the regional director's report, I requested the special event on COVID-19 response in the WHO African region. There are already various countries that have raised their hand. I would like to remind you that there will be an opportunity for you to make your statements and your comments at some stage during this session. This session is going to be divided into 4 parts. The first part is the opening session. The second session is a session in which we will do a situational analysis of the COVID-19 pandemic in the region. The third will be a panel discussion on how to build resilient health systems for achieving universal health coverage and ensuring that we are able to respond in that regard. And then the fourth will be a summary of how we can go forward. As you know, the coronavirus type 2 severe acute respiratory syndrome is a rapidly emerging and highly infectious virus that is spread throughout the world, including the WHO Africa region. While the extent of damage caused by this coronavirus has not reached levels seen in other continents, the number of cases and deaths continue to rise, and we are faced with challenges not only due to the weak health and surveillance systems, but also in terms of testing capabilities to document the true extent of infections in Africa. In addition, as many African countries have already taken precautions that involve shutting down economic activities and public services, the collateral impact of the pandemic is also extensive, especially on an economic level. National governments are struggling to coordinate COVID-19 response actions to contain the pandemic, reduce morbidity and mortality, and to protect essential health services. Currently, the tools to limit the spread of SARS-CoV-2 are limited to non-pharmaceutical interventions as we await the development of an effective vaccine against COVID-19. African countries are balancing the introduction of lockdown measures with the need to protect the national economy, the need to protect employment, the social safety net, food supplies, and other essential services. The COVID-19 pandemic has highlighted weaknesses in the health systems in the WHO Africa region and elsewhere, including infrastructure such as water and sanitation facilities, adequate staffing levels, and access to personal protective equipment. Against this backdrop, attention needs to be paid to healthcare workers' increased vulnerability to acquiring COVID-19 and to burnout. At this afternoon's session, we will learn of countries' experiences to date in combating COVID-19, as well as deliberate on utilizing the COVID-19 response as a platform for building a resilient health system for achieving universal health coverage. It is now my pleasure to request the Secretariat to play a 3-minute video recording of His Excellency, the Prime Minister of the Federal Democratic Republic of Ethiopia, a laureate of the 2019 Nobel Peace Prize, who will provide the keynote address at this opening session. Secretariat, please show the video.
Dr. Tedros Adhanom, WHO Director General, Dr. Moeti, WHO Regional Director for Africa, Honorable Ministers of Health, distinguished participants of the 70th Regional Committee meeting, ladies and gentlemen. Allow me to first greet you with the humble Ethiopian expression, Tena Yistilling, which means health be upon you. My regrets that I could not join you for the live session. Excellencies, for the past 8 months, our world has been challenged and shaped in a profound way by the COVID-19 pandemic. This pandemic, which has rapidly spread globally in a short period, has affected millions and claimed the lives of thousands of people. This virus has not only affected our health, but also tested our way of living, societal norms, and economies at large. It prevented us from sending our children to school, limited our societal gatherings, and the act of worshiping together. It also gravely impacted the economies of countries with a decline in GDP growth, high inflation, high unemployment rate, reduction in household income, increase in poverty rate, and others. COVID-19 does not recognize borders, does not differentiate between religions, economic status, or the color of our skins. It has affected all of us. As the Director General once rightly said, it is a common enemy of mankind. In Africa, we quickly felt the impact of the pandemic due to our weak health systems, coupled with the highest disease burden in the world. The World Health Organization declared the coronavirus as a global pandemic on March 11, 2020. In response to this global health threat, my government took decisive measures to minimize the impact of the pandemic on our society and the economy. The measures we took were intended to protect Ethiopia from this devastating virus and to delay the spread on our continent. As early as January 2020, we successfully activated all necessary precautionary measures at Bole International Airport, one of the largest hubs in the continent. Similarly, the action we took to control the spread of the disease once it was detected in Ethiopia were inspired by the concept of solidarity and collective leadership, embodying the spirit of Maddamar or synergy, which I have been championing nationally and globally. In accordance with the spirit of Maddamar, together with Jack Ma, we were able to mobilize 5 rounds of COVID-19 prevention material support to numerous countries in the region. In this difficult time, Ethiopian Airlines has proven that it is an African airline by providing cargo services to deliver life-saving emergency medical supplies from the rest of the world. As you are aware, we are still faced with challenging days as the coronavirus races through our continent. To minimize the effects, I would like to share 3 very important points for the way forward. First, we need to enhance our efforts in a much coordinated manner with utmost cooperation and in the spirit of solidarity. Secondly, we need to develop a common voice to ensure fair and equitable access to COVID-19 vaccines, diagnostics, and treatment. Here I would like to thank the WHO for initiating the ACT Accelerator Program and together with Gavi and COVAX initiative. Africa should be placed at the center of these initiatives. Third and last, let us take this opportunity to strengthen our health systems and further enhance our public health emergency preparedness and response capacity. COVID-19 has taught us that strong health systems are a matter of national security and survival. And I propose the health security agenda be elevated to the top of priorities at the African Union and other regional intergovernmental organizations. Ladies and gentlemen, finally, I would like to recognize the important work of the World Health Organization for their leadership and support to member states during this pandemic. I would like to acknowledge the Director General, Dr. Tedros, and his team, and our Regional Director, Dr. Moeti. Your support has been imperative. I would also like to take this opportunity to thank Commissioner Amir El Fadi, Commissioner of Social Affairs for the African Union, and Dr. John, Director of African CDC, for their relentless follow-up and action which helped countries to minimize the dire impact of the pandemic in our continent. My utmost appreciation to you, Ministers of Health and health workers in general. Your role is invaluable. Let me conclude by wishing this August Assembly successful deliberation. Amasagnallo. I thank you.
Monsieur le Premier ministre.
Thank you, Your Excellency, the Prime Minister of Ethiopia, for your thoughtful insights. We have much to learn from countries' experiences in responding to the COVID-19 pandemic and adapting best practices to suit each country's context. This concludes part one of this session. I now pass the floor to the session moderator. This is Ms. Julie Gishuru. She's the Head of Public Affairs and Communications for MasterCard Foundation. And she will moderate the rest of the session. Welcome, Julie. You have the floor.
Thank you so much, Chair, for so eloquently setting the scene for today's discussions and deliberations, this important session on COVID-19. And this really is a chance for all of us to come together and to learn from each other in responding to COVID-19, to look at how we can adapt the lessons and the experiences and ensure best practice at country level, best practice that suits context at national level, sub-national level, district level, and community level as well. That's why we are here. Allow me to say this, I join you to host these discussions as a passionate Pan-Africanist, as an African woman, a mother, yes, a professional, an Afro-optimist, and also as a team member at MasterCard Foundation. We are committed to walking the journey with Africa and ensuring that we do build resilience to be able to withstand and to move forward in this COVID-19 era. Without further ado, I have the pleasure to invite Dr. Chidi Moeti, the WHO Regional Director for Africa, to present a regional overview of COVID-19 response, and this will include progress made and impact as well. And so, Dr. Moeti, over to you.
Thank you very much, Julie. Great to see you again. And honorable ministers, heads of delegation, dear partners, colleagues and friends, it's my great pleasure to take the floor again to give a summary of the situation of the COVID-19 in the region. But I'd like to start, first of all, by just expressing my own thanks and appreciation to the Prime Minister of Ethiopia for having joined us to give this very inspirational message, and indeed for the role that Ethiopia is playing at the continental level, not least of which is in transporting some of our staff, myself included, when I was coming here, and to South Africa from Brazzaville, and also many of our supplies. It's deeply appreciated. So as far as the situation is concerned, I think in the interest of time, I will go directly to summarizing the situation by saying, as I said at the beginning in my opening remarks, that we had indeed made some very grave predictions, projections of what the situation might be like in Africa. And there's been a lot of anxiety expressed about how the region might be able to survive such a pandemic. I think the Honorable Minister of Health of the Congo said it very well, taking into account the status of our health systems, which we've already mentioned in this session. Next slide, please. But the situation is as follows. And we have seen that the type of, how can I say, extremely courageous, difficult decisions taken by political leaders at the top level did avert, in our view, the type of projections that we had made as WHO and that other modelers had made of the situation, which, however, continues to be a very grave situation. So it was said by the Director General, our continent has now passed 1 million cases. And in the region, we have now, hang on. So we've had over 1 million cases on the continent, and 28,000 people have died. And we've had just about 1 million cases in the region, and 20,000 people have died. That is a big impact, and I think we do not by any means understate that this has been a very difficult situation, a huge challenge in the region. We remain with 179,000 active cases in the region, meaning many of those who were infected did not in fact get seriously ill as to die, and we still have cases that are being quarantined, that are being followed until they cease to be active. And we see the evolution of this graph that we have had indeed at some point what looked like a very rapid increase in cases. We are going to be hearing from the Minister of South Africa shortly. He's one of the panelists about the very grave situation in South Africa, because if you look at the graph in dark blue, we have the situation in South Africa, which has at some point was accounting for over 2/3 of the cases that were being reported daily in the region, and that is a situation cumulatively. We also are showing there several of the countries that have had the largest numbers of cases, like Algeria, Ethiopia, Ghana, Kenya, and to some extent, Nigeria. And then the pink, you see the situation as it has evolved over in the other countries, the 41 other countries in the region. And we are seeing that we have had what seems to have been a peak, and now have the daily number of cases being reported overall at the regional level going down, although we do still have a few cases which are showing an increase in the daily number of cases. I can say that the situation has varied a lot between one country and the next. Some of the countries that had very few cases at the beginning, such as Namibia, are now seeing a significant uptick in daily cases. So it is very much a situation that is up and down, and that underlines the need to manage on a day-to-day basis based on the data and based on what is happening currently as far as the different measures that are being put into place. I'd like to highlight the situation of healthcare workers. Although this looks like a small number, 3.9% of cases in the region, we know that every single health worker is a precious resource in our region because we have the worst gaps as far as healthcare workers are concerned. We also wanted to show some of the impact, where that purple column labeled lockdowns. Countries started shutting down early in the African region, and there's been a lot of debate about whether this was appropriate or not. We think that taking into account the status of our public health capacities, that they were not scaled up all over countries, and that governments were concerned about the rapid spread countrywide of the pandemic. Actually, the very difficult decisions to close down the economies, stop people moving around, did make a difference as far as the evolution of the pandemic is concerned. So we're showing there that 14 countries locked down nationwide, 11 countries partially, and now we are seeing, since this started in March, an easing of some of these restrictions of movement by the member states, by the governments. Because I think it was said very well by previous speakers that there is a need always to balance lives against livelihoods. And this is what governments are doing on an individual basis. Next slide, please. I'd like to commend the high-level political leadership, again, coordinated at the level of the African Union, with the participation strongly by the Africa CDC, which took a continental approach, emphasizing working together, solidarity, and collaboration among African countries. It's been exceptional, and we'd like to recognize that. I will just go through very quickly some of these achievements in building up the capacity and readiness extremely quickly. That was done by member states under extremely challenging circumstances, especially as regards laboratory capacity, because almost as the virus hit the region, we had tremendous problems in procuring some of the vital supplies that are needed, both for testing and also for protecting healthcare workers. But as you can see, there was a rapid increase in laboratory testing, starting from 2 labs, with decentralization quite significantly in a number of countries. There was a lot of work to put in place the case management platforms in countries that have very little by way of ICU beds, high care capacity, because there's been a justifiable emphasis on primary health care in many of our countries. Work was done to improve access to oxygen supplies, including through oxygen plants being established, oxygen concentrators being procured. The number of ICU beds was rapidly increased, as we can see on the slide, and even the procurement of ventilators was rapidly increased. I'd just like to emphasize through the slide the importance of action, not only in the healthcare area, but at the community level. At the end of the day, the success in responding and bringing to an end this pandemic is going to be a combination of action between governments, the public health systems, other sectors that play an important role in order to enable individuals and communities to engage and to adopt the kind of behaviors that they need to adopt on a day-to-day basis, wearing masks, social distancing, the hygiene measures that are going to be so critical to control. So there was a lot of emphasis on our part to mobilizing community health workers by the governments and also engaging with those that work with communities. So our colleagues who work on risk communication, we call it, mobilized, and we're in touch with over 250,000 participants in our webinars and communication activities, and they're expected to reach 3 million people each month. Next slide, please. So one of the things that has also been important has been integrating technologies, innovations in the response, including pharmaceuticals, including looking and preparing for being involved in the identification of vaccines that are going to make a huge difference to the evolution of the pandemic. I won't go into all the discussion about what has been done as part of the ACT Accelerator and the COVAX platforms that WHO, Gavi, and other partners and member states have put together, simply to say that 9 candidate vaccines now in the COVAX platform are in either phase 2 or phase 3 trials. We have had participation. I would say we would have wished for more participation of African countries in the various trials that are going on, both for vaccines and also for pharmaceuticals. We've encouraged this, and we know that several member states are in the pipeline waiting to join some of the trials that are going on. There's been discoveries. I just mentioned dexamethasone as an example of an effective pharmaceutical product that can make a difference in severe cases of disease. There is a lot of work going on to discover several others. And one of the key challenges has been access to diagnostics, as I've said, and use of the PCR platform, which is a challenge in many of our countries. There's been a great deal of willingness to try rapid diagnostic tests that have been produced on the market. And WHO has worked with an organization called FIND, a network called FIND, to try to evaluate and find the best performing rapid diagnostic tests that can be recommended to countries. In the meantime, we have provided some guidance. In a very challenging context, we have to acknowledge for countries to see how they can benefit mostly from rapid diagnostic tests. Next slide, please. Just to highlight some challenges, I think after the very strong action of our leaders at the political level, first to say economies are now being opened up in the region, and governments have accepted they cannot keep economies locked down. And therefore, we have the challenge then of adjusting to the fact that there will be more risk as more and more people move about, people gather in ways that were highlighted so well by the Prime Minister of Ethiopia. Financing the response has also been a challenge. And I know that African countries have gone out mobilizing resources for the work that you have to do, honorable ministers, not only in health, but also very importantly, in mitigating the socio-economic impact of the pandemic and of the physical distancing measures on populations. And this component, I have to acknowledge, has not received the type of financing that it needed, which has led to a lot of suffering and also limited the ability, sometimes families and individuals, of playing their parts. In WHO as well, we have received and are grateful for the support of member states and other partners, but our response plan has received just over 50% of the financing that we needed to really do all that we meant to do in response to the pandemic. The global supplies market has been absolutely difficult from very early on. I won't say this again. It's just been one of the most difficult challenges that has been faced. We are urging that it's important for the turnaround time of lab results to be shortened so that it comes into around 48 hours to enable the follow-up of contact tracing and isolation and quarantining to have an impact. We still have cases where it takes several days, 5 days, a week to get the results back. This continues to be then a challenge to the effectiveness of the response. I'd like to highlight information sharing so that data can be analyzed with countries in order to support the response. We express our gratitude to those countries that are sharing the data and recognize that there is more effort that is needed here. And then just to say, as I've already said, that keeping communities engaged and empowered is one of the challenges that we are facing and one of the biggest priorities, because it is through people's actions that we will be able to sustain, if you like, controlling the pandemic until such time as a hopefully effective vaccine is available, it can be rolled out, it can be accessed in an equitable manner. And ensuring the continuity of other services, I think has already been mentioned, I won't dwell with it. Immunization, maternal and child health services, access to treatment for people with HIV and other conditions need to be done at the same time as the response to the pandemic. Equity in getting access to the key tools that are being developed now is something that we are identifying as a challenge, and various initiatives have taken place. I'd like again to commend the African Union for the work that they have done in mobilizing private sector partners, countries to work together on this. And the economic impact has already been mentioned by the Director General and by the Prime Minister of Ethiopia. Just to say that we need to be on the lookout of the impact on this, on financing for health in the future, and just prepared to do our advocacy and continue to prove that health is a good investment. Okay.
Dr. Moeti, can I just ask? Yes, it has muted.
Okay, thank you, Julie. Next slide. So as I said, we are opening up economies and societies, trying to revert back to normal life is now going on. And we are emphasizing here the need then to use data to inform these decisions and to look at the risks involved and to decentralize what is done so that it's not a matter of locking down the whole country or opening up the whole country, because situations vary between the so-called hotspots, often in capital cities, urban areas, and in other parts of countries. I'd also like to highlight the cross-border issues that have arisen in different sub-regions and say that recognizing countries' wish not to import cases from their neighbors, we have developed with the African Union and Africa CDC some protocols and encourage that these be used. We are talking to the sub-regional organizations about how to harmonize this. And I would really like to emphasize using technology so that if people are going to be crossing from one country to the next, possibly they can have a test before they leave, then we can upload this so that the next country can receive this result without having to see a piece of paper, a so-called certificate brought by the person. We believe strongly that it's possible for countries to work together to minimize those queues of trucks parked at the border while tests are being carried out, and to really facilitate the opening up of economies and enabling people to move. In Africa, our capacities remained limited, so we must be strategic about shielding those who are most vulnerable from getting severe forms of the disease and dying. And we also are urging very much and are determined to work with you as WHO to use this opportunity to continue to build our health systems, capacities, and their resilience to outbreaks. I will not say more about encouraging and working hard ourselves to support research into new technologies, and emphasizing just once more that it is individuals' actions together with the public health interventions that are going to play a strong role in stopping the pandemic. And just assuring all of you that as WHO, we appreciate the leadership, the work that you've done, honorable ministers, and we appreciate the partnerships. Many of our partners are online. Thank you for working with us, and particularly again here, the Africa CDC and African Union, to support our member states to address the situation. Thank you. Thank you, Julie. Back to you.
Thank you. Thank you so much, Dr. Moeti, for providing a really comprehensive overview of the COVID-19 situation, pandemic situation in Africa. We know it's evolving. Thank you so much for taking us through why the pandemic is playing out differently in Africa compared to to other regions, to taking us through some of the challenges, but also the possible solutions, what's being done, what's having impact, what are we learning. So thank you so much for that. We now turn our attention to South Africa. And we do know that currently South Africa is the hardest hit in Africa, registering, as it stands right now, more than 600 COVID-19 cases to date. I have the pleasure of inviting Dr. Zwelithini Mkhize, Honorable Minister of Health of South Africa, to present South Africa's experiences in combating COVID-19. Minister, over to you. Standing by for Minister Mkhize. South Africa, are you with us?
I am sorry, I was muted, but I'd like to share some slides. Can we confirm that they are visible, please, moderator?
They are visible. Thank you.
Thank you. Well, thank you very much, moderator of the session. The Director General of WHO, Dr. Tedros, the Regional Director, Dr. Matshidiso Moeti, the chairperson and deputies of this WHO session, fellow ministers, excellencies, and leaders of delegations and various delegates who are with us, members of the media, thank you very much. Thank you for allowing us the space to share the journey of South Africa through the COVID-19 situation. Sorry. Sorry, trying to get the slides to move. Okay. I'm not sure whether I'm able to control from here, but if I can just ask someone to assist me at that level, we'll move pretty quickly. But the first point, which I think we need to make, is that South Africa has a very unfortunate position of bearing the heaviest burden in the continent, almost just 46% of the total, as well as the 90% of the SADC region. And we are seeing even the level of mortality. At SADC level, South Africa is responsible for the 90%. Next slide. This journey is a journey of how we started. If you look back, around March was our first patient, and a few weeks later, we then started on a lockdown because we had noticed that there was the doubling time was 2 days, and so we realized that our health system was going to be overwhelmed. And over the years, over the months, the past 5 months, we had to move to a very hard lockdown. It was about 4 or 5 weeks. And after that, we started easing down in a differentiated way. But when we started with about 1,000, just under 1,000 cases, by the time we had to reduce the lockdown, we had actually gone to about 16,000 of the cases, and went up to about 32,000. So the numbers started rapidly increasing when we moved to the third level release of the lockdown. And at this point, we are now at a level where our numbers, next slide, please. Our numbers have gone beyond 613,000. Can we have the next slide, please? Okay. Part of the lockdown involved a number of restrictions, including ban on international travel, ban on large gatherings, restricting funerals to a small number of 50, and church gatherings, musical and sports and others were actually restricted. A ban on alcohol, closure of schools temporary, as well as restriction in the hotel and travel in the hotel and restaurants. And at the end of the day, we had to afterwards take a risk-adjusted approach where we're to release these restrictions very carefully based on adoption of various protocols, trying to balance the lives and the livelihoods. Next slide. Over this journey, I think we should be able to see how at the beginning we had a doubling time of about 2 days. With the lockdown, we're able to extend it to about 15 days. When we started easing the lockdown, it went down to about 12 days, and then it started going up to about 14 days. At this point, we are now on what we call the third level or second level, but we are now at about 79 days. Although the numbers have been increasing cumulatively, but the doubling time has actually been delaying, which for us has been a very important issue, because the issue was about how to make sure our health services can cope with a large number of people who are positive cases. Next slide. At the moment, we will notice that South Africa cumulatively has got about 613, while 611 on the slide. There's there are variations, sub-national variations. So not all regions are giving us exactly the same numbers, and they were moving up onto surges at different levels. And so this experience has actually helped us to be able to start on one area and then move to the other province. And as we moved along, we noticed the numbers of provinces changing from one having the highest burden and then slowing down, and then another one taking over. But what has been positive is that we have about 516,000 recoveries, which are equal to 84%, which to us, for the past few weeks, we've actually seen a huge movement towards more recoveries. And at case fatality rate, 13,000 is equal to about 2% of case fatalities. Next slide. This slide for us has been a slide that has really shown us lots of optimism. If you look at the colors at the bottom, those colors indicate how the different provinces actually moved from having a different pattern each for the of the pandemic. One started surging up early, even during the lockdown, and then it started picking up, achieving a peak and plateauing downwards. Then, of course, the other provinces have been coming up at different levels. The most popular is the one that's got a red, which is Gauteng, followed by the one in green, which is the second popular province, and the third one in that way. But we can see now that we're over the surge. We've actually got a pattern which is showing South Africa has moved really past the surge. This has confounded all the models that had shown that there was a possibility of much higher numbers. But at this point, we must say that it has actually been a very, very hectic, 4 or 5 months as we went through this. But the black line indicates the overall total of the whole country cumulative numbers. It's showing that now they are actually irretrievably going downwards, although we have not reached the bottom. And this is a point that we're now watching about whether there's still a risk of a resurgence in South Africa. Next slide. These two slides are an indication of what we have seen in the way our testing levels. Over the past few months, we've actually screened over for 20,000 population for symptoms, and then tested at the moment 3.6 million people. At the beginning, we have had to push the testing level up. On the one side, you can see the average number of daily tests per week. On the other side, we've seen the proportion of positive tests. You will see that the pattern is actually the same. Now that we're at this level, we're seeing the reduction of the numbers of people who have got symptoms, and the reduction in the numbers of the cases tested, of the tests done, is a reflection of the numbers of people with symptoms who fall into the criteria. But we will note that the positivity rate went up to 27%. It's dropped now to about 14%. It's actually indicating to us we are no longer getting as many positive people getting infected, even though we know that the total number of positive cases is not the total number of people who are infected in the country. But the evidence here is clearly that South Africa is beyond the peak. Next slide. This is another interesting slide, which is showing the increasing numbers of deaths. And if you follow all of these slides, we have tracked the numbers of deaths. And at some point, we were able to notice that there will be a few more deaths that are associated either with undiagnosed COVID-19 or the environment where people are staying away from hospital because of fear of COVID, or some of the areas where they fear that there might be no services or they might be infected. So this number is giving us what we track as excess deaths. So the numbers of people who have been recorded as dying has mimicked the flow of our positive curve. But at the same time, you'll notice that excess deaths started increasing, also mimicking that same trend. But now that the numbers are going down, even the deaths are going down, which means to us that we're not now having an aberration of testing and reduction of numbers. It's actually a situation where the totality of numbers of both of those who are getting positive and those who are dying as a result is actually beginning to decline. Next slide. Our biggest worry is whether, in fact, this is the first surge, and there might be another one. If you look at South Africa, we've gone past our apex, our surge. Now, if you look at other countries like Germany, they seem to have stayed on, without another surge. But if you look at Spain, it started showing up a surge after a long lull. But if you look at the US, it went up and decreased, never got quite to the bottom, and started having a huge surge, which is higher than the first surge that they've had. So this is the precaution that we are giving out to our people in South Africa, not to be complacent, because this might still be a possibility. Next slide. This slide basically just gives us some of the factors here, the demographics on age and gender. We've seen that there are more females who are infected than male in our situation here. And on the other side is showing us the declining number of hospital admissions. Different colors are showing different sub-regional areas, provinces, wherein the numbers have actually been decreasing, particularly from the month of August. So there is a definite indication of a reduction at this level. Next slide. Now, the major issue has been our case management, of course, starting with the issue of diagnosis, quarantine, testing, contact tracing, triaging of the patients, putting up fever clinics and isolation, as I've indicated, of patients under investigation, the early use of oxygen, supportive treatment, high flow oxygen, ventilators in some cases, and of course the use of dexamethasone and a whole lot of other treatment on the protocol. What we've actually done is to put up a lot of field hospitals. We can actually at this point say that we've never breached in South Africa our bed requirements, our ventilator requirements, and so all our people were able to be managed in-house in all the hospitals. And at the end of it, we have now started dismantling all the field hospitals. We're now preserving only the structures which were done as permanent structures, because we'll need those for the future. Thank you. Next slide. Some of the best practices, which I think is important here, is that leadership of government at the highest level, led by the president, and multi-sectoral response has been the key in this case, understanding that there's a lot more sectors than health that are involved, and therefore there is need for us to be able to go out and mobilize communities, and community screening and testing assisted to get us a sense of where the high transmission and low transmission was, and focusing on strengthening decentralized response at the district and local levels, and also ensuring that in dealing with this thing, government works together on a whole government and all spheres, and the society and the whole society approach, which has really been quite important. And in this case, it's also been important to ensure that there's collaboration across various departments as we deal with issues, to make our people aware of some of the issues, particularly issues of comorbidities that are associated with the worst mortalities, how they can contain the infection, the basic containment measures of treatment of hand washing, masks, and distancing, and so on. Next slide. Some of the lessons that we have learned is that our most important issue has been the need to protect our health workers. At this point, 27,000 of our health workers have been infected, and that's about 4% of the total cases, and we've lost about 240 of them. It's one of the most important lessons that we have to learn about protection, protective gear, training, and ensuring that we work together and give them support as we deal with this issue. The second point has been about the fact that early decision on a national lockdown has actually assisted us in this case. And then on easing the lockdown, a risk-adjusted strategy was very, very critical in ensuring that we don't have a sudden let go, which then creates a rebound, transmission of infection. That the information and data management is crucial for both planning and for management, but that transparency is critical. Sharing the information with the public, inclusivity in planning, all the partners in society need to know that they have a role to play. We've actually seen a lot of support where even the private sector had to put up a whole fund where they came together to support government, particularly when we're running short of the protective equipment and some of the diagnostic kits. They actually had to open up through disaster legislation. We're able to open up and get all of them to collaborate to bring in as much as possible for the support. So the coordination of all actions and collaboration between government and of the government departments as well as other parts of the the society, business, labor, civil society has really been the major focus in this regard. Next slide. I think some of the issues that we have to focus on now have to be about how do we ensure that we have got adequate resources mobilized so that they are able to strengthen our health services. But at the same time, we also need to make sure that we are able to mobilize society for behavioral change and adoption of non-pharmaceutical interventions as a new way of living, as a new way of coping with a post-COVID situation. Attention that has to be given to rebuilding the economy, creation of jobs, opening various sectors of the economy, and making sure that people can go back to work and that our economy is able to carry the entire society along. The other area of attention to humanitarian relief, lots of problems of starvation, helping the community to cope during the period of a lockdown, including also the fight against crime, combating crime, particularly gender-based violence, which became an issue. The matter of psychosocial support is critical for health workers when they go to work and the fear and anxiety of losing of contracting the infection and losing their colleagues is very, very devastating. The scenes of nurses and doctors weeping when they've lost one of their colleagues is something that's really very touching. And at the same time, the psychosocial support for families who can't go and visit their members, who can't even attend to the bereavement. All of this grief management and anxiety has been a big issue. But the idea of striking a balance between dealing with the infection and at the same time managing the economy and protecting workers, all of this has been very, very important. So it puts us at a point now where we believe we need to focus very strongly on surveillance, where we monitor the risk of resurgence and excess deaths, in particular focus on the testing criteria. And whilst we've been using mostly the PCR test, but we now have started using the antibody test to be able to look at the prevalence of the infection. This has just been recently agreed upon. So the major issue is whatever investment we make, we must actually use the response to COVID-19 as a way of, as a springboard of building a future health service which is more resilient, which is able to promote universal health coverage. Next slide.
Thank you, Minister. I'm going to ask you to please wrap up. Thank you so much.
That's the last slide, Madam. Thank you very much. I think that the main issue is that COVID-19 is going to be with us for a while, and therefore, you know, a behavioral change is important. It means we're going to restructure our economies, restructure our social lives, and as we deal with the management of suppressing the virus, we need to ensure that we avoid the loss of visits by other people with other diseases, tuberculosis, immunization, and all of this are very, very important to balance all of that up. And at last, I also want to say thank you to WHO. They've been wonderful, regional director, the director general. You've all been so wonderful with the technical support, with continuous support at levels where we needed technical expertise, we needed advice, we needed opinions. You've always been there with us. And I also want to thank the AU, particularly Commissioner Amira and the Africa CDC for all the support that we have received. At this point, I would like to say that from South Africa, we're grateful for the support throughout the continent, and we are really looking forward to a post-curve or post-surge, post-COVID-19 situation where we'll be able to be more vigilant to reduce the spread of the infection. Thank you very much, and thank you for coming along with us on this journey of the very difficult 6 months that we've come from. Thank you.
Thank you so much, Dr. Mkhize, for providing a very clear overview of the situation in South Africa. It's great to see South Africa is moving past the surge. It's also great to hear that the country will not be complacent, still cautious. The best practices, the lessons, the challenges, all very instructive and helpful. Thank you for that. We go straight now to hear from Abdoulaye Diouf Sarr, Honorable Minister of Health of Senegal. The floor is yours. May I request, sir, that you unmute Minister Sarr? You may still be on mute. Kindly unmute. Thank you.
Je vous remercie. J'aimerais donc.
Thank you very much. I would first of all like to greet the Prime Minister of Ethiopia, as well as the Regional Director of the WHO Africa, members of the Secretariat. Thank you very much for this opportunity to address this meeting during this COVID session. And I would also like to congratulate the Regional Director for the excellent report that she provided in the previous session. It is an honor for Senegal to share our experience with you in the area of the COVID-19 response. I'd like to thank the WHO for its constant support since the beginning of the pandemic in Senegal. The representative of WHO in Dakar has been continually working with government to support us to ensure that our response is effective to this pandemic. And so I'd also like to thank the Africa CDC for its support to Senegal. The experience of Senegal with regard to a multi-sectoral response to COVID-19 is probably something that other countries can learn from as well. And I'd like to thank you for this opportunity of sharing with you. To give you some information about the country, Senegal covers a surface of 196,722 square kilometers. I'm having difficulty. Yes, that's right. Good. Thank you. Next slide. So yes, we cover 196,000 square kilometers. In terms of our demographical data, we have 16,705,000 inhabitants. We have a GDP per capita of $1,033 and a GDP growth rate of 6.7% in 2018. In terms of our health data, we have got 40 health promoting institutions, of which 4 of them are not hospitals. We have 79 districts with 103 health centers at intermediary level and 1,415 health outposts that are at the more peripheral level. So, in terms of structure, we have got a presence in large parts of the country. Like many of the other countries, we have established 3 intervention levels in our national COVID response. So first of all, I'd like to congratulate our government for their strong engagement in the COVID response. So basically, through governance and leadership, we have ensured that we have 2 presidential councils that work together with our National Epidemic Management Committee. Please, can you go to the next slide? So, as I've mentioned, in terms of the coordination of our response, we have the strong involvement and engagement of the President of the Republic. And as I've mentioned, he created 2 presidential councils, which together with our National Epidemic Management Committee have a look at the COVID situation. So, first of all, they have planned the response and they created an entire set of plans and strategies. And we've ensured the financing of our preparedness and response plan. And during the second meeting, they planned the multi-sectoral contingency plan and how that plan would be funded. So this multi-sectoral contingency plan has to cover all the interventions that need to be taken, that need to take place. And then the president, together with the CNGE, decided to establish 2 levels of coordination. Our first level is the strategic coordination level. So our National Epidemic Management Committee is involved, and they have got weekly meetings that are chaired by the Director General of Public Health. And so during this weekly meeting, they look at the situation of our COVID response. And then they put in place whatever interventions are necessary. So you'll see that our implementation has evolved significantly since the beginning. And then we also have the operational coordination level. And this is done through our COVID incident management system. And that kicked in on the 2nd of March. And they have got daily meetings. So they have a look at the situation, and once again, they monitor implementation of our different COVID response activities. It's also important to note that the national epidemic level is managed at national level, but we've also decentralized our approach. So we have got as well a decentralized system that takes care of management at the different levels. So our multi-sectoral approach has been a cornerstone in our response. And so we have collaborated with various sectors of government. So we have the health, transport, home affairs involved, because we need to involve the provincial and regional governors in the response. Next slide. So, as I was saying, our multi-sectoral approach has been cornerstone in our response. So we've involved the Ministry of Home Affairs. They've been significantly involved in the response because we involve the regional leaders and governors. And so the Minister of Home Affairs has got a significant role to play in this area. And then the Ministry of Transport is also very important. We developed a health protocol to try and prevent infection risks in air, land, and sea transport. We've involved the Ministry of Justice. They have developed and published 2 health protocols, the one that is focused on detention centers and prisons, the other one that is focused on supervised education establishments. We've also involved the armed forces, and they are... So in terms of this multi-sectoral approach, another very important area is the support and involvement of many organizations and partners. So Senegal is a member country of the WHO, and this has allowed us to strengthen the efficiency of our preparedness plans. We've been supported by the WHO, by the UN system, and we've even organized a summit virtually, where we've presented our needs and where we've received support. So these multi-sectoral interventions have allowed us to better implement our contingency plan. And so our strategies are quite flexible and adaptable. They take into consideration the epidemiological context and how it has developed over time, as well as the socioeconomic constraints. So at the moment, what happens is that we have systematic management of all confirmed cases in epidemiology and epidemic treatment centers. We also, because of the fact that we don't always know exactly how many suspected cases we have, we also do outpatient management of asymptomatic cases and also of patients that are having light symptoms. So this allows us to ensure that we don't overburden our health system. And we also have the isolation of contacts, either in dedicated sites or in self-isolation. And we have medical home-based treatment of all patients with light symptoms of patients that do not have comorbidities. So you can see that our response is dependent on the situation and once again oriented by this multi-sectoral approach. So every week our CNGE meets and has a look at the situation, and every morning as well we receive information. We also receive information at regional level, which helps us to determine our actions. The next slide, please. I'd like to speak a little bit about the highlights as well as most important policy decisions that we have taken and which have allowed us to respond to COVID. So in March, on the 2nd of March, we had our first imported case. And then on the 31st of March, we had the first death. On the 23rd of case, on the 23rd of March, we declared our state of emergency with a curfew. And we also then prohibited gatherings. We closed public spaces such as schools, places of worship, restaurants, and markets. We also prohibited inter-urban transport. Then the situation evolved, and then in May 2020, we eased many of our lockdown measures. So the lockdown was being complied with very strictly, and so in May we had to ease some of those measures due to socio-economic impacts. So we shortened the curfew, we reopened the markets and the shops, we reopened places of worship for a specific reason. And we also resumed interurban transport, but with the continuance of observance of barrier measures. Then in June, we continued to ease the restrictions and lockdown measures. So we lifted the curfew and we allowed for more transport. We opened up places of worship. We reopened those classes at school that require examination, and we also resumed air travel on the 15th of July. So there was definitely an easing of these restrictions. And then in August, we had a look at the figures, and so we decided to strengthen our decisions with regard to barrier measures or non-pharmaceutical measures. So we've made the wearing of masks in public spaces mandatory, and we've also prohibited large gatherings, especially in areas where the youth normally meets, such as family ceremonies and on beaches. And also we have strict measures for burials. So I'd like to speak a little bit about the role of our public and private laboratories. COVID-19 has allowed us to boost our health system resilience, as well as our national public health laboratories' capabilities to better respond in terms of epidemic surveillance and detection. So we have got two types of laboratories. We have the Dakar Pasteur Institute, which has deployed two mobile laboratories, one in the center of the country. But I have lost the sound of the speaker. We've also got the Research Institute for Health Surveillance and Training, which was launched by President Macky Sall. And then we started decentralization from the capital and then to the regions. So we've got 10 PCR testing laboratories in the country, 3 of which are in Dakar. And then we have 7 sites where we can carry out a rapid diagnostic testing.
Minister, if I could please ask you to wrap up. Thank you very much.
Hence the reason why, from the beginning of the pandemic, we focused on case detection and management. So the number of tests that have been conducted are 141,000. So this is a screening rate of 0.7%. Our target is 1%. Our number of confirmed cases is 13,013. Our number of recoveries, 8,595, with a 64% recovery rate. And then the number of healthcare workers that have been infected, 348. You can see that the pandemic is concentrated in the area of the capital in Dakar, if you look at the map. So you can see that it is strongly concentrated in the most populated area, which is around Dakar. And this is where there's a lot of access as well. There are many people that work there, and so it's important for us to also carry out a risk communication, community engagement in that area. The multi-sectoral approach that has been carried out has involved the following. First of all, easing of certain lockdown measures. So we've been able to open up our airports since the 15th of July, but that was done after having a multi-stakeholder preparation meeting. We've also had risk communication, community engagement, associate health district, and we've had to carry out this RCCE to strengthen awareness. And Senegal has evolved significantly in the area of RCCE. And today we have a consolidated approach to ensure that we can work very closely with those who are providing home-based treatment for infected people. And this has allowed us to reduce the burden on our epidemic treatment centers. It's allowed our health workers to also work more safely. I've spoken, therefore, about the laboratories as well. Decentralization of the laboratories to the peri-urban areas is also very important. And it's allowed us also to monitor exactly where the hotspots are and where the pandemic will probably increase. And it's also allowed us to provide home-based treatment. Next slide, please. And we can see that there are cases that are asymptomatic, and so it's important for us to keep those patients at home, provide home-based treatment to them, but at the same time, we need to ensure monitoring and evaluation of those patients. Next slide, please. So what are the main lessons that we've learned? It's important, based on our experience, it's important to therefore note. I'm sorry, but we've lost the speaker. Thank you. So to conclude very quickly, it's important to note the determining role of leadership and of a multi-sectoral approach. The support of the private sector in the COVID response and public-private partnerships is also important. Another important aspect is the fact that we must have a flexible strategy that evolves in response to the situation on the ground. It's also important to ensure that social sciences are involved in risk communication, community engagement. It's important that country readiness and preparedness is used to address all the major public health emergency issues in accordance with the 2005 International Health Regulation. And then it's also important to take note that the development of strategies to ensure continued provision of essential health services and programs, such as for malaria, TB, and so forth, is essential. To conclude, I would say that I would like to thank the WHO once again and to reiterate that we received extremely good cooperation, collaboration from all the different departments of government as well as all our partners, and this has been essential and a determining factor in our multi-sectoral approach. And so I would say that we need to ensure that we perpetuate the lessons that we've learned and that we continue to use these interventions and tools to prepare for future emerging and future health emergencies and other public health threats that may occur. So I think, therefore, that it's important for us to take note of this. Thank you very much.
Thank you very much, Mr. Sarr. And an informative presentation. I think you really demonstrated the power of the Senegalese community coming together, collaborating, the state, civil society, private sector researchers, and more to ensure that we're working collectively to stop the spread of COVID-19. Thank you for taking us through that. I'm going to go straight now to hear from the next speaker, Dr. Pierre Somse, Honorable Minister of Health and Population of the Central African Republic. Minister, the floor is yours.
Merci, Madame la Présidente, Madame la Directrice.
Thank you, Moderator. Thank you, Regional Director. Dear colleagues, brothers and sisters, Ministers of Health, distinguished guests. Let me start by thanking the Regional Director for having kindly involved me in this exchange and thereby giving me the possibility of sharing the experience of the Central African Republic as a country in conflict and dealing with a humanitarian crisis. In the earlier session, I expressed concern with respect to the need to take into account the humanitarian context. But let me say that beyond that, we would like to appreciate the role played by the Regional Director in connecting us with the world and making our the voices of the weakest heard by involving us in various communication initiatives at global level, which have made it possible for the media and through the media the citizens of the world to be aware of our situation. As you know, Central African Republic is experiencing the COVID crisis against the background of a humanitarian context, alongside chronic political and health instability, with all the consequences such as poor health, vulnerability, and high risk. Next slide, please. Here you see the various indicators. I won't dwell on those, but what needs to be noted perhaps is that
déjà vu pour une situation humanitaire, c'est le fait qu'on est un pays enclavé.
Humanitarian situation may seem to be something that you're familiar with, but remember that we are a landlocked country dependent on neighboring countries.
Concentration d'étrangers.
We also have a high concentration of foreigners, which means there's a lot of mobility, especially with the peacekeeping missions that are constantly in and out of the country, as well as foreign armies that are in our country from time to time. And there is frequent rotation amongst them. In addition, we have the armed groups, which are true connectors, and they have connected all the parts of the country with the
humanitaire.
Zones that are insecure and that have humanitarian crises. So our approach was measured and prudent in order to enable us bear in mind our vulnerability and, above all, ensure a balance, which of course is unstable. Because of this, we have not followed the traditional path. We did not adopt the measures such as state of emergency. We did not lock down families. We did not punish those who did not respect the restrictions. So lockdown was partial and limited in time and space. So our vision in the circumstances was that the population of the country, next slide please, needed to quickly go back to a normal socio-economic, cultural, and health life and begin to live with COVID. And with two major objectives: to limit the progression of the pandemic and also limit cases of death. This was a combat that mobilized all sectors of leadership, and there was perfect alignment at the various levels, at the level of the president, at the strategic level represented by the Minister of Health, as well as the operational level, as you can see with the organogram. We had to set up a special COVID unit, and we were lucky that this was headed by a colleague that used to work with the WHO and had just retired and was willing to head this center. This was extremely important for us. With this organogram, with this arrangement, we were able to come up with a national plan with a major health dimension at its center. Next slide, please.
Donc, ce plan national était articulé autour de 7 axes stratégiques.
There were 7 strategic axes of this national plan. We have the strengthening of coordination, surveillance, intensification of preventive measures,
Diapo suivant.
etc.
Particulièrement guidés dans notre lutte par des principes.
In our combat, we were guided by very clear principles, public health and epidemiological principles. One, is that the combat should be based on public health. Because at the beginning, there was a lot of pressure. There was a high risk of the combat being politicized in a country. There was also panic that started because information was coming in telling us about lots of people dying, and this created a lot of irrational panic. And everybody felt that they were an authority on the combat, and felt they could give instructions to the minister, and so on. So we needed to ensure that the combat was based on public health and medicine, and that it was also evidence-based. We also ensured continuous analysis of information coming in, and we reviewed the combat midway, and above all, we monitored the epidemic and broke it into 4 phases, just as we did when we had the combat against AIDS. We had the silent phase, we had the phase of disease and the phase of high mortality, as well as a phase that has to do with the consequences of all of that. But the difference is that in the case of COVID, all these phases overlapped one another. So this is how we operated and thereby adapted our response to the realities. We also had a zero regret approach. In other words, we adopted methods and solutions that we felt were suited to our context. For instance, for chloroquine, we did not stop to think. We applied it immediately, and whenever there was fresh information on treatment, which we felt was useful, we used it. We applied it. At operational level, as you all know, we based it on the 4 actions, which is to screen, isolate, monitor. We also decentralized the functions of the various decentralized facilities. Next slide. Next.
Et donc, tout à l'heure, comme je le disais, nous avons fonctionné.
As I said, we operated in phases, and today we feel that we're at phase 2 of this outbreak in our country, because we do have cases. We have had some deaths. We have not attained the death rate that we feared. And so we changed our approach. In phase 1, which is a visible phase, we did not have any cases. Rather, we had a lot of asymptomatic cases.
L'accent était surtout mis.
So, accent was placed on active screening at borders and case search and care for cases identified, as well as surveillance of mortality rates. In phase 2 today, we changed our approach. We no longer screen asymptomatic cases, but rather we concentrated on the search for cases with showing signs so that we can care for these cases early and thereby limit mortality. We have therefore decentralized screening to many of our health facilities. And we connect these health facilities with the central laboratories. We have two. We have the Institut Pasteur and the National Laboratory. So we emphasize case monitoring and for cases that are at high risk in order to limit cases of death. So what we ensure is that persons that have underlying conditions but have COVID are quickly screened and cared for. and that they be educated as to the state of risks that they're facing. Also, in order to be familiar with the trends in the epidemic, we have a sero-epidemiological survey carried out so that we understand the trends in the infection, because now we are concentrating on cases, as well as trends in specific groups that we are monitoring, especially the vulnerable groups that we need to protect, such as healthcare workers, pregnant women, etc. We also have community-based surveillance. So we have teams that go from household to household to look for cases within the communities, because we realized that in about 3/4 of the death cases we had were people who fell sick in their communities and did not go to the hospital. So we go in search of these persons, and at the same time,
nous renforçons d'autres activités de santé, la continuité.
Strengthen other activities. We strengthen other activities such as immunization. With regard to isolation, initially we were screening asymptomatic cases and isolating them.
Diapo.
Next slide, please.
Diapo. Voilà, donc pour l'isolement, donc ça s'est passé bien sûr.
Isolation. This was in two phases, as I explained already. In the first case, we isolated the asymptomatic cases and sought out their contacts. In the second phase, it's only the sick that we isolated, and we take care of them in the treatment centers or at home. The previous slide, please.
Donc, le traitement, bien entendu, on a adopté les protocoles.
Treatment, obviously, we follow the traditional protocols with chloroquine at the center, because for us, chloroquine has proved its worth because it quickly treats the sick. And we saw a clear difference between those who were treated early and those who were not. Of course, we don't use chloroquine when the disease is well advanced. The protocols were adapted to the evolution of global knowledge and to WHO recommendations. In the second phase, we also emphasized treatment at home as cases increased, and we did not have enough facilities in the hospitals to admit everybody. So we had measures we put in place for those who were kept in hospital or kept at home, as the case may be. In this phase, we also strengthened our care for persons with comorbidities, especially those with diabetes, which is quite widespread. One thing that came out of this is that it has highlighted the need to pay attention to non-communicable diseases. And so now we are developing a strategy to make medicines accessible to those with hypertension and diabetes, because this is one of the reasons why they are vulnerable is that they don't accept treatment because it is too expensive for them. And so that makes them vulnerable to COVID. So we accepted, we got the government to accept the possibility of free treatment for them.
Suivant. Donc, nous sommes en train de renforcer la surveillance assise communautaire.
At the moment, we are strengthening community-based surveillance so that we can have early screening of cases.
Une logique basée sur une trilogie, basée sur nos observations.
Therefore, based our action on observation.
À la base des retards, c'est
because we realized that one of the reasons where there is delay in treatment is because of the similarity between symptoms of malaria, of flu, and of COVID. So people get treatment for malaria, and then afterwards we see the conclusions of COVID come and they're taken by surprise. So we're working on the trilogy of malaria, flu, and COVID. So anybody that shows any of those symptoms is screened and placed under observation. They are considered a suspect case until otherwise proven. At this stage,
Minister, if I could please ask that you wrap up. Thank you very much.
You let many people speak longer. Excuse me. Lever des mesures contre les églises.
You still have a few minutes to wrap up, sir, but please do stop. Thank you. Thank you.
Donc, je dois finir maintenant, parce que vous avez laissé des collègues parler 25 minutes.
But you let other people speak for 25 minutes, madame. But anyway, I'm almost done.
Je ne peux même plus pas bien présenter mon... Donc, je dis que je parle donc de la surveillance communautaire. Je vais passer tout cela.
I was talking about community-based surveillance, but I'll leave that and conclude.
Nous avons également accordé une importance à la continuité des services. Nous n'avons pas rompu, nous n'avons pas arrêté les services
that our
de
services
vaccination.
continue. We did not stop our vaccination services. Next slide.
Vous mettez du temps pour passer le diapo et vous interrompez.
You're spending so much time changing the slides and then you start interrupt me. Next slide. Next.
Diapo. Diapo.
Next.
Bon. Diapo. Bon, je vais m'arrêter un peu sur ce graphique.
Wait,
revenez en arrière, s'il vous plaît.
Let me stop for a moment and talk a little bit about this graph. Please move back. This graph quickly shows the curve that is going down, and that is simply because of a change of strategy. But we observe the trends that have been mentioned by colleagues, and that is a reduction in the number of cases. Does it mean that there is a reduction in the number of infections that are circulating? We're carrying out a survey to enable us answer that question. Next slide. Next slide.
Diapo.
Next slide.
Diapo.
Next.
Voilà, donc j'ai une liste de défis.
Well, I have a list of challenges, but since you asked me to stop, you'll see that we have a long list of challenges, but I won't dwell on that since the slides will be shared. Let me conclude.
Please do go ahead with the challenges. Please do go ahead. We will not restrict that. Please do go ahead. Thank you.
Thank you for your understanding, your flexibility. Donc, je veux m'attarder un peu sur les défis.
Let me spend a little time on the challenges. As you can see, we have quite a lot. There's a challenge of resources.
400 milliards de francs CFA de budget.
We had 400 billion CFA francs as budget for COVID, 33 billion for the health sector.
Les financements ont été mobilisés, mais cela
Funds were mobilized, but they have not even reached 1/3 of the figure. The resources that were pledged are not always made available in time. Some of them since April, they have yet to be disbursed. Available resources are not always managed with the government, especially where the humanitarian actors are concerned, because they often prefer to work with their NGOs. So there are lots of gaps there. There's the economic interdependence, which makes it impossible for us to close our borders. which means that we are vulnerable to cross-border transmission with countries like Cameroon that had a serious outbreak before us. Then insecurity, which should have protected us because people are not open to the world, but we have populations that cross borders and go to the insecure zones. We also have humanitarian and peacekeeping missions, which are high-risk groups at the end of the day, and also are exposed to the populations. And finally, we have the armed groups that are also mobile and cross the borders. And amongst them, we also have traders. And the first cases we had were actually from that category. Insufficient screening capacity was another challenge. Low capacity in the health facilities. Stigma, that's a major point. And this stigma is not only against the sick, but also humanitarian workers who have been stigmatized because they were seen as coming from outside. The same for foreigners, especially in some locations. It was the foreigners that brought in the first cases of COVID. And then there's continued denial of COVID and a high level of tolerance for the danger. This is something we observed in a humanitarian area where there was a lot of violence. We found that danger has become a way of life. People are used to seeing people being killed or dying. So really, talking to them about COVID didn't mean anything to them. This, of course, is to be expected in a country in conflicts because danger becomes a way of life and it's something they see all the time. There is also the risk of importation. I mentioned that as a result of the various partners. In light of all these challenges, we are reviewing and revising our plan, our plan of action. One other challenge I should mention is misinformation. We are often, people say that this is a Western disease, a disease invented by the Western world to decimate Africans. This is something that has impacted negatively on vaccination and the sharing and acceptance of the message. Let me conclude by expressing our gratitude to a group of partners, the public sector, the UN system, particularly the WHO, as well as the partners such as MINUSCA, the private sector as well as regional and continental organizations, African Union, ECAS, etc., all of whom have contributed tremendously, and above all, countries like China, which has played a key role. Without China, we would not have been able to effect our screening. On this note, I would like to thank the regional director, all the same, who has been very active in terms of relations with the countries in spite of all the challenges. I thank you all.
Thank you very, very much, Minister, for that, and really sharing Central African Republic's experience in responding to COVID-19, the pandemic, in a complex humanitarian setting. We really appreciate that. We move now to open the floor to questions, but even more importantly, I think statements from ministers. And so the WHO Secretariat will support me at this point. You may put your hands up just to indicate that you, and I do see them coming up. And I will ask the Secretariat to assist us in identifying which hands went up first. My request is, please, let's keep it at 2 minutes. We're not doing well on time. We want to take as many views as possible. And so handing over now to the Secretariat for our first list of speakers. Thank you.
Thank you very much, Julie, and good afternoon to all the colleagues. So in terms of the countries that have raised their hands, I noted that we have Niger, Algeria, Cote d'Ivoire, Mauritania, and Guinea, if we can start with those first 5 countries. So we have Niger, Algeria, Cote d'Ivoire, Mauritania, and Guinea. Over to you, Julie.
Thank you so much. Niger, Minister, the floor is yours.
Merci. En réalité, moi, c'est pas une intervention, c'est une proposition.
I would like to make a proposal.
Impératif, tant que je vois
in
en train
view
de.
of our time constraint and in view of other interventions from the other ministers. I think we should finish with the interventions first and then have general discussions. Because it's the same concerns and the same challenges and the same solutions that will be proposed. So you might as well give the floor to the other ministers first and then we take the discussions after. Thank you.
Thank you very much. Very wise and agreed. So we shall request that we take the statements and discussions will follow, I think, after the panel session. Let me call on Nigeria. The floor is yours.
Thank you very much. Bonjour. Madame la Présidente, Madame la Directrice régionale, Excellences, Mesdames et Messieurs les
Madam Chair, Regional Director, Honorable Ministers, distinguished guests.
La 10e Assemblée mondiale de la santé en mai 2017 avait retenu pour thème
The 2017 World Health Assembly recommended that the best systems should be put in place for sustainable development so as to strengthen the health systems and ensure universal health coverage and ensure preparation for health crisis. Unfortunately, this virtual session of the RC70, which is taking place in the context of global crisis as a result of COVID-19, reminds us of the need to further strengthen health systems to make them more resilient and capable of dealing with any health crisis.
Since any system
that seeks to improve health has to have a sustainable approach, Algeria feels that the financial question should be decisive.
Il sera crucial de recourir à d'autres ressources.
It would be therefore crucial to ensure additional resources, for example, innovative financing, and also a recourse to non-financial solutions, such as experience and knowledge sharing.
Des autres activités de santé dans le domaine des maladies transmissibles et non transmissibles.
We must not give up on our attention to other health concerns. We also need to ensure vigilance so as to ensure sustainability of health concerns. And of course, we need to take into account all the various pathologies. Algeria has been doing this by making the resources available. Political commitment has been shown through, has been robust. Also, the vaccines are being manufactured, and we believe that our region should mobilize in such a way as to ensure that it has equal access to the new vaccines. My country feels that the commitment of the heads of state and government to the Addis Ababa program of action from the conference on health sector financing will ensure sustainable development in a spirit of solidarity. The global approach adopted by the WHO on the matter of vaccines should also be encouraged.
en espérant que les populations de notre
hope also the populations of our regions will be able to benefit from the expected vaccines for COVID. In conclusion, I wish to mention that Algeria supports the need for the WHO to tackle these challenges. We have a lot of common challenges, and we believe that we need to share our experiences, think together, and develop North-South and South-South partnerships so that we can have appropriate solutions to the various needs of our respective countries. Thank you.
Thank you very, very much. Côte d'Ivoire, you have the floor. Minister?
Oui, modératrice. Madame la modératrice.
Côte
d'Ivoire?
Niger has muted his mic.
Minister,
the Honorable Minister of Niger, the mic is muted.
I see you are trying to speak, you're on mute.
Oui, j'ai une observation.
I have an observation. Before you give the floor to Côte d'Ivoire, are you hearing me?
Yes, sir. Please go ahead.
Oui, j'ai fait une proposition. Je ne sais pas
I made a proposal. I don't know if it has been adopted. If you did, I was the first to raise my hand, and I should read my statement.
Please, sir, you may go ahead and read your statement. I assumed your hand was up to just make the proposal. So please go ahead, and then Côte d'Ivoire will follow. Go ahead, Minister. Thank you.
Merci.
Thank you.
Madame la Présidente, et Monsieur le Directeur Général de l'OMS, Madame la
Director General, Regional Director for Africa, distinguished delegates, ladies and gentlemen. Allow me first to express my greetings and congratulations to the chair, as well as the other members of the Bureau for their brilliant election, and to assure them that we were fully in support of their efforts. I would also like to congratulate Dr. Tedros, WHO Regional Director General, as well as Dr. Moeti, RD for Africa, for the various achievements for the benefit of health in the world in general and in Africa in particular. Madam Chair, at the beginning of December 2019, the country was confronted with COVID-19, which today affects all countries and all continents. The health crisis resulting from it has had serious human, social, and economic consequences. Niger, like other countries of the international community, was affected by this public health event. And the first index case was on 19th December 2019. To tackle this, the government, in collaboration with technical and financial partners, including WHO, have taken a lot of measures, such as the closing of places of worship, the introduction of a state of emergency, closing of borders, development of a preparedness and response plan, establishment of collaboration committees to manage the crisis, and decentralization of screening and care, organization of a donor roundtable, preparation and dissemination of strategic documents all over the country, as well as the introduction of rigorous lockdowns in the country. Today, some of these measures have been softened, such as the opening of the air borders and the opening of places of worship. These measures help to contain the spread of the pandemic. At the same time, we need to remain vigilant at global and sub-regional levels. Madam Chair, this crisis is also happening within a national context characterized by persistent insecurity in the Sahel region. This is why it is imperative to and even urgent for our countries to invest more in the health systems to make them more resilient so that we can tackle this challenge, as well as other emerging diseases, and ensure the provision of all healthcare services. Finally, allow me to thank the WHO and other partners, bilateral and multilateral, for the assistance they have given in the prevention and management of this pandemic at the time that we needed it the most. We wish to urge the entire international community to mobilize around the WHO in order to quickly ensure the production and distribution of vaccines.
Au nom du président de la République,
Finally, on behalf of the President of Niger, His Excellency Al-Haj Yusuf Mamadou, I would like to thank the Regional Director and the Director General of WHO. I thank you for your attention.
Thank you very much, Minister representing Niger. We have a timer. I will request that you monitor the timer, and please, the tighter we are, the more people we can hear from today, the more the more statements we will have. To the Minister for Côte d'Ivoire, thank you for your patience. The floor is yours, sir.
Merci, Madame la Présidente.
Thank
Merci.
you, Madam Chair. Thank you, Moderator. Côte d'Ivoire had prepared a video. I don't know if the video, if we can show the video, or I should just make my intervention.
We can indeed show the video. Thank you, sir. I will ask the Secretariat team to now play the video. Thank you, sir. The video will be played.
Merci.
Thank you.
Monsieur le Président de séance,
Madam Chair of the session, Regional Director, first
avant tout propos,
and
je tiens à
foremost, I would
féliciter
like to congratulate WHO Afro
leadership
for
dans la
its
gestion de
leadership
la
in the management of the pandemic,
due à la maladie
the
à coronavirus
coronavirus
2020,
pandemic,
COVID-19, qui ébranle le
COVID-19,
monde entier,
which has shaken the entire world.
sociale
It sorely tested the
La
health
Côte
systems
d'Ivoire,
of our
à
countries.
l'instar des autres
Côte
pays du
d'Ivoire,
monde,
like other countries of the world, is confronted
au
with
nouveau
the
coronavirus COVID-19.
disease COVID-19.
Le
Its
premier
first
cas de
case
COVID-19
was
a été
confirmed
confirmé
on
le 11
11th March
mars 2020.
2020. The
Le gouvernement
government
s'est fortement
mobilized
mobilisé par
by
l'élaboration
developing and
et la
implementing
mise
a health
d'un plan de
response
riposte
plan to the
à
tune
hauteur
of
de 85
$85.5 billion
CFA, soit
CFA francs, that is
191
91 million US dollars,
qui a permis
with which we were able to
des
make hospital
disponibilités
facilities more
hospitalières
available
par la
by
construction de
building
nouveaux
more
dispositifs
and
hospitaliers
also
et
by
par l'augmentation
increasing the
de la capacité de prise en charge
capacity
de
for
697 nouveaux lits
provide
d'hospitalisation,
care by
dont
providing many
71
more
lits de
hospital
réanimation à
beds
Abidjan. Pour l'intérieur
within
du
the
pays,
country.
388 lits,
388
dont 98
beds
de
were made
réanimation.
available in the hinterland.
Mise en place de 13 centres d'accueil
Screening centers were also made available in the communes of
et
Abidjan,
l'opérationnalisation
and
de
more
plus
than
de
50
50 équipes
rapid intervention
d'intervention
teams
rapide.
were deployed. We
L'acquisition
also
d'importants
acquired
stocks de
important
matériel
stocks of
et de médicaments
materials and
contre
medicines,
COVID-19
as well
ainsi
as
que d'équipements
PPE.
de protection individuelle.
Madam Chair,
Monsieur le
my
Président,
country
mon pays a
developed
bâti
its response
poste
plan
contre la
on the
COVID-19
basis
sur la
of the strategy of screening, isolating, and treating. By 13th
À la
August
date du
2020, the epidemiological situation of Côte
de la
d'Ivoire
COVID-19 de la
shows
Côte d'Ivoire
that out of
montre que sur
108,000
108
cases tested,
testés, on dénombre
16,800 cases were positive, 3,500
décès. Un taux de
cured,
guérison
and
supérieur à
over 100 deaths,
80,08% et une
which gives
létalité.
us a lethality rate of
Ces dernières
0.73%.
semaines,
The rate of positive cases varies from 6 to 8%. We note with satisfaction that the rate of hospital admission is less than 20%. Management was multisectoral and coordinated by a high-level center with prompt and efficient mobilization of resources. Today, our major resource is to learn to live with the presence of the virus as we respect the restriction pending the availability of vaccines.
Monsieur le Président,
Madam Chair,
la Côte d'Ivoire félicite le bureau
congratulates
régional
AFRO
de l'OMS
for the actions taken in the fight against the COVID-19 pandemic and encourages it to forge partnerships to deal with the various challenges facing the countries of the African region. I thank you for your attention. Thank you, Madam Chair.
Thank you very much. A statement from Côte d'Ivoire. We move now straight to Mauritania. Over to you. Mauritania, the floor is yours.
Madame la Présidente, chers collègues,
Chair, dear colleagues,
directrice régionale, après
Director,
je m'en vais directement.
the traditional expressions of gratitude, let me just say that in Mauritania, today, after testing 1.75% of the population, we feel that the evolution is favorable, even though we are not totally sheltered from it. We have had 6,000 cases confirmed, 600 cases confirmed. We have drawn 6 main lessons from this. The first is that the personal commitment of the president and the commitment of the entire government is decisive as they put in place a special fund to fight COVID. Second lesson is
la précocité des mesures, leur génération et leur appropriation par la population.
Early action was decisive also. 3, total transparency towards the population and the management of the outbreak made them take ownership of the fight. 4, the personal commitment of the healthcare workers makes up for the lapses in the system. 5, there's the need for progressive adaptation of the measures on the basis of evidence, and this is crucial. 6, coordination with the UN system was decisive for effective management. We do appreciate the support of the technical and financial partners.
Thank you, sir. Please wrap up.
As well as the commitment of the government. We recommend regional and sub-regional exchange should be strengthened in the spirit of international solidarity. Also, the guarantee of equitable access to any new vaccine. And finally, strengthening of our health systems to make them resilient to any subsequent emergencies. Thank you, Madam.
Thank you, Minister. And we can hear the aligned responses, the statements asking for strengthening of health systems, access to vaccines, and we hear the common messages coming out. Going straight now to Guinea. Guinea, the floor is yours. Minister.
Oui, Madame la Présidente de la 72e Assemblée.
Madam Chair,
Madame la
70th RC.
Madame la Directrice Régionale.
Regional Director. distinguished guests, honorable ministers, allow me first of all to express to you the greetings of the President of the Republic for the constant support of the WHO since the beginning of this pandemic. The first case of COVID-19 was on 12th of March 2020. To date, we have had 9,000 plus cases.
Global de 10,5%,
which means that we have 10% cases positive and 53 deaths. The outbreak has covered the entire country.
38 ont signalé du moins des cas positifs, ce qui fait un pourcentage de 44%. Les cas sont
Health
asymptomatiques.
facilities have had positive cases. Most of the cases are asymptomatic. We have used hydrochloroquine and azithromycin to treat them. We are also exploring plant-based treatment. As demand increased, we have also introduced rapid testing. The country has not had any lockdown, but we have had a health emergency declared for 4 months. Schools, leisure centers, and places of leisure have been closed, and the use of masks is in force. We have opened the air borders and land borders in the last 1 month, and we have strengthened control measures on the arrival and departure of travelers. The major challenges now have to do with decentralization of laboratory activities to the regions and the procurement of inputs, as well as availability of services. Thank you.
Thank you. Thank you very much for that, Honorable Minister. The challenges noted, the progress noted. I go now. We have had a series of videos that have been sent in. I will go now to Angola, the Minister of Angola coming to us on video. Thank you.
Madam Chair of the 70th session and Regional Director of the WHO Afro. The document regarding human resources, the situation in Africa indicated quite a few gaps in various areas. In the last 3 years, the Angolan government has carried out various efforts to try and reduce these gaps and to try and overcome the areas of shortages. In the HR area in 2018-2019, after the necessary candidatures, we allowed another 1,620 health resource workers to work with us. We've also increased our medical assistance, and we've also provided equipment to 19 health centers and the first level and primary care areas in various regions and districts. We've also equipped 8 specialist health facilities. And this program benefited the country with another 580 beds. In 2019, many of our health facilities were provided with the necessary equipment, as well as ensuring a better time management. Despite all these progresses that have been made, the COVID-19 pandemic, which is systematically affecting the economy and the health of all countries, has also become a threat in Angola for the area of UHC attainment. It's also put at risk the Sustainable Development Goals. So more than ever now, the principles and the primary KSB services become very important and strategic so that we can reposition our health priorities. Thank you very much.
Thank you very, very much for that. Very concise and focused. As we prepare for the video from the Minister from Cabo Verde to play, just to restate that Angola is working to reduce gaps and really, overcome areas of shortages. And we're seeing once again that these are common gaps. There are a lot of similar things happening around our different member states. I'll go now to Cabo Verde, the video. Thank you.
Regional Director for WHO Afro, Dr. Mweti, Honorable Ministers, distinguished colleagues, heads of delegations. At the outset, allow me to salute this 70th session of the WHO Regional Committee for Africa, a session that is being held under a new format due to the SARS-CoV-2 pandemic. Allow me also to salute the efforts of all countries and the WHO in containing this virus, as well as supporting the recovery of infected persons. Our continent of Africa, which has been afflicted not only by vector-borne diseases, including malaria, and waterborne diseases such as cholera, as well as HIV, now faces this pandemic, which is placing an added burden on our already fragile health systems. The WHO health strategy makes sense now more than ever. Madam Regional Director, distinguished participants, this is a moment of great challenge, yet also of great opportunities, for we can make the health sector the top priority sector of all public policies. We have the opportunity to improve the allocation of human and financial resources for health, and also to introduce the necessary adjustments to good governance of this sector. We have the opportunity to promote and strengthen public and private partnerships. We have the opportunity to innovate, improve, and even optimize the existing health technologies and digital health. We believe that we will overcome what is undoubtedly one of the greatest public health challenges ever faced. We also believe that we will be able to tackle COVID successfully, despite the fact that many cases are asymptomatic, thereby increasing the risk burden on our hospital facilities. Our country needs more human resources for health. We need intensive care doctors and nurses, but also epidemiologists and laboratory assistants in order to improve our response capabilities in detection and isolation of new cases. We are involved with many important bilateral as well as multilateral health development partners, such as the WHO, the UN agencies, World Bank, Global Fund, and other partners who have provided essential support to Cape Verde, and for this we thank them. Thank you, and I wish you all a fruitful 70th session of the WHO Regional Committee for Africa. Thank you.
Thank you for that. There, yes, a moment of great challenge and of great opportunity as well. And they say never let a good crisis go to waste. With that, we go now to hear from Congo. Thank you.
Le Congo a notifié son premier
declared
cas
its first case of COVID-19
le 14 mars 2020.
March 2020. As of 20th August, 26,000
On the
plus cases
20th
have
of
been
August, we
carried
had
out.
already conducted 26,000
3,800 plus
tests,
cases were positive,
and we had more
which
than
is a rate of
3,000 cases
14%.
that were confirmed with a case
2,500
fatality ratio of
active.
1.3%.
60% men.
The most affected people are males of the ages between 30 and 39.
50 and above with comorbidities.
And most of the people that are dying are people with comorbidities, people that live in the urban areas, so our rural areas are not that affected, and we are applying a lockdown measures.
Taken by the
Congolese response strategy is focused on screening and testing intervention. as well as the treatment of
To
confirmed
do this,
cases.
a
We
response
have
plan
also
was
got
developed
a
for an
response
estimated
plan that
cost of
was
22
developed
billion in order
with
to
a budget of
build the
22
capacity of the
million to
country
strengthen
to
our
respond
country's
promptly and
capability
effectively.
to
In
respond
terms of
to
institutions, the response is coordinated at the highest level by the president himself
de la riposte.
within the National Response
La task
Coordination.
force évalue
The
l'impact
task force
socio-économique
evaluates
de la
the
COVID-19.
socio-economic impact of
Le comité des experts
COVID-19,
donne des
and
avis
the expert
scientifiques.
committees give scientific opinion.
Présidé
The
par
technical
Madame la
committee, chaired by the Honorable Minister of Health,
de la
is the
mise en
organ responsible for the implementation of the response plan.
œuvre pour
A
garantir le
COVID-19
financement de la
fund was
riposte.
set up to guarantee the funding of the response. In terms of achievement, 59 rapid
83
intervention
points
teams,
d'entrée et de
83
contrôle
entry
sanitaire
points
ont été mis en place.
and health
6
control points were
laboratoires
set up. 6 laboratories were
labellisés
equipped
COVID-19 avec une capacité de 1400 tests par jour.
with
6
a capacity
hôpitaux
of
dédiés à la prise en
1,400
charge
tests
des
daily.
malades COVID-19
6 hospitals
réhabilités
were
et équipés
earmarked
par le
for
gouvernement
and
pour une
equipped for
capacité
the care
d'accueil
of
de
patients,
150 lits,
and they
dont
can
au
take.
moins en
They have
réanimation.
750 beds, including
et
at least
contre
3 for intensive care.
pour la réduction des risques
A
et le
vast
déploiement par la
communication
force
problem
publique.
for risk reduction
3723 agents pour
is
sécuriser les
also in
interventions sur le
place
terrain renforce ce dispositif. Nos défis concernent
in order to support
la
this
mobilisation de fonds
arrangement.
pour la
The
riposte,
challenges
les
have to do with
capacités de gestion
mobilization of
d'éventuelles
funds,
flambées épidémiques avec
capacity for management of possible outbreaks with the imminent opening of
et intrants
borders,
de laboratoire.
procurement of equipment and
Recommandation,
laboratory inputs.
il est
By
important
way
de
of recommendations,
les
we feel that
capacités
it is
des États
important
à
to build the
acquérir des
capacity
équipements.
of states to procure equipment
Pour cela,
and inputs in
un
case
système
of
de commande
outbreaks.
groupée est à
So a
envisager.
group procurement system is being envisaged for this purpose.
Thank you very much for that, Minister of Health of Comoros. They're sharing what they've done and their challenges as well. Let us come of Congo. Let us come now to Comoros. So over to Comoros. That was Congo. Now, Minister of Health, Comoros via video. Thank you.
Merci, Madame la Présidente.
Thank you, Madam Chair.
Go ahead,
Hello,
please.
Ministers, Regional Director, distinguished guests, ladies and gentlemen. Allow me, first of all, to congratulate the Regional Director and the entire Secretariat for the untiring efforts they have been making to support countries so that they can deal with this common enemy, which is the COVID-19 pandemic. Madam Chair, dear colleagues, Regional Director, Comoros, like other countries, was recovering from the hurricane cycle, which affected the country in April 2019 when the outbreak of COVID-19 came. The gravity of the threat was serious in Comoros, which is an island country and with a rather weak health system. Unfortunately, this outbreak has simply come to add to the various challenges facing the country. In all humility and in the spirit of transparency, I wish to say that Comoros was the last country to receive CAR procured by the government last April. And with that, we were able to confirm the existence of the country at the end of April. To date, 2,000 cases have been screened. 118 cases are positive, and we have 7 deaths. Our partners like the WHO and the African Union, as well as the group of the private sector of Comoros, have also strengthened, given technical support for the procurement of diagnosis and group purchase. We seize this opportunity to thank them all, and in particular, the WHO Regional Director, Dr. Moeti, for her support and the special attention given to my country. Comoros would like to draw the attention of our states and our organization and all our partners to the need to strengthen health surveillance systems and make it central to the efforts to improve the health and well-being of all. Madam Chair, at this time of the pandemic, our country seeks to continue to ensure essential services, especially for chronic diseases, for immunization, and for maternal and child health, as well as emergencies and surgical interventions. The dialogues on policies and strategies to strengthen the resilience of health systems as well.
Minister, thank you very much. We do need to wrap up.
6 août 2020, un plan de développement intérimaire 2020.
An interim development plan for 2020-2024 is in place, and one of the objectives of the health sector is to promote a health system that meets international health standards, so as to achieve two important points by 2024, and also to ensure improved nutrition services. The support of the WHO in the quest for solutions to the problems of the weak health system in order to continue the services is desired. Finally, I plead for the WHO to continue to support the country in its quest for a resilient health system. Our situation does not make it possible for us to organize a response to enable us to deal with the outbreak in all the islands. And that's why we are seeking for support in terms of screening and case management, as well.
I will stop you. I will stop you.
Financier et logistique pour les interventions dans l'ensemble des îles. Et enfin,
as well as logistics in all the islands, as well as support for capacity building for the Ministry of Health in order to organize governance and coordination of health sector actors. Finally, we commend the affirmed leadership of our head of state in this combat. Thank you, Madam Chair.
Thank you, Minister. I will appeal to all who speak. If you take extra time, you actually take away time from a fellow minister to share a statement. Our appeal is within the time. We're going now straight to hear from Malawi, who are coming to us via video. Thank you. Comoros, Minister, would you kindly mute? Thank you.
Control activities in the country. The major COVID-19 control activities in the country include: 1, disease surveillance, which is done in line with WHO Integrated Disease Surveillance and Response System, IDSR. The country so far has accumulative cases of 5,382 positive cases as of August 22, 2020. The new cases are at 60. Unfortunately, the cumulative number of deaths at 168. On laboratory testing of COVID-19, we have the capacity of doing 2,400 tests per day in the 43 laboratories across the country. On COVID-19 case management, the ministry has set up treatment centers in all regions of the country to make sure that COVID-19 patients get timely treatment. The ministry, together with our partners, we also make available PPEs to our health workers, such as face masks, gloves, boots, aprons, and etc., as well as to the community in order to protect them from COVID-19. Our Port Health Services section continues surveillance at ports of entry such as international airports, as well as border posts across the country. The other important activity we are doing are on risk communication and community engagement. The ministry continues sending COVID-19 prevention and control activities to the communities. These activities are coordinated by the Health Education Unit of the Ministry of Health. Last Chairperson, I would like to take this opportunity to thank our partners, including WHO, for the technical and financial support they continue to render to Malawi as a country in fighting against COVID-19.
Thank you very much,
thank you.
Honorable Minister of Health Malawi, for your very concise and informative brief. We go straight to video from the Minister of Health Rwanda. I'm hoping the team has this ready. Do we have the Rwanda video ready to play? If not, there we have.
The person of 70th Regional Committee for Africa, Excellency Director General of WHO, Dr. Tedros, Excellency the Regional Director of WHO Afro, Dr. Moeti, dear Ministers of Health, distinguished guests. The spread of COVID-19 virus has created unprecedented health crisis across the world. To break the chain of transmission, Rwanda has adopted a strategy for testing all suspect cases, contact tracing, and isolation treatment. More recently, the country introduced a home-based care system to ensure the treatment and monitoring of asymptomatic cases for COVID-19 in their homes. Electronic bracelets are used for effective enforcement of the home-based quarantine. 5 months into the pandemic, we conducted so far 300,000 tests, and as of now, we have 2,700 total cases with close to 70% recoveries and unfortunately 11 deaths. The supply chain was reinforced for faster procurement of all required commodities. As a digital-oriented nation, the government of Rwanda launched the use of drones for awareness campaign in certain communities and the use of robots in reducing contact between medical personnel and patients in treatment centers. A successful national response could not be possible without a very strong leadership, a resilient health system, a multi-sectoral approach, and the involvement of our communities in complying with COVID-19 preventive measures, including the lockdown. We call upon for international solidarity to avail all required financial resources to contain and mitigate socio-economic impact of COVID-19. I thank you all for your attention.
Thank you very much. Remarks there delivered from the Minister, by the Minister of Health Rwanda. At this point, the Chair, I think, would like to say a word or two, so I will hand over to the Chair, and then we shall move to part 3 and our panel session. Chair, over to you. Thank you.
Merci Julie pour l'excellente tenue de cette session.
Thank you, Julie, for the competent manner you have handled this session. I simply wish to remind us that we really do have to respect our time. We still have about 7 people who would like to take the floor. So I wish to appeal to the honorable ministers and their colleagues to respect the 2 minutes time allotted to each of us so that we can finish this very interesting session by 3:30, which is in 25 minutes. Thank you very much.
Thank you, Madam Chair, for that. And hearing what Madam Chair has said, I'll come to the Secretariat before we move to part 3. Are we able to take a few more statements? Let me hear from the Secretariat for guidance before we move to our panel discussion.
Dear Julie, thank you very much. Indeed, we have a number of ministers who have requested to take the floor, And I will read out the names, and thereafter you can declare that the list has been closed. We have the ministers from Ethiopia, Liberia, Kenya, Mali, Guinea-Bissau, Sao Tome and Principe, Burkina Faso, DRC, and Nigeria. I'll repeat the list: Ethiopia, Liberia, Kenya, Mali, Guinea-Bissau, Sao Tome and Principe, Burkina Faso, DRC, and Nigeria. Thank you, and over to you.
Thank you very much. The request is let's keep within the 2 minutes, if possible shorter. Minister of Health, Ethiopia, over to you. Madam.
Thank you very much. Thank you, Madam Chairperson. Protocols observed, I would first like to thank WHO leadership and staff for the leadership and support you're providing to countries in this response to the COVID-19 pandemic. The government of Ethiopia has been responding to this pandemic since the end of January and made significant progress through engaging the whole of government and whole society in the preparedness and response activities. We have expanded our testing capacity from none in January to more than 20,000 tests per day in August, and to date conducted around 775,000 tests within 50 labs currently across the country. This is a great milestone, although we are not still testing enough yet, considering our population. We had also started a maintained screening of passengers at port of entry since the end of January, with mandatory quarantine for international travelers being in place for months since March, and recently introduced negative testing certificate with home isolation. In addition, our country closed schools, businesses, religious institutions, mass gatherings, among others, and declared state of emergency to enforce those. To address PPE availability, in addition to mobilizing resources, we're also working on enhancing local manufacturing through repurposing, but still facing challenges. However, with all these interventions put in place in collaboration with WHO and other partners, number of cases and deaths is dramatically increasing, with the socio-economic and political impacts of the pandemic being felt by all citizens in every corner. And this month, we have launched a nationwide campaign to enhance this response. And now we are at the stage where the government is evaluating how to balance reopening schools, reopening the economy, while ensuring the safety of the people. So finally, I would like to say that I believe African governments require WHO support more than any time in the past to guide all of us to safely reopen schools, economies, and cross-border issues and considerations with our context. And I also call upon WHO to continue its support in building, sustaining, testing, contact tracing, and isolation capacity, as well as clinical management capacity. Thank you very much.
Thank you very, very much for that. I move straight to the Minister of Health, Liberia.
Madam Chair, Minister, colleagues, and distinguished friends, let me begin by appreciating Dr. Tedros, Director General of WHO, for the timely pronouncement in declaring a global pandemic when it became necessary. With that information, it places every one of us on a guide in how to find a mitigating strategy based on country's context. Liberia immediately began to institute measures to safeguard her citizens. As a country, our first approach was activating the incident management system and deploying a precautionary observation strategy. We began to screen travelers coming into the country and instituted 14 days quarantine at our precautionary observation center, which was necessary to mitigate community transmission since it was clear that the disease would come through our airport based on risk analysis conducted. With support of laboratory reagents from WHO and other partners, Liberia was ready to reinvigorate her community engagement strategy after the index case. The key was the leadership support from His Excellency George Manuel Weah, the President, through the Presidential Special Committee on COVID that he chairs. Over the past couple of weeks, Liberia has been making a significant progress with 1,295 confirmed cases as of today, 84 deaths, of which 12 died in treatment units with 821 recoveries, giving us over 90% of recovery rate. Liberia is not complacent. We know that in dealing with virus epidemic, it becomes a challenge when you begin to see a single-digit rate of infection. This is when one has to become more vigilant in deploying different strategies that are contextualized per the community. It is like finding a needle in a stack of hay. In short, Ebola has taught us a lesson, and we are leaving no stone untouched as we deploy various mechanisms in making sure that Liberians are safe. It will be of significant benefit when we as Africans begin to innovatively find an appropriate way to integrate our response into routine health services. Liberia avails herself to additional experience and is willing to share her experience. Thanks, Madam Chair.
Thank you very, very much. We move straight now to hear from the ministry in Kenya.
Thank you, Rapporteur. The Republic of Kenya would like to thank the Secretariat for organizing this special event on the COVID-19 response in the African region. The world continues to face unprecedented difficult times due to the ongoing COVID-19 pandemic, which has continued to devastate lives and economies, as well as disrupting the way we live and introducing new normals. Chairperson Kenya recorded his first case of COVID-19 on 13th of March 2020. And as of 24th of August, we have recorded 32,557 cases, unfortunately with 554 deaths, giving us a case fatality ratio of 1.7%. We have conducted more than 430,000 tests spread across 34 laboratories in the Republic of Kenya. Like other countries, we have put in place various intervention measures, and we have begun to see the fruits of these measures as the cases have begun to decline. Madam Chair, Kenya is fully committed to providing our share of support towards COVID-19 response measures within and beyond our region. Our scientists will in the next few days be conducting local trials for one of the vaccine candidates, which has already reached phase 3 trials in the United Kingdom, Brazil, and South Africa. In addition, Kenya has contributed 50 multidisciplinary team of healthcare workers to support the surge capacity in Seychelles. In conclusion, Chairperson, Kenya wishes to applaud WHO for the critical role played in providing technical leadership and mobilizing resources from partners to facilitate timely containment of this pandemic. We are calling for collective efforts from all member states in tackling these menace. I thank you.
Thank you very, very much for that. We move now to hear from Mali. Over to you, Minister. Mali, are you with us? And perhaps you need to unmute.
Bonjour. Le Mali est là?
Yes, Mali is here.
Madame la Présidente.
Madam Chair.
Madame la Directrice Régionale de l'OMS Afro.
Regional Director, Honorable Ministers, distinguished delegates, ladies and gentlemen. First, on behalf of the government of Mali and the authorities of our country, I would like to express our sincere gratitude to the WHO for its leadership through the RD, Dr. Moeti, as they supported us as we deal with this unprecedented global health crisis. We thank the RD for the clarity of her report. My country is deeply committed to the implementation of the universal health coverage. We also intend to respect the Mali Action Plan, especially with the 5 pillars relating to health. We also like to thank the other countries for their support. COVID-19 came up at a very difficult time for our country. For more than 8 years, Mali has been confronted with an unprecedented security crisis, which has destroyed the health facilities and displaced the populations. This means that we have both insecurity and vulnerability, and it was in this context that this virulent virus, COVID-19, was notified by the WHO. To date, we have had 2,700 cases with 135 deaths. 2,800 have been healed. All these cases were taken care of in the isolation centers. But even before the first case was identified in Mali on 25th March 2020, the government had initiated a national response plan with the support of the WHO and the international community. It was a multisectoral effort for 52 million euros, which strengthened control measures at borders, emphasized a communication strategy, as well as a system for tracing contacts and care for patients.
Thank you.
The funds were also used to ensure that capacity was made available to the healthcare workers. We asked Malians to ensure physical distancing, but we realized that it is very difficult to lock down a community of persons living under precarious conditions. We commend the Malians for their efforts to fight this pandemic. The entire country adopted the program of immunization by 2020, and I thank you for your kind attention.
Thank you, sir. I go now straight to the Minister of Health, Guinea-Bissau. Guinea-Bissau, are you with us? And after Guinea-Bissau, we shall hear from Sao Tome and Principe. If you would be please ready, Guinea-Bissau, over to you. Minister, please unmute. Guinea-Bissau, the floor is yours. I think there may be a problem. We can come back to Guinea-Bissau. Let us go to Sao Tome and Principe. If you are ready, we shall hear from you. Minister?
Government of Sao Tome and Principe would like to greet the regional director of the WHO AFRO, as well as all its staff. I would like to congratulate you for the organization of the 70th edition of the WHO AFRO RC meeting. The document RC 70/70 talks about the scope of the COVID-19 response in our country, has had to take various measures and various decisions with regard to our contingency plan. We have got a crisis response plan that is led by our Prime Minister, and we have also declared a state of national disasters. We've carried out various awareness campaigns through radio and various other measures. We've also trained our healthcare workers so that they can understand the reality of all COVID-19 cases. There's the mandatory use of masks, as well as washing of hands and social distancing. And we also have required people to isolate themselves if they have any of the symptoms. There's also accountability in all areas. There's the daily information on radio, television, and newspapers regarding COVID-19. The ministry has created various multi-sectoral teams to follow up up on home-based care and treatment of patients, as well as providing food coupons and support to people. It is sometimes difficult to detect early and isolate cases, as well as do contact tracing, but we are trying in this area. And we're also using our community health workers so that they can ensure the surveillance of all patients at risk. The Ministry of Health and WHO have supported the training of staff in the area of COVID-19 response. The United Nations systems agencies, as well as bilateral, multilateral organizations, various personalities in the country are all involved in our COVID-19 response and in strengthening the efforts of our national health system. It is also important to say that all the results that have been obtained thus far are as a result of the involvement of everybody, especially our government organs that have been involved since the beginning, as well as our President of the Republic. So on behalf of the government of São Tomé and Príncipe, we would like to thank all those that have supported us in our efforts. At the moment, our challenge is in trying to coordinate all efforts and interventions to try and strengthen leadership, as well as the ownership of all these programs so that we can respond properly. There's also ensuring proper financing, ensuring that we get all the funds that have been pledged. I'd like to specifically thank our population for their behavior, as well as our armed forces, our security forces, and all our health professionals. It is due to them that we can survive this crisis. Thank you very much, and good luck to all.
Much appreciated. A reminder to all who are still to speak to please keep within the 2 minutes. Otherwise, we will have a challenge doing what we need to do before we close the session. Guinea-Bissau, Minister, over to you.
Excelentíssima Senhora Ministra da Saúde.
Your Excellencies, the Minister of Health and Population of Congo, Chairperson of the current session, Honorable Ministers and Heads of Government of Congo and Mauritius, Regional Director of WHO Afro, and distinguished ministers, representatives of the different institutions and organizations present, distinguished ladies and gentlemen. At the outset, allow me to thank the opportunity that is provided to me to participate in this 70th session of the WHO Afro Regional Committee. And I'd like to specifically thank the Minister of Health of the Republic of Congo with regard to the COVID-19 pandemic, which continues to concern the entire world and particularly our country, and in the absence of a vaccine or adequate therapeutics. It has now been 5 months since the declaration of the first state of emergency in Guinea-Bissau on the 27th of March 2020. This state of emergency has been renewed 7 times, and I'd like to share with your Excellencies what is the current epidemiological situation in the country. We have got 2,200 positive cases and 34 deaths. During the COVID-19 response, the weakness of our health systems, we have never been isolated. So we've received support. We've also received strong leadership from the President of our Republic, and we've also received support from ECOWAS, from the African Union, from the WHO, from the European Union, and all our neighboring countries and friendly countries, especially Turkey and Senegal. Ladies and gentlemen, the COVID-19 pandemic is far from being controlled all over the world, and Guinea-Bissau is no different. So this requires us to reflect very seriously and to take on board empirically based and evidence-based responses, especially with regard to the area of transmission and infection. It's also important for us to ensure proper use of all preventive and barrier measures to ensure greater accountability and better behavior by our communities. I'd like to conclude my statement wishing all of you fruitful discussions, and may we succeed in our efforts against COVID-19 pandemic. Thank you very much.
Thank you for that. I see the Minister of Health Burkina Faso is ready. Madame, over to you.
Yes, merci. Honorable participante, honorable participant, je salue la
Distinguished participants, I commend the holding of this 70th Regional Committee for Africa in this environment of the COVID-19 pandemic. I would like to congratulate and thank the WHO for its involvement from the outset of the outbreak through technical and financial support for countries, all of which made it possible to come up with response plans as well as training of health workers so as to limit the cases of infection, which is 114 in Burkina Faso with no deaths from the outbreak. I acknowledge the regional collaboration under the leadership of the African Union, ECOWAS, and of course the support of WAHO. I commend the ownership of the response by the authorities of my country, starting with the head of state himself, who called for unity of action at national level. And we responded. The private sector and other development actors were involved alongside the Ministry of Health. It was the private sector that supported us in the manufacture of masks with Burkina Faso cotton under the technical guidance of the Burkina Faso Association for Management of Quality. We commend the contribution of all partners who helped us to ensure continued health services throughout the pandemic. In particular, we have the precious presence of the WHO rep in Burkina Faso who supports us as we deal with the pandemic all over the country. For the strengthening of the health systems, Burkina Faso notes the need for better ownership by the countries of the COVID platform, the content of which should evolve alongside as knowledge on the disease is known. Burkina Faso goes along with all the initiatives and recommendations that will come out of this session. I thank you.
Thank you very much, Minister, for that. I come now to DRC, and straight after that, we shall hear from Nigeria. Please be on standby, Nigeria. Over to you, Minister of Health for DRC. Thank you.
Cher directeur de l'OMS,
WHO Regional Director,
Leurs Excellences Ministres de la Santé,
Honorable Ministers of Health,
Madame la Directrice Régionale de l'OMS,
Regional Director. In my country, the outbreak started on 10th of March 2020. To date, we have had a total of 9,800 confirmed cases, one probable case since the outbreak. We have had 251 deaths. That is a global mortality rate of 2.6%. The capital, Kinshasa, remains the epicenter with 80% of cases recorded at national level. This is not followed by the North Kivu province, which accounts for 6.1% of cases. Information available in our surveillance, epidemiological surveillance division shows that we have had 529 patients hospitalized and 526 with mild symptoms and 3 with moderate cases. To date, we have not had any declared cases of severe cases, but we do have some major challenges. One is the decentralization of laboratories for diagnosis. 2, management of travelers. 3, double outbreaks. As you know, in DRC, we have both the COVID-19 pandemic and the Ebola epidemic in the Equator province. In line with the decentralization of laboratories, we have already started this to other provinces, particularly Nokem, Gubu, Lumumbashi, and Kisangani, as well as with regard to decentralization with respect to COVID-19, efforts have been made to improve the process, as well as diagnosis capacity, and the time it takes for the results to come back. COVID tests are required 3 days before travels. With regard to Ebola in Badaka, we have already come up with an integrated Ebola COVID-19 response plan. Thank you.
Thank you. Thank you very much. Fantastic to hear there's an integrated response plan. I come now, this is the final statement from Nigeria. Minister, over to you.
Thank you, Madam Chair. Nigeria wishes to acknowledge the efforts of the WHO African region in supporting her states, especially Nigeria.
C'est vrai, mais pourquoi elle a parlé?
During this COVID-19 response. Following confirmation.
Ok, ça va. Ça va. Merci. Merci.
Yeah, may I request that the DRC Minister, would you please mute? Please do mute.
Sorry.
Thank you. Nigeria, back to you.
Thank you. Nigeria wishes to acknowledge the efforts of the WHO African region in supporting her states, especially Nigeria, during this COVID-19 pandemic response. You will recall that following the confirmation of the new virus, Nigeria established the Level 3 COVID-19 Emergency Operations Center at the Nigerian Center for Disease Control. She also established the Interministerial Coordination Committee on the response. However, following the declaration of a pandemic, the Nigerian government upped her response by establishing the Presidential Task Force on the COVID-19 response, which mobilized both human and material resources and provided strategic coordination of a whole of government approach towards the pandemic response. This gave this response the highest level of political support. This made the establishment of the PCF gave this response the highest level of political support. However, in order to adequately respond to this pandemic, we have also mobilized and established unprecedented strengthening of the response infrastructure. For instance, Nigeria has gone from 3 laboratories at the beginning to over 64 laboratories. We have also established positivity ratio from 19.7 and reduced it to 13.9 in August. The number of states with testing capacity has also increased from 2 at the onset to 32 out of the 36 states at the FCT. The average testing capacity has increased from 500 to over 3,500 per day. In addition, we have recorded several achievements, which includes, of course, the development of the National Strategic Health Sector Pandemic Response Action Plan with the support of the WHO and other partners. In moving forward, we are looking at further improvement in the testing and treatment of for the pandemic. We're also looking to increase and intensify risk communication, implement targeted subnational response, ensure transition planning, and operationalize the National Pandemic Response Action Plan.
Thank you.
Nigeria is willing and available to share her experiences with other countries in the African region. Thank you.
Thank you so much, Minister of Health Nigeria. They're closing out the statements. And just a change in our program, we will not be able to do the panel session justice, and we must move from this session to the next. So I believe it will be scheduled later. I want to hand back to the chair, but just as I do that, just hearing the comments from all our ministers, it is clear that there is more than ever before a leadership commitment and an opportunity to put health front and center on government priorities and really to build and strengthen public health systems. It has been repeated across the board. This is required. So now maybe more than ever, it's our chance to get it right. As I said earlier, never let a good crisis go to waste. How do we build resilience and improve our health systems? Also, just to point out, it is clear that the multi-stakeholder collaboration, the effort, the work at continental level, at national level, and at community level has been incredible. Needs to be continued, maybe intensified. But with that, Madam Chair, let me come back to you. Thank you.
Merci infiniment, Julie.
Thank you very, very much, Julie, for the high quality of the debate. This was a very passionate and interesting debate. Congratulations on all for a very lively working session. We now need to give the floor to the Ministry of Health of Equatorial Guinea, who was the last to ask for the floor. Before we close the session, Minister of Equatorial Guinea, you have the floor. Thank you very much, Madam Chair. Madam Chair, Madam Regional Director of WHO Afro, heads of mission, ladies and gentlemen. Since the 13th of March 2020, we have had 4,926 cases with over 3,000 people who have recovered and very few deaths. More than 90% of cases are asymptomatic, and there are still 900 cases active right now. 5,000 PCR tests have been carried out since the beginning of the pandemic, and 350 tests per 10,000 inhabitants. Madam Regional Director, Madam Chair, we would also like to signal that the rate has come down from 10.7 to 3.7 in the last few days. We have strengthened our laboratory capacity in the last little while by acquiring further PCR equipment and reinforcing our capacity so we can carry out 1,500 tests per day. After mass testing campaigns, on the 27th of August, we will be beginning a mass testing campaign, and we have been able to do this thanks to the decentralization of our response. We have also strengthened our response capacity by creating isolation facilities, and we have also set up an adequate treatment protocol. Madam Regional Director, we would like to thank you for the quality of the support offered to us by the WHO. We had an incident manager as well as 4 international consultants who have helped us deal with the COVID-19 pandemic in our country. In conclusion, we would like you to know that our strategy now allows us to publish daily data on our health ministry website, and we also carry out regular updates between the WHO and our ministry. Thank you very much. Thank you very much, Minister. At present, I think what we will now have to do is have a short 30-minute break, perhaps a little less than 30 minutes, because we now have a shorter period of time available to us for the break. Our work will pick up again with the celebration of certification of wild polio virus eradication in the African region. Given the fact that there is very little time left, we will now interrupt our work and the session to do with resilient health systems with a view to implementing UHC. That is part 3 of the COVID-19 session, in other words, which was to be presided by 4 eminent experts, will take place after the session on the celebration of the certification of wild polio virus eradication in the African region. That session will begin at 3:55, 5 minutes before when it was supposed to start, so that we can catch up a little. So we have 15-minute break before we come back for the next session. Thank you all.
One, two. This is a test. Can you hear me? 1, 2.
Are you talking to me?
Yes. If you are answering, is that you can hear me. Thank you very much. This is Geneva HQ doing a test.
Thank you. Yes.
Right, so it's the president of Nigeria who's coming to talk to the poor.
Hello? Hello, testing mic. Can you confirm hearing me, please?
Yes, we can hear you loud and clear.
All right. Thank you very much.
Allô?
Hello, Isham. Mesdames et messieurs, le ministre.
Excellences, Monsieur le Ministre, Mesdames et Messieurs, en vos grandes qualités, toutes les séances rigoureusement observées, Mesdames et Messieurs les professionnels médias, l'heure à laquelle nous arrivons est consacrée à la cérémonie officielle de certification de la région Afrique comme libre de polio, et le Cameroun en fait partie. Donc, notre pays également bénéficie de cette reconnaissance au terme des travaux qui ont été conduits par l'un des maillons essentiels de cette chaîne-là. C'est le professeur Ndeke ici avec nous.
Je souhaite un bon retour à tout le monde. J'espère que nous sommes prêts.
Welcome back. I hope that we are ready for the very next session. I would like to just say that following the previous session, we will now have the certification of wild poliovirus eradication African region, after which we will have the panel on COVID-19. But correction, they will no longer be the panel because the members of the panel will no longer be available. And so after this special event of celebration, we will go straight into point 21 of our agenda, which is the closing ceremony of our regional committee. So welcome back, ladies and gentlemen. Honourable delegates, distinguished guests, for those of you just tuning in, I am Jacqueline Lydia Mikolo, Minister of Health of the Republic of Congo and the chair of the 70th Regional Committee of the African region. After this very fruitful session on COVID-19, we will now continue our work with the special event for the celebration of the certification of wild polio virus eradication in the African region. Today is a long-anticipated moment in the history of wild polio virus eradication on our continent. It thus gives me great pleasure to be chairing this working session, during which the African Regional Certification Commission for Polio Eradication will make its final decision about the status of wild polio eradication in the African region. Over the course of this session, we will hear from a polio survivor, from global health leaders, and from polio eradication champions from Africa and around the world. We will also learn about the measures and the work that remains to ensure that Africa plays its part in securing a polio-free world. Before we begin, I would like to give a special welcome to His Excellency President Muhammadu Buhari, President of Nigeria, Mr. Aliko Dangote, Mr. Bill Gates, members of the Africa Regional Certification Commission for Polio Virus Eradication, and the leadership of the Global Polio Eradication Initiative. Also, the World Health Organization, UNICEF, Rotary International, the U.S. Centers for Disease Control and Prevention, the Bill and Melinda Gates Foundation, and Gavi, the Vaccine Alliance. Most of all, I want to extend my personal gratitude to the millions of frontline health workers, from vaccinators to surveillance officers, all of whom have dedicated years of their lives to fighting polio, and without whom today would not be possible. I know there are many people following us in many different countries, and I would like to pay tribute to them. Thank you. To begin today's event, we will be watching a short video with representatives of polio eradication programs in Africa, indicating what has to be done in order to halt wild polio virus in the region. I will now give the floor to the Secretariat so that they can show us this video. Secretariat, kindly show us the video.
Ridding a continent of wild polio, one of the most devastating diseases of all time, is one of courage, resolve, and collaboration.
August 25th, 2020 marks a huge day in the history of the fight against polio. After 4 years without a case of wild polio, the WHO African region has finally been declared free of wild polio virus.
Only a generation ago, in the early 90s, wild polio was paralyzing 75,000 children every year in Africa.
I was hospitalized for 2 full years. I was just sleeping in bed without even being able to turn your head, nothing. All I could do was just to talk, but I couldn't even move any part, even my fingers. I couldn't feel anything.
In 1988, the World Health Assembly endorsed a resolution to eradicate polio worldwide, launching the Global Polio Eradication Initiative.
In 1996, the African heads of state came together in Cameroon to declare their commitment to eradicate polio from Africa.
Also this year, the great Nelson Mandela with Rotary International launched the Kick Polio Out of Africa campaign, uniting Africans together behind a common goal: to vaccinate every child against polio.
Across the region, we saw an increase in investment, leaders rallying together, and communities mobilized all across Africa for polio eradication. We started to see a decline in the number of polio cases. It is then that we realized that it was possible to eradicate polio from Africa.
In many parts of Africa, there are areas of conflict, and anywhere there's conflict, then there's always that challenge to accessing children. You have areas that are hard to reach. There are geographical areas that have water, mountainous areas, desert areas.
It was necessary to use several means of transport, for example, cars, motorcycles, and even more. We used canoes, motorized or not, to transport vaccines to where the children are.
Reaching every last African child with the polio vaccine has required countless acts of extraordinary bravery.
There was an attack or bomb blast, and 1 hour after, the teams continued their work. Whatever achievement we have made, I give it to these frontline health workers. They are the heroes that have made polio eradication to be possible.
This is a story of innovation and communities coming together towards one unified goal.
It was the implementation of community-based vaccination and also the improvement of epidemiological surveillance so that we could have a proper response.
Eradication has been a truly collective effort.
This is thanks to the governments, donors, non-governmental organizations, communities, and their leaders who have been with us every step of this journey.
Today, health systems and public health programs are much stronger because of the vast investments made to eradicate polio.
The polio eradication program has a huge footprint of expertise and infrastructure. As we speak, the polio infrastructure is being used to respond to the COVID-19 response.
We must continue to protect Africa's children against all forms of polio and other childhood diseases, ensuring they are protected by immunization. And we must take the lessons learned and best practices from eradicating wild polio virus to achieve Africa's other public health goals and improve healthcare for all Africans.
Merci.
Thank you very much for this very inspirational video. As we have just seen, it shows us the incredible journey required to achieve a wild polio-free Africa. I have now the pleasure of giving the floor to Professor Rose Leakey, Chairperson of the African Regional Certification Commission for Polio Eradication, who will tell us about the essential work that this commission has carried out in order to achieve today's results. Professor Leakey, you have the floor, please.
Thank you very much, Madam Chair. I'd just like to say I have with me here our Minister of Health in Cameroon, Dr. Manauda Malashi. Thank you, yes, sir. Your Excellencies, ladies and gentlemen, distinguished guests, on behalf of the Africa Regional Certification Commission for Polio Eradication, the ARCC, I would like to thank you for inviting us to present our findings today. Let me start by a quick introduction of the ARCC members. The group includes Professor Jean Kabore, Burkina Faso, Dr. Arlene King, Canada, Dr. Mark Palanche, USA, Professor Yewale Tomori, Nigeria, Dr. Abduli Jack, Gambia, Dr. Bijan Sadizadeh, Iran, Dr. Ibrahim Akan, Mauritania, Dr. Nadumba Edward Kironde, Uganda, Dr. Raul Jorge Lopez Peru, Angola, Dr. Supame Chunsutiat, Thailand, Dr. Zakaria Maiga, Mali, Professor Bogre Kwashi, Cote d'Ivoire, Dr. Ngokana Nkomo, South Africa, Dr. Rudolf Tangerman, Germany, Professor William Bahati Matuja, Tanzania, and myself, Professor Rose Ghana Fombanleke, as chairperson from Cameroon. The dream of a polio-free world started with the landmark resolution of 1988 during the 41st World Health Assembly, when 166 member states endorsed the resolution to globally eradicate wild poliovirus by the year 2000. In 1996, at the 32nd Ordinary Session of the Organization of African Unity, OAU, heads of states and governments signed a Yaoundé Declaration in Cameroon to commit themselves to eradicate polio from Africa. It is a personal honor that as the chair of the ARCC, I am a Cameroonian speaking to you today from Yaoundé, where this historic declaration, the Yaoundé Declaration, was made. President Nelson Mandela then followed on and launched the Keep Polio Out of Africa campaign. In 1998, the Africa Regional Certification Commission for Polio Eradication, ARCC, was established by the WHO Regional Director for Africa, the late Dr. Ibrahima Malik Samba, then continued under Dr. Luis Gomez Sambo, and finally now with Dr. Machidi Somoeti. Our mandate is to oversee the certification process and serve as the only body to certify the WHO African region as free of the wild poliovirus. The ARCC is composed of 16 experts, I just named them, from 5 different WHO regions, and 2 of the commissioners, Dr. Arlene King and myself, are also members of the Global Certification Commission, the GCC. Over the past 22 years, the ARCC members have met annually and more recently 2 to 3 times a year to review the complete documentation of selected countries, as well as the annual reports of all the 47 member states of the region. In October 2018, the framework for the certification of wild poliovirus eradication was endorsed by all 47 member states at the 68th session of the WHO Regional Committee for Africa. With wild poliovirus types 2 and 3 declared to have been eradicated globally in 2015 and 2019, respectively, the last case of wild poliovirus type 1 in the African region was detected in Nigeria on August the 21st, 2016, and the last virus detected in a healthy child on the 27th of September, 2016, in the same state in Nigeria. In August 2019, the region completed one of the regional certification prerequisites by passing 3 consecutive years without detection of any wild poliovirus cases in the presence of adequate surveillance, including in high-risk areas, while achieving good routine immunization coverage. Over the years, the ARCC has been in the field in many countries to verify data and make recommendations on improvements to surveillance, immunization, and data quality in the region. These field visits, I must say, have been very helpful in giving us the confidence as we've worked towards certification. Our visits to the last 4 countries late last year and early this year were quite challenging. And in some instances, we had to travel by helicopter to verify data in insecure and inaccessible areas. On June 18, 2020, After rigorous investigation and meticulous data verification, this commission accepted the documentation of the last 4 countries in the region: Central African Republic, Nigeria, South Sudan, and Cameroon. On August 18, 2020, this commission convened to review the latest updated annual reports from all 47 countries, supporting their claim of maintaining the wild polio-free status through sustained certification standard disease surveillance and improved immunization coverage. Today, we, the members of the ARCC, having considered the criteria, conclude that indigenous wild poliovirus transmission has been interrupted in the WHO African region. On behalf of all the ARCC members, I would like to congratulate all heads of states, heads of governments, and ministers of health on this achievement. We would also like to commend all Global Polio Eradication Initiative partners and donors on their relentless efforts. This historic milestone on the path of global polio eradication would not have been possible without the support of parents and community leaders, community health workers, as well as the work of frontline health workers and polio survivors, not forgetting communities themselves. To each and every one we say thank you immensely. The ARCC would also like to pay homage to the polio heroes and champions who didn't live to see this moment, the frontline workers and staff who lost their lives in the course of carrying out polio eradication activities in the region. I also pay homage to the members of the ARCC who started with us on the certification journey, but who are no longer members today. Professor Francis Nkrumah of Ghana, Professor Amadou Di of Senegal, Dr. Beatrice Amadi, Zambia, Professor Jackson Natu of Zimbabwe, Professor Rida Tekle Haimanot of Ethiopia, Professor Mbonda Eli of Cameroon, Dr. Ocheng of Kenya, Dr. Almazru of Emro, as well as former members of the National Certification Committees, NCCs, National Polio Expert Committees, NPEC, and the National Task Force, NTF. We also remember today the late members of the ARCC, Professor Joseph Ando of Cote d'Ivoire, Professor Mafoyane of South Africa, as well as the late members of the polio committees, NCCs, NPEC, NTF, who dedicated their careers to polio eradication. And in particular today, I do remember Professor Joseph Mbidi of Cameroon. As we celebrate the certification of the interruption of wild poliovirus transmission in the region, the ARCC would, however, like to use this occasion to share our concern regarding 2 key challenges: the ongoing outbreaks of circulating vaccine-derived poliovirus, as well as the impact of the COVID-19 pandemic on surveillance, outbreak response activities, and immunization coverage. We hope that the diligent efforts of the Africa Polio Rapid Response Team, with the full support and engagement of the affected countries, will result in these outbreaks being thwarted as soon as possible, and that plans for resumption of polio eradication activities amidst the COVID-19 pandemic will be urgently crafted. To conclude, the ARCC would like to encourage member states to use the lessons learned from the polio eradication efforts to eradicate other vaccine-preventable diseases and improve on health systems across the world. Your Excellencies, ladies and gentlemen, with these remarks, it is now my pleasure and honor on behalf of the Commission to hand over the report, conclusion, and certificate to the WHO Regional Director for Africa, Dr. Machidi Somweti, concluding that today, the 25th of August, 2020, the ARCC certifies that the WHO African region has interrupted the transmission of indigenous wild polio virus. Thank you very much for your kind attention, and congratulations to all who have made this historic public health achievement a reality for us all to witness. I thank you.
What is happening? The crowd themselves like that one.
For us to take our principal, you gotta reflection, someone just
Merci infiniment, Professeur Leke.
Thank you very much, Professor Leke. Congratulations to us all. I now invite Dr. Matsidisha Mweti, WHO Regional Director for Africa, to take the floor. Dr. Mweti, you have the floor.
Your Excellency, the President of Nigeria, Mr. Muhammadu Buhari, Honorable Ministers of Health, Professor Rose Leke, the Chairperson of the African Regional Commission for Certification of Poliovirus Eradication, and esteemed Commission members, dear leaders and partners in the Global Polio Eradication Initiative, Rotary International, the US CDC, UNICEF, the Bill and Melinda Gates Foundation, and Gavi, the Vaccine Alliance, Dr. Tedros, the Director General of WHO, the US Secretary of Health and Human Services, Mr. Aliko Dangote and Mr. Bill Gates, our leaders who have so inspired and supported this movement, the WHO Regional Director for Africa Emeritus, my predecessor, Dr. Luis Gomez Sambo, distinguished health workers, polio survivors, colleagues, guests, and friends. It is among the greatest honors of my life to join you for this celebration of the eradication of wild polio virus from the 47 member states of the WHO African region. This is the second virus to be eradicated from our continent after the eradication of smallpox 40 years ago. For me personally, this is an incredible and emotional day as I stand in my late father's footprints. He was a Southern Africa member of the Global Commission that certified smallpox eradication. Little did I know when I was listening to his stories of trekking out to remote communities chasing after smallpox, that I would one day be reporting that Africa is free of wild polio virus. Today, we reap the fruits of a promise made 24 years ago by African heads of state to future generations. It has been a remarkable journey of perseverance, of innovation, and of sacrifice. At times, it was difficult to see if we would be making progress, particularly in settings of active conflict and where large numbers of people were displaced and inaccessible. In working towards this goal together, we have averted 1.8 million cases of paralysis among children, and in doing so, deployed 9 billion doses of the vaccine. My warmest congratulations to all the governments, the heads of states, the ministers and their staff, to our partners, to community leaders, to frontline health workers, polio survivors, caregivers, community volunteers, and individuals for rallying together to eradicate this virus. I pay special homage to the frontline workers who gave their lives in fighting polio. The eradication of wild polio virus from Africa is an example of what we can achieve with international solidarity. It is a vivid reminder that vaccines work and that the collective actions of communities, governments, and partners can bring about tremendous changes. This battle is not over, as our region still faces the threat of circulating vaccine-derived poliovirus type 2, or CVD-PV2, due to low immunization coverage and poor sanitation in many of our communities. Today, 16 African countries are responding to outbreaks of CVD-PV2, with some immunization campaigns postponed in the context of the COVID-19 pandemic. I thank the ministers of the countries concerned for agreeing to resume the campaigns as soon as possible. We look forward to working with you on this and ensuring safety precautions are in place to protect vaccinators and communities. In closing, the eradication of wild poliovirus from the African region reminds us of the importance of investing in universal health coverage, in preparedness and response to outbreaks, and in making our societies more equitable, particularly for the most vulnerable among us. I'd like to say a special word of thanks to His Excellency, the President of Nigeria, for having shown this remarkable leadership despite the reverses that we suffered together, and for being with us today. With these remarks, I accept the presented report, conclusion, and certificate by the Africa Regional Commission for Certification of Polio Eradication, and hereby concur and officially declare to all 47 member states that the WHO African region is certified free of wild polio virus. Congratulations and thank you all. You have truly made Africa proud. Thank you very much, Madam Chairperson.
Nous sommes tous autorisés à allumer nos micros pour applaudir.
We can all applaud, light up our microphones and applaud this momentous occasion.
Están aplaudiendo.
Congratulations, Africa.
Congratulations.
Pero han declarado erradicación.
La erradicación de la poliomielitis.
Thank you very much. Thank you very much for expressing your congratulations. Thank you very much, everyone. Thank you, Dr. Mweti. And congratulations to you for this great achievement. I would like to congratulate everybody, each and every one of you who contributed to this. Could the Secretariat please project up the certificate of eradication up on screen again so that we can truly appreciate this momentous occasion? Could we have the certificate on screen, please?
Il me plaît à présent de passer la parole au directeur général.
I now happy to give the floor to the Director General of the WHO, who is also the chair of the Polio Oversight Board. Dr. Tedros, you have the floor, please, sir.
Thank you. Thank you, my sister. Your Excellency, President Muhammad Buhari, President of Nigeria, Your Excellency, the RC Chair, Dr. Jacqueline Lydia Mikolo, and Professor Rose Lake, the Chairperson of our friend Aliko, and Bill, and my regional Moeti, Excellencies, friends, and colleagues. Today is a day of celebration and day of hope. Today, we come together to rejoice over an historic public health success, the certification of wild polio virus eradication in the African region. On behalf of the Polio Oversight Board, our partners at Rotary, CDC, UNICEF, the Bill and Melinda Gates Foundation, and Gavi, and all donors and partners, I congratulate the people and governments of Africa for your leadership and determination. Your success is the success of the world. None of us could have done this alone. The landmark achievement has only been possible because of the power of partnership, the power of solidarity. Since 1996, almost 9 billion polio vaccines have been delivered in Africa. Up to 1.8 million cases of wild polio have been averted, and up to 180,000 lives have been saved. The substantial investments we have all made in defeating polio have delivered a rich reward. And although wild polio has been driven out of Africa, those investments will continue to bear fruit for many other health needs. The Global Polio Eradication Initiative has helped to deliver vitamin A, bed nets, and deworming tablets, and support for outbreaks, including Ebola. The COVID-19 pandemic is once again demonstrating that polio staff are an essential public health workforce that can be quickly mobilized to serve the most vulnerable communities. Local health workers are the backbone of the response, but we're pleased that polio workers from WHO, UNICEF, the Polio Stop Program, and CDC have been able to support the response to COVID-19 in 36 African countries. These personnel are conducting surveillance, contact tracing, risk communication, data management, and reporting, as well as preparedness and coordination. The polio laboratory network, with 16 labs in 15 countries, is now dedicating 50% of its capacity to testing for COVID-19. Hundreds of tests are done each day using polio testing machines in Algeria, Cameroon, Cote d'Ivoire, Ethiopia, Madagascar, Nigeria, Senegal, and South Africa. The polio program continues to lead in engaging trusted voices on COVID-19, reaching and sensitizing health professionals and community influencers on the prevention and detection of COVID-19, while providing them with protective equipment and screening tools. My brothers and sisters, the end of wild polio in Africa is a great day, but as we all know, it's not the end of polio. 16 countries still face outbreaks of vaccine-derived poliovirus, and we have a hard road ahead to eradicate wild poliovirus from Afghanistan and Pakistan. As long as polio persists anywhere, it's a threat everywhere. We still have a lot of work to do to finish the job of consigning polio to the history books. We must continue to mobilize funds to strengthen health systems, especially for essential immunizations, to train health workers, to boost outreach services, and to listen to community concerns to counter misinformation. Yes, all of this costs money, but in the end, money spent eradicating polio is not a cost, it's an investment. an investment in a healthier and more productive future in which polio no longer robs children and prevents them from becoming everything they could be. A future without polio may have once seemed impossible. But in the words of Nelson Mandela, when people are determined, they can overcome anything. Thank you again. Merci beaucoup. It was such a great honor joining you, being from the same continent, from Africa. I join my sister how proud we are to see this day. Thank you so much again.
Merci, merci beaucoup, Dr.
Thank you
Tedros.
very much, Dr. Tedros. This brings us to the next part of our program, where we will hear the presidential keynote address. I have the honor to give the floor to His Excellency Muhammadu Buhari, President of the Federal Republic of Nigeria. Nigeria is the last country of the African region to have successfully eradicated and kicked out the wild polio virus. Your Excellency, President Buhari, the floor is yours.
Thank you very much. The Director General, World Health Organization and Chair Polio Oversight Board, Honorable Ministers, Senior Government Officials, Regional Director for Africa, World Health Organization, distinguished ladies and gentlemen. I am pleased to be part of this historic event to celebrate our collective achievement of wild polio virus eradication in Africa. It has been over 3 decades since the World Health Assembly passed a resolution to eradicate polio, and I am glad that the African region has finally reached this milestone. Let me acknowledge and commend my brother, President Cyril Ramaphosa of South Africa and Chairman of the African Union, under whose leadership Africa crossed the finishing line, a journey which Africa embarked on in 1996, when Nelson Mandela, of blessed memory, launched the Kick Polio Out of Africa campaign. This is indeed a truly historic event. I also congratulate Dr. Matshidiso Moeti and the World Health Organization Regional Committee for Africa for their untiring efforts, contributions, and leadership towards polio eradication in Africa. I recall that shortly after assuming office in 2015, I made a pledge to Nigerians that I would not bequeath a polio endemic country to my successor. This certification is therefore a personal fulfillment of that pledge to not only Nigerians, but to all Africans. At a time when the global community is battling with COVID-19 pandemic, this achievement strengthens my conviction that with the requisite political will, investments, and strategies, as well as citizens' commitment, will flatten the endemic curve. I can affirm the commitment of all African leaders in this course of action. We must guard this achievement of the eradication of wild polio virus in Africa jealously and ensure that we take all necessary steps to prevent a resurgence of this dreaded disease. This will require maintaining the highest quality of surveillance and sustaining population immunity through increasing routine immunization coverage and supplemental immunization activities. It is heartwarming to note how the strong partnership between the Global Polio Eradication Initiative and governments of African countries work tirelessly and collaboratively to deliver this success. Let me assure the global community that Nigeria will sustain the momentum and leverage on the lessons learned from polio eradication to strengthen our health system, especially primary health care, and prioritize health security. We use data systems, community engagement, and innovative technology to monitor and predict the occurrence of polio outbreaks. These same skills and tools are being used to fight COVID-19 and the multi-country outbreaks of circulating vaccine-derived polio viruses. I would like now to commend the dedicates of hard work and resilience of health workers and volunteers across the region, ministers of health and other stakeholders, such as political, traditional, religious, and community leaders who provided the required support and leadership. I would also like to appreciate the invaluable support of our donors, development and local partners, such as World Health Organization, UNICEF, Rotary International, Bill and Melinda Gates Foundation, Aliko Dangote Foundation, United States Center for Disease Control and Prevention, Gavi, USAID, European Union, Emeka Ofo Foundation, the Japanese and German government, numerous NGOs, and faith-based organizations. These are truly the heroes and heroines of many battles that have made us triumphant in the war against polio. Finally, I congratulate our African brothers and indeed the global community and urge us not to relent in our efforts, because the hard work to sustain the success requires even more dedication. We must continue to vaccinate our children because vaccines save lives. We must continue to invest in our health systems because healthy populations create wealthy nations. We must continue to build trust between government institutions, leaders, and citizens so that we can unite as a people and confront the health and socio-economic challenges we face together. Thank you, and God bless Africa.
Merci, Excellence.
Thank you so much, Your Excellency. Honorable President of the Federal Republic of the Nigeria. We were very inspired by your speech, ladies and gentlemen, ministers, heads of delegation. It is now time for us to hear from some of our key partners in the fight against Poland. The Global Polio Eradication Initiative leadership will present to you their statements during this section of the session. Let us start with two representatives of Rotary International. I would like to invite Mr. Holger Kanak, President of Rotary International, and Dr. Tunji Funcho, Chairman of the Nigeria National Polio Plus Committee, to take the floor. You have the floor, sirs.
Thank you, Chair Mikolo. Let's be honest. In the face of the pandemic, the world did not have much good news to celebrate in global health this year, and the challenges ahead are formidable. That's why we must recognize this great achievement and commend all of the people who played important roles in reaching out this milestone. It took tremendous effort over many years. Rotary and our partners began this mission more than 2 decades ago when we joined with Nelson Mandela to begin the work of eradicating the wild polio virus in the African region. Mandela inspired us all, and his support for this effort energized African nations and leaders across the continent to step up their efforts to reach every child with polio vaccine. And step up we did. To all our Rotary members, thank you for your continued support and dedication. We know this hasn't been easy, and there are still work to be done before we can fulfill our promise of a polio-free world. But you have helped achieve something remarkable. Rotarians have raised funds for polio eradication, advocated with world governments and local national leaders, held events and fundraisers for World Polio Day, and raised awareness of polio eradication. The dedication of Rotary members as part of our polio program has been central to the fight to end polio, and will remain committed until the end. And now I will turn over to Nigeria National Polio Plus Committee Chair, Dr. Tunji Funjo.
Thank you, President Holger. For more than 3 decades, Rotary members have been fully invested in polio eradication and have played an instrumental role in protecting children in the African region, from providing polio pluses such as soap and health kits, along with oral polio vaccine in camps for internally displaced persons in Borno State, to giving polio immunization during Health Day across Ghana, Nigeria, South Africa, and Uganda. Rotary members have shown resilience, persistence, and steadfast dedication to our top priority of ending polio. But we did not accomplish this alone. Tens of thousands of health workers have dedicated their lives to fighting polio throughout Africa. Thank you for your hard work. You have served as trusted voices in your communities and protected hundreds of millions of children from paralysis. Today's announcement is a big step in our journey to a polio-free world. But the fight is not over yet. We still need the support of our Rotary members, donors, and the heroic efforts of our healthcare workers to finish the job and eradicate the wild polio virus in every region of the world. There is one more big celebration to come, when we eradicate the wild polio for good. We need your energy, tenacity, and commitment to protect children worldwide and rid the world forever of this terrible virus. Let us continue to work together to make polio a disease of the past. Thank you.
And it was showing signs. We thought it was internet.
I'll say that again.
Yes, you can, please.
For more than 3 decades, Rotary members have been fully invested in polio eradication and have played an instrumental role in protecting children in the African region. From providing polio pluses such as soap and health kits, along with oral polio vaccine in camps for internally displaced persons in Borno State, to giving polio immunization during family health days across Ghana, Nigeria, South Africa, and Uganda. Rotary members have shown resilience, persistence, and steadfast dedication to our top priority of ending polio. But we did not accomplish this alone. Tens of thousands of health workers have dedicated their lives to fighting polio throughout Africa. Thank you for your hard work. You have served as trusted voices in your communities to protect hundreds of millions of children from paralysis. Today's announcement is a big step in our journey to a polio-free world. But the fight is not yet over. We still need the support of our Rotary members, donors, and the heroic efforts of our healthcare workers to finish the job and eradicate the wild polio virus in every region of the world. There is one big celebration to come when we eradicate wild polio for good. We need your energy, tenacity, and commitment to protect children worldwide and rid the world forever of this terrible virus. Let us continue to work together to make polio a disease of the past. Thank you.
Merci, Monsieur Nag.
Thank you, Mr. Nag and Dr. Funsho. The role of Rotary International has been crucial in this endeavor to fight polio. I now have the pleasure to pass the floor to Madame Henrietta Fore, Executive Director of UNICEF. Madame Fore, you have the floor, please.
Thank you very much. It is an honor to join you today. We are certainly marking a special achievement for the people of Africa. The official end of wild polio in 47 African countries. This wonderful milestone happened because of the commitment and dedication and investment of the people joining in this event today. But it also happened because of the thousands of health workers, vaccinators, and logistics personnel who delivered the vaccines to more than 220 million children under the age of 5. It happened because of community volunteers and workers who visited parents and caregivers to build trust in these life-saving interventions. It happened because so many trusted local voices helped to spread the word. Community leaders, village elders, religious teachers, tribal leaders, polio survivors, students and teachers, journalists and radio broadcasters, all working together to spread the word, to stop the spread. And most of all, it happened because of mothers, fathers, and caregivers who listened to these voices. Children cannot get immunized without the support of parents and caregivers. So thank you to parents and caregivers who said yes when a vaccinator knocked on their doors. But our work is not yet done. While we've won the battle against wild polio in Africa, we need to build on our progress so far to win the war against all forms of polio virus on the continent. We must use the networks and pathways that we have created to deliver polio vaccines to continue the fight against other outbreaks like malaria and Ebola and measles. And to do so as we address a new threat, the COVID-19 pandemic, a global health emergency that not only threatens people's lives, it threatens to interrupt our work to deliver the polio vaccine and so many other life-saving interventions in Africa. But as we look for guidance, we can look to the spirit of Madiba. When he launched the Kick Polio Out of Africa campaign in 1996, the challenge seemed insurmountable. And now, 24 years later, we've proven that a polio-free Africa is within our grasp, that people can come together across the continent, from villages and towns and cities, to defeat a deadly disease. As we face COVID-19, we are summoning the same spirit. We've seen the very polio workers and networks that we've built together responding to the COVID-19 pandemic in Nigeria and many other countries. Together, let's reveal once again the power of African unity to gather people around a common goal and to build a better, healthier, brighter future for children and families across the continent. On behalf of the entire UNICEF family, congratulations to Africa and to the people of Africa on this milestone. We are very proud to be with you on this historic day. Thank you.
Merci infiniment, Madame Faure.
Thank you so much, Madame Faure. It is now my pleasure and my honor to give the floor to Alex Azar, the United States Secretary of Health and Human Services. He will be followed by Dr. Robert Redfield, Director of the United States Centers for Disease Control and Prevention. Secretary Azar and Dr. Redfield will be giving you their remarks through pre-recorded videos.
As U.S. Secretary of Health and Human Services, and on behalf of the entire United States government, I want to congratulate all African nations on the continent's eradication of wild polio. This milestone is a testament to the tireless work of African governments, the Global Polio Eradication Initiative and its partners, and community, traditional leaders, healthcare workers. As the world's largest bilateral global health donor, the United States has been a leading supporter of polio eradication efforts, and that commitment will continue. I especially want to commend the political and technical partners who made this achievement possible. We saw this renewed political commitment in Nigeria quite clearly when President Buhari personally gave one of his grandchildren vaccine drops. I also want to thank the many frontline healthcare workers who work tirelessly to vaccinate children and protect them from this terrible disease, often while working in difficult or dangerous conditions. I met and thanked many African health leaders and workers in the Democratic Republic of the Congo, Uganda, and Rwanda last year, where they were combating the Ebola outbreak while still working to deliver important childhood vaccines. On that trip, I emphasized America's commitment to strengthening Africa's health capacity. During COVID-19, we have seen many African nations demonstrate their impressive and growing public health capabilities. Even as much work remains, today is a historic day for global health, and it's a cause for celebration for everyone who works to improve Africans' health. Congratulations to everyone who helped make it possible. With that, I will hand things over to CDC Director Robert Redfield.
Today, we celebrate Africa's incredible public health achievement, interrupting wild polio virus transmission. On World Health Day in 1995, Nelson Mandela announced that South Africa would put its efforts behind achieving a world without polio. A year later, he launched the Kick Polio Out of Africa campaign. Today, that goal has been achieved. This milestone marks a huge step forward on the road to global polio eradication. Over 90% of the world is free from wild-type polio today. But the work is not done. To sustain this progress, each country must maintain high levels of protection against polio virus through vaccination. We know and have seen that wild-type polio importations can occur in any country. And while the virus is still circulating in endemic countries, the world remains at risk. An urgent charge now for Africa is to rapidly stop circulation of vaccine-derived polio virus outbreaks. For over 30 years, CDC has worked with countries and partners to eliminate polio in Africa. In December 2011, CDC activated its Emergency Operations Center to strengthen the agency's partnership engagement through the Global Polio Eradication Initiative. CDC has intensely focused on key priority areas to help reach this milestone, providing leadership and support for quality polio surveillance in the African region,
serving as one of the 6 global polio special reference laboratories and being on the forefront of developing new diagnostic tests, introducing technology in the field to rapidly diagnose and respond to polio cases and outbreaks, providing scientific and technical guidance through the participation in the polio technical advisory groups for the Africa region and around the world, and strengthening the ability to detect and respond to the polio virus through CDC's flagship Stop Transmission of Polio, or STOP program. This moment is Africa's to celebrate and to savor, and I want you to know that CDC stands with you today until the day that polio is finally eradicated. The polio program has already created many public health legacies, which are being used to jumpstart critical surveillance and diagnostic efforts against other global health threats like Ebola, measles, and most recently, COVID-19. Polio workers and resources are playing an important role in the fight against COVID-19 and providing critical support to protect communities. I offer my sincere congratulations to all the nations in Africa and their leaders for their achievement in eliminating wild polio virus from their country and together across the continent. You have demonstrated how much can be achieved when determination, partnership, and resources come together, no matter the circumstances. The end of polio is closer today because we have all believed in seeing the possible.
Merci beaucoup.
Thank you very much to Secretary Azar and Dr. Reedfield of the US CDC. I will now give the floor to Dr. Christopher Elias, President of the Global Development Division of the Bill and Melinda Gates Foundation, a foundation that was another key partner for the African continent in the eradication of polio. Dr. Elias, you have the floor, sir.
Thank you, Minister Makolo. It's a pleasure to be with you and Dr. Moeti and everyone else who's joining us from around the world today. Personally, I'm thrilled to participate in this historic event and want to begin by congratulating every country in the WHO African region for achieving wild polio-free certification. The progress made against wild poliovirus is a testament to your government's unwavering commitment to reaching every child with vaccines. It's also a powerful reminder of the importance of partnership and innovation in achieving global health triumphs such as this one. Today would not have been possible without the collaboration of governments, donors, health workers, traditional and religious leaders, NGOs, and the media, among countless others. I also want to recognize the work of the Global Polio Eradication Initiative in coordinating this incredible partnership. From the work of UNICEF in procuring vaccines and mobilizing communities, to Rotarians for their unwavering advocacy, for WHO and CDC for their technical and operational leadership, to Gavi for its work in financing and procurement of injectable polio vaccines, and to the work of national governments across the region for enabling accountability and demonstrating political will. But as you've heard, the work is not finished. This partnership is so important to tackling the critical risks that remain, keeping children safe from any importation of wild poliovirus, and finishing the job of eliminating circulating vaccine-derived polioviruses. We have a partnership and a strategy that works, and it will be critical that we use all of the tools and energy to make these remaining tasks, especially eliminating circulating vaccine-derived polioviruses, a thing of the past, and to do so as fast as we can. Innovation and ingenuity are also key characteristics of this program. There are so many examples. I especially like Avidar, a simple app created by the program on mobile phones and put into the hands of trained community volunteers, which allows them to report possible polio cases to the ministries of health in several countries across the region, cases that might otherwise have been missed. It's also hard to believe that just a decade ago in our fight to end polio, many health workers were using hand-drawn maps to identify settlements as part of their micro-planning for immunization campaigns. Now, with geographic information systems technology, health workers can reach more children with some of the most accurate and detailed maps in Africa. Similarly, many countries have been pioneers in the establishment of emergency operation centers. These have served us well in the final step to polio, but also in the fight against Ebola and today against COVID-19. We have the partnership, the tested strategies, the technology, and the steadfast commitment and political will to wipe polio off the map once and for all. We at the Bill and Melinda Gates Foundation are immensely proud to be your partners in this important work now and in the days to come. Thank you.
Merci beaucoup, Dr.
Thank you very much, Dr. Elias. And now we will be watching a pre-recorded video of Dr. Seth Berkley, as CEO of Gavi, the Vaccine Alliance. In celebration then of this very important landmark, we will now be watching the pre-recorded video.
Echo the previous speakers and congratulate the countries of the African region, including the legions of health and community workers, all levels of government, and the communities themselves for this momentous achievement. And yet today's celebration must be tempered by the expanding scope of outbreaks of vaccine-derived polio and the broader impact related to COVID-19. There is mounting evidence that the COVID-19 pandemic has had an unprecedented negative effect on primary healthcare systems, including the coverage of essential vaccines. And it's estimated that 80 million infants are at risk globally of getting common infectious diseases, many of which are vaccine preventable. Research underlines the disproportionate impact that COVID-19 can have on disadvantaged communities in low-income settings, the same communities that have fought so hard to rid themselves of wild polio virus and are now struggling to get ahead of vaccine-derived polio outbreaks. Equity and the need to reach these zero-dose and under-immunized children remain two of Gavi's key priorities for its next 5-year period. And the achievement of wild polio virus eradication in Africa can and should serve to re-energize and innovate our approaches to primary health care and comprehensive immunization delivery. In the wake of the pandemic, seeking programmatic and financial efficiencies through integrated service delivery and comprehensive vaccine preventable disease surveillance is more urgent than ever as we consider the sustainability of our achievements. Gavi, the Vaccine Alliance, is fully committed to working with countries to build and sustain the systems necessary to ensure that no one is left behind. We rely on the leadership of governments at the national and local levels, national programs, and the technical expertise of our partners to turn adversity and challenges into opportunities. The significant achievement strengthens our collective resolve and commitment to continue to improve and build the systems that are required now more than ever to not only stop circulation of all forms of the polio virus, but also of measles, yellow fever, pneumonia, and diarrheal diseases that continue to cause significant morbidity and mortality in Africa and other parts of the world. Thank you so much for all that you do, and thank you for listening.
Thank you very much to Gavi, the Vaccine Alliance, for this video. And this brings us to the end of the remarks by the GPEI leadership, that is the Global Polio Eradication Initiative leadership. Honorable ministers, distinguished guests, ladies and gentlemen, we will now move on to the next segment of our agenda. during which two key partners will discuss how to continue investing in immunization and public health so that the continent remains free of wild poliovirus and other infectious diseases. I am honored to now give the floor to Mr. Alhaji Aliko Dangote, the Chief Executive of Dangote Industries Limited and Chairman of the Aliko Dangote Foundation, and also Mr. Bill Gates, Co-Chair of the Bill and Melinda Gates Foundation. We will begin with Mr. Dangote. Mr. Dangote, you have the floor, please.
Thank you for inviting me. This is a great day for Africa and the world, and I'm happy to witness the end of a scourge that has brought untold hardship on humanity. I want to commend our African leaders, especially my own President, Muhammadu Buhari of Nigeria, for his leadership. All levels of government have successfully come together to make this day possible. And much thanks to Bill, who has been a tremendous partner. He has helped us in this push to get rid of polio for many years now. I'm grateful for his support. The onus is on us to continue to push forward until polio in all its forms is gone forever. I have been in business a long time, and perhaps the most critical lesson I have learned over the years is that a country or continent's most valuable resources is always its people. Africa's young people will drive our continent's future success. It is our duty as leaders to invest now in their health and well-being. That is why I started my foundation in 1994 and why I've been pushing to eradicate polio across Africa for many years, because nothing is more important than the health of our children. Ending world polio in Africa is a giant leap forward. We have shown that if we stay clear-eyed and committed to a goal, we can get results. We must always be tenacious to get where we want to go. I know Bill understands that too. We need to apply the same mindset on public health across Africa, beginning with us here today. So let's take this opportunity to reenact our commitment. One, we will end circulating vaccine-derived type 2 virus here as we have ended wild polio. So long as children are paralyzed, our job is not done. We will end other communicable diseases in Africa, including COVID-19. We will also help every man, woman, and child live a healthy life. There is no better time than now. We must be dedicated to this fight and make the sustained investment in immunizations, medical workers, and public health that will make a difference. We must also make a sustained political commitment until the job is done, that we will achieve this goal, and that we will hold ourselves accountable for the results, whether good or bad. I also pledge to continue helping in any way. I also continue helping in this fight in any way I can. I believe the private sector and government are natural partners. So congratulations to all of us. Today we celebrate, and tomorrow we get back to work. I now have the great pleasure to hand over the microphone to my partner, my friend in this polio fight, Mr. Bill Gates. Bill, it's over to you.
Hello, everyone, and thanks for including me in this important celebration. I'm honored to speak today and to appear with Aliko Dangote, who's been integral to the success of this huge public health effort. Aliko and I became friends as soon as we met. Since then, we've had a chance to travel together across Nigeria and Chad several times to support our joint work on polio eradication. We've had meetings with ministers, traditional leaders. We've visited health clinics and surveillance sites and put in some long days. And I know he's as delighted as I am that we've reached this critical milestone. 30 years ago, more than 40 people worldwide contracted polio every hour. Even in 1996, wild polio paralyzed more than 75,000 children across Africa. Today, wild polio in Africa is gone. This is an historic milestone and a public health triumph for Africa, one that has and will continue to pay dividends in the fights against diseases like Ebola and COVID-19. We're not done yet, of course. Now more than ever, it's important to protect the progress we've made. We still have to beat wild polio in Pakistan and Afghanistan, because until polio is gone everywhere, it can still return. And the global polio program has to contend with another less common type of polio, CVDPV. These viruses continue to spread in a number of countries, mostly in Africa, and require coordinated efforts and financial support to end them too. But let's be clear, today is an amazing achievement that is going to mean a world of good for the children of Africa. I think of the kids I met in Lagos with routine immunization now t-shirts and in clinics in Sokoto and Abuja. They are that much closer to a world without polio. There was nothing inevitable about this moment. If African nations hadn't come together to stop outbreaks across the continent and reach millions of children who had never been immunized, wild polio would still be a huge issue. We're here today because all of you and many more work together to end this disease. We're here today because of the hard work, commitment, and coordination of millions of people across Africa, political, traditional and religious leaders, donors, and public health advocates, organizations like Rotary, frontline health workers, and communities who worked to see every child vaccinated. It also took significant money and other resources. Staying wild polio free and stopping CVDPV will mean continuing to invest in polio immunization campaigns and infrastructure. African governments will need to provide political and financial support to ensure that eradicating polio remains a top priority. But the value of these efforts, immunization campaigns, disease surveillance, social mobilization, and outbreak response, is incalculable. They've not only helped us beat wild polio, they have also built a stronger public health infrastructure across Africa, one that has helped fight Ebola and is playing a critical role against COVID-19. The COVID-19 pandemic is testing Africa and the world. We must find ways to both beat the virus and make sure we don't backslide on all our progress against polio and other diseases. It's going to be tough, but I'm confident we will prevail if strong immunization programs continue and improve in the many places where they remain weak. And that's why I think it's important today we are acknowledging this remarkable milestone. Africa is now free of wild polio because so many leaders and partners came together to defeat it. Country governments must continue to invest in public health, support the frontline workers, stay vigilant against outbreaks, and most importantly, work together. With the commitment of the international community, I'm confident we can make all forms of polio everywhere and COVID-19 things of the past. When we work together and stay committed, we can achieve amazing things. Today is proof of that fact. Thank you and congratulations.
Merci infiniment.
Thank you very, very much, Mr. Gates and Mr. Dangote, for your remarks. for being here with us today, for your generous contributions, and for the work championing wild polio eradication over the years. And thank you all, distinguished guests, for your invaluable contributions and tireless commitment. It is thanks to you all that we are celebrating this remarkable achievement today. But we could not conclude our special event without listening to someone that has personally experienced living with the wild polio virus, that today was certified to have been eradicated from the African region. I have the honor to give the floor to Senator Kipchumba from Kenya, a polio survivor and a longtime advocate for wild polio eradication. Senator Kipchumba, the floor is now yours. You have the floor, sir.
Thank you. Thank you, the Honorable Madam Chair, Your Excellency, distinguished guests, ladies and gentlemen. It is a great honor to be joining you today in celebrating a wild polio-free Africa. At the age of 4, what my mother thought was a normal malaise turned out to be a lifetime journey of pain and suffering. Yes, they diagnosed me with polio, which has no cure. No reason or excuse was spared to explain my illness. Even my parents were blamed. I wish the certification of wild polio virus eradication in Africa region had taken place 55 years ago. I could have lived to my fullest potential. I could have become the Army General that I dreamt to be. As a child, I missed the fun of growing up, running around, playing, and attending the nearest school in my village, which was 8 miles away. As a teenager, I was always one left behind by peers when they went for adventures and hikes on the beautiful hills and valleys of Baringo. Found peace when I accepted my predicament and the fact that I have survived with a permanent disability. Sadly, fear gripped me when I learned that children were still getting infected and dying of polio and other vaccine-preventable diseases in this time and age, despite having a safe and effective vaccine. In 2013, Kenya had a new polio outbreak and 14 people were paralyzed. Most of them were children. I decided to be part of the solution with the dream of having polio eradicated globally in my lifetime. I mobilized polio survivors in all their diversity to put a face to this disease and to share our stories. We reached out to parents, caregivers, cultural and religious leaders, NGOs, health workers, development partners and governments through community engagements, mass media, meetings, campaigns and lobbying. Sometimes there was opposition, but we strived on. To leaders, our call was loud and clear. Immunization is not a choice. It is a right and a responsibility. To parents and caregivers, we pleaded that no child should undergo our pain. Never and never again. With this certification, I hope we will not close our eyes or turn away from Africa's primary health challenges. With COVID-19, we can easily lose our gains if we don't stay vigilant. we must not take our foot off the pedal. We need to strengthen routine immunization programs, enhance community engagements, improve disease surveillance, upscale mechanisms for emergency response, and resume vaccination campaigns. On this special day, I want to thank my family, my parents, my wife and children for their support through the years. I also greatly appreciate the role that the WHO, UNICEF, USAID, and the UN family, the Global Polio Eradication Initiative's partners have played, and the generous support of all donors and individuals. Thank you, the Dangote Foundation and Bill and Melinda Gates Foundations for having invested in health and leaving a footprint in humanity. Thank you for the commitment today. COVID-19 has complicated healthcare and daily life for millions. I plead to all public health leaders listening to me today to continue working on the provision of essential healthcare services uninterrupted and a vaccine developed in the shortest time possible. I want to appreciate COVID-19 has brought the reality that vaccines are important and everybody wishes there's one for COVID. But there's always vaccines every day for our children, and some do not take it serious. I call upon governments to prioritize immunization. Today, on behalf of the millions of voiceless Africa's children and polio survivors, I wish to propose a vote of thanks. I would like to thank all parents, volunteers, communities, and religious leaders, frontline health workers, health authorities, and heads of state of each of the 47 countries in the WHO African region who have worked collectively as one team to kick wild polio out of Africa. Thank you all. Asante sana.
Merci beaucoup. Merci beaucoup.
Thank you very much, Senator Kipchumba. It was a real pleasure to listen to your testimony. This brings us to the end of the special event for the celebration of the certification of wild poliovirus eradication in the African region. We would like to thank His Excellency President Buhari for having honored us with his presence. Honorable delegates, distinguished guests, ladies and gentlemen, our dear donors, thank you. With a great deal of emotion, I would like to thank you all, and I would like to say huge congratulations on achieving this milestone. Once again, I think we can light up our microphones and applaud our achievements. This achievement which has signaled the end of poliovirus eradication. Thank you very much, and a huge congratulations to all.
Thank you. Thank you. Thank you.
Thank you. Thank you. Thank you.
Congratulations.
Thank you. Thank you.
Thank you from South Sudan. Thank you from South Sudan.
Nous allons profiter.
Merci.
Nous allons maintenant profiter d'une pause de 5 minutes.
We can now have a 5-minute break, which will enable us to prepare for the next session, which is the closure ceremony. We are ahead of time. We will begin our closure perhaps 10 or 15 minutes ahead of time. And I think that we can really congratulate ourselves on our achievements. And this will really help us to deal with the health situation in our countries. So we are going to resume at 17:55 Brazzaville time. 45, I'm sorry.
Okay, no. What to do? What shall I do? Straight like this. Oh, I'm so happy this RC is coming to an end. Okay, yang harisa so. It's still flickering. It's still flickering. I mean, it looks better. Oops. Oh my goodness.
Thank you, Dr. Moiti. This is South Sudan. We are ever so grateful. You've done great today, all day. That was wonderful. Thank you.
Okay, thank you. Thank you very much, Minister. And congratulations to everybody. Congratulations to you, to everyone. It's such a great moment for all of us. It's amazing. Thank you.
Wonderful leadership from your side. The whole team from South Sudan is celebrating. The Minister of Health is representing the people of South Sudan on the achievements, and it is your leadership. You've done well. We've been with you throughout the day, and you've done well. Thank you.
Thank you. Thanks
Thank you.
very much.
Asante sana, they say.
Asante, Minister. Thank you.
Raise our hand. You can just stop. The microphone is on. You can just stop.
Congratulations. Congratulations, Africa. Congratulations, my sister. Congratulations. Congrats.
And thank you for all your support for Nigeria. We are very grateful. This is Ngozi Azoro representing the Minister of Health of Nigeria. Congratulations. It's a great day to be an African.
Okay, congrats, Nigeria. You kept going until the end.
Thank you. Thank you.
Congratulations, Dr. Moiti. Congratulations from Angola.
Oh, hi, Minister.
How are you? How are you? You have done a great job.
No, it's your job. It's your job.
It's our job.
Congratulations
from Liberia.
Hi, Minister, too. So great to see everybody. It's wonderful. Well done.
Buenas tardes, Dr. Moiti. Congratulations.
Oh, Minister Diosdado. Thanks a lot. Welcome.
Big day for all of us. Thanks to you. Thanks to Dr. Campbell who was so there beside you.
Well done, everybody. You did great. Everybody.
Congratulations to Malawi.
Wonderful. Thank you. Congratulations to you too.
Thank you. Thank you.
Parabéns, Cabo Verde.
Ah, Cabo Verde, tudo bem.
Oh, Malawi. Oh, I see.
I was congratulating you and also extending my greeting to Dr. Sambo, whom I saw there. This is a big day, big day. You have done a good job, wonderful job. Thanks for all our children. They are thankful to you, to Dr. Tedros, to Dr. Sambo, Moneko, to Dr. Samba. All you have really worked for to see this great day.
Indeed, it's amazing.
Congratulations.
I'm lucky to be the one here when finally their hard work's fruition comes to pass. Really wonderful. That's great.
Congratulations from Eritrea. Thank you for your dedicated leadership, Dr. Miotti.
Thank you. Thank you so much. So great, Eritrea. Thank you very much. I appreciate it.
Welcome.
Senegal. Zimbabwe. Hey, Zimbabwe.
Hi. Yeah. Well, congratulations. Africa must be proud today and your leadership, Dr. Moeti. Thank you very much.
Oh, no, I'm very proud of Africa for the persistence. It was not easy. It really was not easy, but it's a great day, a huge achievement, really.
Oh, oui. Félicitations, Madame la directrice régionale. C'est Dr Abaché, secrétaire général du ministère de la Santé publique du Niger. Toutes nos félicitations.
Merci, merci. Bon, c'est félicitations à vous.
Merci.
On fait le travail dur. Ah, je me rappelle au Niger.
OK.
À travers, OK. Merci.
Félicitations, Dr Abaché du Niger.
Oui, c'est bien lui.
Félicitations. C'est moi, Bolaji du Nigeria.
Ah, mon frère.
L'ancien poste vocal du Nigeria.
Comment ça va?
Ça va bien, merci.
Merci beaucoup. Toutes nos félicitations. Congratulations.
Félicitations. C'est une bonne journée pour l'Afrique.
Merci beaucoup.
Yeah, c'est une bonne journée.
Merci à vous aussi.
The screen. If I take it, show me holding camera. So take it and send me.
Okay.
Félicitations, Madame Wiki. Félicitations, Madame Wiki.
Merci beaucoup. Félicitations à vous, plutôt. C'est vous qui en faites du travail. Merci beaucoup.
Oui, c'est toute la population.
Merci.
Muito obrigado.
Tenez un principe.
Merci beaucoup.
I wish you can kick out poverty like this. Poverty, illiteracy, malaria, COVID-19. It's not. It's a goal. I wish we can kick out poverty, malaria. You know, everything takes dream.
Congratulations, Dr. Maiti.
Thank you very much. Congratulations to you, ministers, and your staff, really, and our national leaders. Wonderful. Thank